Diagnostic assessment is simply figuring out your starting line. It's not a test to grade you, but rather a snapshot of where you are right now. We analyze what you already know and identify the specific areas that need the most attention. This initial phase helps us move past general assumptions about your ability level. Our goal here is clarity, knowing exactly what skills we need to build upon. Think of this stage like a detailed physical checkup before training for a marathon. We aren't just checking if you can run, we are mapping out your endurance, identifying weak joints, and pinpointing areas that require specific strengthening exercises. This thoroughness ensures our entire learning plan is perfectly tailored to your needs. Here are 5 examples. The Tell Me About prompt, using an open-ended topic to assess fluency and vocabulary range. Speaking fluency assessment. When we ask you to speak about a personal topic, we are observing how naturally you connect ideas without hesitation. We aren't grading the content of your story. Rather, we are measuring the speed at which you can recall appropriate vocabulary and sentence structures under pressure. Timed writing task, drafting an email or short summary on a given professional scenario. Written production skill. This exercise helps us gauge your ability to organize complex thoughts into clear written English. We look at things like formal tone register and grammatical accuracy when conveying specific messages, which are vital for academic or workplace contexts. Grammar gap fill exercise, completing sentences focusing on tenses or prepositions. Structural accuracy. These quick exercises pinpoint specific grammatical weaknesses that might be holding back your overall fluency. Identifying these small structural gaps allows us to dedicate focused, targeted lessons rather than simply reviewing grammar generally. Listening comprehension quiz, following directions or understanding a detailed narrative. Receptive skills. This tests your ability to process spoken English at natural speed. We analyze whether you are missing key details because the accent is unfamiliar, or if you simply need more practice decoding fast speech. Role-play simulation, handling a difficult conversation, e.g., negotiating, making complaints. Pragmatic competence. This is perhaps the most realistic assessment because it measures your ability to navigate social situations using English. We evaluate not just what you say, but how appropriately and effectively you communicate intent. Here are 3 reasons why this matters. Maximizes learning efficiency. We eliminate wasting time on concepts you already master. By knowing your baseline, we skip the basics and jump straight into the material that will provide the greatest return on your study effort. This ensures every lesson is as productive as possible. Builds confidence through success. Focusing on attainable goals prevents frustration. When learning, failure can be highly demoralizing. By setting goals that are slightly challenging but achievable, we ensure you experience consistent small wins, which is the ultimate builder of long-term confidence. Provides clear motivation. Having a defined target keeps your focus and commitment strong. Goals give purpose to the struggle. Instead of just learning English, you will be working towards something specific, like passing that certifications or leading a presentation in my native language. That concrete objective fuels motivation. Let's explore the topic of Phase 1, diagnostic and target setting. This is an important concept to understand for learning English effectively. This is a foundational concept when learning English. Understanding Phase 1, diagnostic and target setting deeply will unlock many other areas of the language. Think about how often you encounter this in real life and try to notice it in the English you hear every day. The more you engage with this idea, the more natural it will feel. Here are 4 ways to practice. Journaling key vocab. Every day, write down 3 new words and how you plan to use them immediately. This simple habit forces active retrieval of information. Don't just list the word, write a full sentence using it in context. This moves vocabulary from passive recognition into usable memory. Shadowing native speakers. Listen to podcasts or videos and repeat exactly what you hear, mimicking the rhythm and intonation. This process, called shadowing, is excellent for improving pronunciation and sounding more natural. You are essentially training your mouth muscles to produce sounds that might feel unfamiliar yet sound normal. The teach it method. Try explaining a complex concept like quantum physics or cooking entirely in English. If you can teach it, you truly know it. Using the teach it method forces you to structure your thoughts logically and retrieve detailed language under simulated pressure. It's one of the best ways to identify knowledge gaps. Peer feedback exchange. Exchange writing or speaking tasks with a trusted study partner for objective criticism. Receiving feedback from others helped you develop an external ear, which is crucial. You start to notice your own patterns of speech, like repeating the same grammatical error that you might otherwise overlook. Achieving Band 7 or higher means moving beyond simply understanding English. It requires mastering the specific discourse conventions of academic medicine. This is a shift from general fluency to highly specialized communication. We are focusing on how language functions within complex arguments, such as explaining pathophysiology or reviewing clinical trials. It involves using appropriate register changes and maintaining extreme coherence across long pieces of writing and speaking. Think of it this way: Band 7+ isn't about knowing more words. It's about deploying the right words in the right context with surgical precision. We are building a framework that allows you to write like an expert who has been immersed in medical literature. Here are 5 examples. Advanced vocabulary and collocations. Precision in language. Do not just memorize definitions. Instead, focus on collocations, the words that naturally go together. For example, instead of saying strong evidence, you should aim for the more academic pairing like compelling datas or robust findings. This instantly elevates your writing quality. Syntactic complexity. Sentence structure. This involves using sophisticated sentence structures, such as inversion or nominalization. Rather than keeping sentences simple and direct, we will teach you how to weave together multiple ideas into one grammatically rich statement. Academic register shift. Formal tone. The biggest hurdle for many students is maintaining a formal, objective academic voice. We must eliminate colloquialisms and personal pronouns that undermine the professional distance required in medical reports. Cohesive linking devices. Flow and connection. These devices are more than just however or therefore. They are intellectual signposts that guide the reader through your logic. Mastering them ensures that your argument reads as a unified, seamless piece of thought. Discursive argumentation. Developing viewpoints. This means you can take a complex medical problem and argue multiple sides presenting counter-arguments before refuting them. It's the skill of intellectual debate articulated through impeccable English. The core of high-level academic writing is the structured argument. This means every paragraph must adhere to a clear topic sentence, evidence, analysis model. You start with a definitive statement that guides the reader, follow it immediately with supporting data or literature, and then dedicate sufficient space to analyzing how that data supports your initial claim. It is crucial to avoid simply describing information. You must interpret it. Instead of stating, "The study showed X," you should analyze, "This finding suggests a potential mechanism for Y because." This shift from reporting facts to critically evaluating them is what separates Band 6 from Band 7 and above. Remember that analysis requires careful signposting. Use phrases like "consequently" or "this evidence strongly implies" to show the reader how you are moving from a piece of data to your expert conclusion. Treat every paragraph as a mini-essay supporting one central idea. Let's compare 4 pairs. Band 7 proficiency. Band 8 proficiency. Level of sophistication. While Band 7 shows strong command, Band 8 and above demonstrate near-native fluency with remarkable intellectual sophistication. It means your language doesn't just convey meaning, it enhances the argument itself. General academic writing. Medical report writing. Contextual focus. Academic writing is broad, but medical report writing demands specific jargon and a highly objective tone. You must be prepared to drop general English and immediately adopt the precise lexicon of your specialty. Vocabulary recall. Contextual application. Usage versus knowing. It is one thing to know 4 synonyms for inflammation. It is entirely different and much harder to use the correct synonym in a sentence that matches the appropriate medical register. Focus on application over mere memorization. Simple explanation. Nuanced discussion. Depth of thought. Don't settle for surface-level explanations. When discussing a condition, you must be able to explore its underlying mechanisms and implications. This requires complex sentence structures and precise causal linking. Here are 4 ways to practice. Start a specialized vocabulary journal. Record new terms and their collocations. When you read a medical journal article, don't just underline unknown words. Write down the entire phrase or sentence they were used in. This helps your brain internalize the natural usage pattern. Daily expository summaries. Summarize complex topics orally. Choose a challenging topic, like metabolic syndrome, and record yourself summarizing it for 5 minutes. This forces you to maintain coherence and structure without relying on notes. Targeted reading practice. Read primary sources. Move away from review articles that summarize. Start reading original research papers. These sources provide the authentic, high-level English discourse you need to master for your exams. Structured writing prompts. Practice argument structure. We will assign prompts that require specific structures. Discuss X and refute Y. This active practice trains the logical pathways needed to sustain high-level academic writing under pressure. Scientific discourse refers to the specific language patterns used when discussing academic and research topics. It is characterized by precision, objectivity, and logical structure. When we talk about skill gaps, we are identifying areas where your communication falls short of this professional standard. These gaps might affect how you formulate an argument or how clearly you present evidence. Identifying these weaknesses is the first step toward mastering academic English. Remember that scientific language isn't just complex vocabulary, it's about how you connect ideas. It requires signaling transitions, maintaining formal tone, and structuring information logically through discourse markers like consequently or. Furthermore, focus on the architecture of your arguments, not just individual words. Here are 5 examples. This experiment showed that the drug worked really well. Lack of objectivity, writing. Using subjective intensifiers like really well is common in casual speech, but diminishes credibility in academic writing. Instead, quantify your findings or use measured language, such as, the results indicated a statistically significant improvement. So basically, the mitochondria, it does all the energy stuff. Vagueness and colloquialism, speaking. General phrases like stuffs or filler words undermine your authority. Always aim to replace vague descriptions with precise technical terminology specific to your field of study. But if you look at the data, it suggests something different. Weak transitioning, writing, speaking. The word but can often signal a confrontation rather than a nuanced shift in thought. Try using pivot phrases like conversely or however. Alternative analysis reveals that to smooth the transition. We think the causes are linked to genetics and environment. Oversimplification, argumentation. Scientific arguments rarely have single causes. Instead of listing possibilities with and, use complex structures that show correlation or interplay, such as the predisposition is thought to interact with environmental factors. This paragraph needs a concluding summary. Structural deficiency, writing. A body paragraph must have clear internal signposting. Ensure you start with a topic sentence, develop evidence, and conclude the specific point before moving to the next argument. Here are 3 reasons why this matters. Building credibility and authority. Academic writing demands a professional voice that instills trust in the reader. When your discourse is vague or overly casual, readers assume your knowledge is equally imprecise. Highly controlled language signals mastery of both the subject matter and the medium. Improving argumentative depth. Identifying gaps helps you move beyond simple description to critical analysis. The goal isn't just to report facts, it's to analyze relationships between them. Diagnosis forces you to articulate the nature of your claims, whether they are hypotheses, correlations, or established facts. Tailoring your communication strategy. Knowing your weakness allows targeted practice in specific linguistic areas. If you consistently struggle with summarizing complex material, a skill gap, instead of just reviewing vocabulary, you should practice synthesizing information from multiple sources into a concise narrative. Watch out for these 3 common mistakes. Too direct casual. The data shows that patients who took drug A recovered quickly. Academic tone shift. Analysis of the cohort suggests a stronger recovery rate in patients administered drug A. Notice how the first sentence makes a definitive statement, but the corrected version uses suggests and analysis, which is far more appropriate in scientific discourse. This slight shift indicates cautious, measured reporting. Overstatement. This study proves that diet affects weight loss. Hedging language. The findings indicate a potential correlation between dietary habit changes and weight management outcomes. Scientific writing must be appropriately humble. Never use absolute language like proves or always. Replace it with modal verbs such as may, suggests, or phrases like appears to indicate. Prescriptive authoritative. Therefore, the main conclusion is that we should change guidelines. Recommendation. Framing. Taken together, these results suggest a need for re-evaluating current clinical guidelines. Avoid sounding like you are issuing a mandate. Frame recommendations as suggestions based on evidence, using softer verbs and indirect structures to maintain academic neutrality. Here are 4 ways to practice. The elevator pitch drill. Summarize a complex paper in exactly 90 seconds, forcing conciseness and clear structure. This exercise is excellent for diagnosing structural gaps. You must quickly identify the core methodology, key finding, and implication without faltering or becoming vague. The counter-arguments exercise. For every claim you make, prepare a counter-argument and how you would refute it. This elevates your discourse from merely stating facts to engaging in true critical thinking. It forces you to anticipate weaknesses in your own argument and preemptively address them. Active revision reading. When reading academic texts, highlight every transition word and classify its function, contrast, addition, cause. Don't just read for content, read for rhetoric. By noticing how experts signal shifts in thought, you internalize the correct patterns for your own writing and speaking. Peer discourse analysis. Have peers critique your work specifically on formality and precision, rather than just grammar. Asking someone to focus only on academic tone forces you to hear feedback about the feels of your writing. This helps bridge the gap between grammatically correct English and truly professional discourse. The core of achieving a high band score is mastering register the appropriate style for the context. Academic English demands formality, precision, and objectivity in your language use. Conversely, casual speech relies on colloquialisms, contractions, and informal phrasings. In IELTS, you are always being tested on your ability to shift convincingly between these 2 registers. Remember that academics doesn't just mean complex words, it means structured thought presented with sophistication. When we talk about register, think of it as the required tone for a job interview versus talking to a friend over coffee. For IELTS, you must adopt the academic persona consistently. Focusing on eliminating slang and using sophisticated linking devices is your single most important immediate goal. Here are 5 examples. Use formal discourse markers. Instead of I think or it seems, use phrases like it can be argued that or oh, a primary consideration is nah when introducing an argument in speaking. These discourse markers signal to the examiner that your thoughts are structured and logically weighted. They elevate basic opinion statements into formal, thesis-driven arguments. Avoid contractions in slang. Never use don't, it's, or words like gonna. Write out full forms always. In both speaking and writing tasks, contractions are the hallmark of casual speech, and their presence immediately lowers your perceived formality level. Writing out full phrases ensures maximum grammatical precision. Adopt nominalization. Turn verbs into nouns to create a more academic texture. For example, instead of "the government decided," say "a decision was reached by the government." When describing processes or actions, nominalizing is a classic sign of advanced writing in English. It allows you to discuss concepts abstractly rather than focusing on who performed the action. Employ hedging language. Use phrases like "it appears that" or "one might suggest" rather than making absolute claims. When presenting evidence or analysis, academics rarely speak in absolutes. They present nuanced arguments supported by evidence. Hedging shows intellectual caution and nuance, which is a key marker of high-level thought. Master passive voice appropriately. While overuse is risky, using the passive voice helps maintain objectivity when focusing on the process rather than the actor. When discussing scientific or historical processes, if the focus of your answer is the research finding itself, not who found it, the passive structure is perfect. It keeps the tone impersonal and scholarly. Let's compare 4 pairs. Weak candidate. A lot of people think climate change is bad. Strong candidate. There is considerable evidence suggesting global warming poses significant environmental risks. The key mindset shift, from personal opinion to objective reporting. Notice how the strong candidate uses academic vocabulary like considerable and poses. This immediately shifts the focus from an emotional, generalized belief to a measurable, life evidence-based claim. Weak candidate. It's clear that technology helps us with our lives every day. Strong candidate. Technology has fundamentally reshaped daily life by enhancing accessibility and efficiency across multiple sectors. Insight. Moving from vague statements to specific analytical scope. The weak answer is general. The strong answer uses sophisticated collocations fundamentally reshaped, enhancing accessibility to show mastery of precise academic phrasing. Weak candidate. Because the economy went down, people lost their jobs. Strong candidate. The recession resulted in a significant downturn in employment rates. Insight. Replacing simple cause-effect language with sophisticated academic terminology. We are replacing casual words like "went down" or "lost their jobs" by using terms like recession, downturn, and employment rates. You signal familiarity with specialized discourse. Weak candidate. This point is important because it makes things better. Strong candidate. This perspective holds significant weight given its positive implications for sustainable development. Insight. Using evaluative, high-level rhetoric. The weak answer uses vague filler phrases like "makes things better." The strong answer substitutes this with complex academic phrasing that evaluates the value and impact of an idea. Here are 3 reasons why this matters. Demonstrates conceptual maturity. Elevating your discourse shows you think like a high-level academic. High scores are not just about grammar, they're about demonstrating how deeply you can process and articulate complex ideas. Adopting formal register proves that maturity. Enhances lexical resource scoring. It ensures your vocabulary use is sophisticated, precise, and contextually appropriate. The examiners are scoring your range, but they also score appropriateness. Using the wrong register saying "super" in an essay is a loss of points even if the word is grammatically correct. Achieves cohesive flow. Academic linking devices create seamless transitions between ideas. A strong argument must flow logically. By mastering formal connectors like furthermores, or conversely, you ensure that your speech or writing reads as one cohesive, expert piece of analysis. Here are 4 ways to practice. The colloquial to formal swap drill. Take 5 everyday phrases and rewrite them using strictly academic vocabulary. This is a highly targeted drill. Focus on swapping out common verbs and nouns for their more formal, Latinate equivalents. It builds muscle memory for formality. The thesis statement Polish. Write 5 short paragraphs, then rewrite the opening sentence of each to sound like a journal abstract. This forces you to immediately adopt an objective and formal tone. Your goal is to eliminate any personal pronouns or casual framing from your initial statements. Listen for register shifts. Watch academic lectures, TED Talks, university seminars, and actively note 3 phrases that signal formality. Active listening is crucial. Don't just listen for content. Listen specifically for how they structure their ideas using advanced linking words. This trains your ear for the ideal sound. Summarize news articles formally. Read a news article, then summarize it aloud or in writing without using any contractions and focusing on nominalization. This combines comprehension with immediate production under academic constraints. It simulates the actual test environment where you must stay formal while processing complex input. Advanced medical listening requires more than just recognizing individual words. It demands skilled comprehension of complex discourse structures. We are moving beyond basic vocabulary and needing to understand the relationship between ideas, the causality, the contrast, and the implications discussed by experts. Key strategies include predicting content based on context clues, focusing on signal phrases like however or consequently and, chunking information into thematic units rather than listening for single facts. By applying these techniques, you can process rapid-fire academic speech while maintaining focus on the central argument. Remember that in advanced listening, your brain needs to act like a filtering system. Don't try to translate every word. Instead, listen for the speaker's main point and how they pivot between supporting ideas. This shift from word-level processing to idea-level processing is what will significantly boost your comprehension scores. You are about to hear a listening passage. Get ready to listen and take notes. Good morning. Today we are reviewing the latest findings on managing type 2 diabetes in patients with comorbid cardiovascular risk factors. Initial guidelines suggested a general approach, but recent meta-analyses show that personalized treatment is crucial. Specifically, controlling HbA1c levels alone may be insufficient if blood pressure management lags behind. Furthermore, incorporating lifestyle modifications such as structured resistance training and dietary fiber intake cares demonstrated tangible improvements in insulin sensitivity, often comparable to metformin therapy in early stages. We must also consider the patient's socioeconomic status when prescribing complex regimens. For instance, a polypharmacy approach might be impractical for an elderly patient living remotely. Therefore, local health services need standardized protocols that prioritize simplicity and patient adherence above all else. Question 1. According to the passage, what is insufficient on its own when managing type 2 diabetes? Pause the video now and try to answer before we reveal it. The correct answer is, simply controlling HbA1c levels can be insufficient if blood pressure management is neglected. This question tests your ability to identify a condition or relationship. You shouldn't just hear HbA1cs, you need to process the warning that even successful control might fail due to another overlooked factor, like hypertension. Question 2. What type of therapy did the speaker suggest was comparable to metformin in early stages? Pause the video now and try to answer before we reveal it. The correct answer is incorporating lifestyle modifications, specifically resistance training and dietary fiber intake. Here, we are looking for a specific comparison. Advanced listening requires you to pinpoint the method, lifestyle changes that achieved results similar to a known drug, metformin, requiring careful note-taking. Question 3. What key factor must local health services prioritize when creating new protocols? Pause the video now and try to answer before we reveal it. The correct answer is, they must prioritize simplicity and patient adherence rather than complex regimens. The speaker uses therefore as a concluding signal. When you hear such transition words, pause briefly to anticipate the main takeaway message, which in this case is practical implementation over academic perfection. Here are 5 examples. Comorbid cardiovascular risk factors. Existing conditions that increase heart risks, e.g., high blood pressure accompanying diabetes. This is a classic example of academic nominalization. Instead of saying risks because of other diseases, the speaker groups it into one dense phrase, so you must listen for the collective noun. The meta-analyses. high-level research studies that synthesize findings from multiple independent studies. When hearing this term, recognize it as a signal of authoritative evidence. It means the claim is backed by a large body of published work, which gives you confidence in the information. Tangible improvements. Concrete, measurable changes or noticeable physical progress. Think of tangible as relating to touch you, can measure it. This phrase is used in scientific writing to move away from vague claims and toward observable outcomes. Polypharmacy approach. The use of multiple drugs or complex medication regimens. This is a highly specialized medical term. When you hear it, visualize a patient taking many different pills. It signals complexity and potential difficulty for the patient. Prioritize simplicity. To place emphasis on making something straightforward or easy to follow. The verb prioritize is key here. It means setting one thing as more important than others. In a medical context, it often means choosing patient compliance over clinical perfection. Listen again and fill in the missing words. The patient's initial assessment showed elevated blood markers, requiring further blank before a definitive diagnosis could be made. Pause the video now and fill in the blank before we reveal the answer. The correct answer is testing. In medical English, assessments often precedes terms like testing, screening, or examination. Hearing the context of elevated markers immediately guides you to diagnostic procedures. Due to their chronic condition, she must adhere to a strict diet that restricts both sodium and blank. Pause the video now and fill in the blank before we reveal the answer. The correct answer is potassium. This sentence tests knowledge of common electrolyte imbalances. If the speaker mentions restriction alongside sodium, potassium is a very strong candidate in cardiology contexts. The surgeon advised that the patient maintain an elevated head position for the first few days to prevent internal blank. Pause the video now and fill in the blank before we reveal the answer. The correct answer is bleeding. This requires integrating knowledge of post-operative care. Elevated head and preventing bleeding are common phrases linked in recovery protocols. The team decided to blank the follow-up appointment until the initial lab results were finalized. Pause the video now and fill in the blank before we reveal the answer. The correct answer is postpone. When plans need adjusting because of new information, postpone is the precise academic verb. It's more formal than simply saying they are delaying it. Here are 4 ways to practice. Active listening and note-taking. Don't just hear the words, process them. Use abbreviations and symbols while taking notes, focusing on keywords rather than full sentences. Treat listening like note-taking for a lecture. You are capturing structure, not every detail. Highlighting main ideas using arrows or bullet points dramatically improves recall. Dictation and transcription. Take short passages and write down exactly what is said. This forces your ear to match sounds with spelling. This technique builds auditory accuracy. You are training the phonetic muscle in your brain, allowing you to catch subtle differences between similar-sounding medical terms. Shadowing. Listen to native speakers and immediately repeat what they say, mimicking intonation, rhythm, and speed. This bridges comprehension and production. Shadowing is fantastic for fluency because it forces you to process information and speak at the same time. It's how you internalize the natural flow of academic speech. Pre-listening prediction. Before hearing a passage, read the topic title and predict what vocabulary or concepts might be discussed. This primes your brain for the content. This is a high-level strategy. By activating related knowledge beforehand, you give your brain an anchors to hang new information from, making comprehension much easier. Now it is your turn to practice. Read or listen to the following passage carefully. The management of acute myocardial infarction requires immediate and systematic intervention. Initial steps focus on stabilizing the patient's circulation through oxygen administration and establishing intravenous access for rapid drug delivery. Furthermore, pain management is critical. Potent nitrates are often administered to reduce preload pressure quickly. However, physicians must monitor the patient's pulmonary function closely because excessive vasodilation can precipitate acute respiratory distress syndrome. The prognosis heavily depends on timely reperfusion therapy, which aims to restore blood flow through opened coronary arteries. Comprehensive follow-up includes cardiac rehabilitation and strict adherence to antiplatelet medication for the next several weeks. Question 1. What is the primary initial focus of myocardial infarction management? Pause the video now and write your answer before we reveal it. The correct answer is stabilizing the patient's circulation through oxygen and establishing IV access. This tests your ability to identify sequential, actionable steps. Notice how the speaker guides you from immediate actions, oxygen, to setup actions, IV access. Question 2. Why must physicians be careful with vasodilation in this context? Pause the video now and write your answer before we reveal it. The correct answer is excessive vasodilation can potentially lead to acute respiratory distress syndrome. This question focuses on cause and effect. You need to link the action, vasodilation, with its potential negative consequence, ARDS, which is typical of advanced academic discourse. Listening effectively in a clinical setting is far more demanding than simple comprehension. You are processing complex jargon, rapidly delivered information, and multiple streams of data simultaneously. The challenge lies not just in hearing the words, but in accurately indexing them for later recall and use. Instead of trying to write down every single word, we must shift our focus to structural note-taking. This means organizing information by category, such as symptoms, lab results, or potential causes, rather than writing sentences verbatim. Remember that academic listening isn't about transcribing, it's about extracting the core meaning. Think of yourself as a filter. Let only the key data points and relationships pass through. Identifying these categories first, like symptoms, history, or plan, will give your notes immediate structure. You are about to hear a listening passage. Get ready to listen and take notes. The patient presented with an acute onset of severe abdominal pain radiating to the lumbar spine. Initial examination revealed significant tenderness in the right lower quadrant and a positive Murphy's sign when palpating the gallbladder area. Blood work showed elevated C-reactive protein levels, suggesting systemic inflammation. The initial differential diagnosis included appendicitis, diverticulitis, or perhaps a renal colic issue. However, given the patient's age and these specific pain characteristics, we strongly suspect cholecystitis until further imaging. Specifically, an ultrasound can rule out other gastrointestinal causes. We need to monitor their vitals closely for any signs of septic shock. Question 1. What type of abdominal pain did the patient present with? Pause the video now and try to answer before we reveal it. The correct answer is severe abdominal pain radiating to the lumbar spine. This question specifically tests your ability to capture descriptive details. Notice that they didn't just say pain, they specified both its severity and its direction, which is crucial information in medicine. Question 2. What key finding was noted when examining the gallbladder area? Pause the video now and try to answer before we reveal it. The correct answer is a positive Murphy's sign. Focusing on specific clinical signs like positive Murphy's sign requires you to listen for technical terminology. In a case study, these precise details are often more important than general descriptions. Question 3. What diagnostic tool was recommended next? Pause the video now and try to answer before we reveal it. The correct answer is an ultrasound. This tests your ability to follow the logical progression of care. When you hear a conclusion or a recommendation like, "We need an ultrasound," that signals a key actionable point for your notes. Here are 5 examples. Acute onset. Meaning, sudden beginning. Use it when symptoms appear rapidly rather than gradually. This is a high-yield phrase for clinical notes. Instead of writing "the pain just started," You use this academic term to immediately convey urgency and suddenness, radiating to the lumbar spine, meaning spreading outwards or traveling along a path, in this case, toward the lower back. Hearing directional terms like radiating helps you map out anatomical relationships in your mind. Physically pointing to where the pain travels when summarizing can reinforce this concept. Differential diagnosis, meaning a list of potential conditions that could be causing the current set of symptoms. This phrase is essential for understanding medical reasoning. When you hear this, your note-taking strategy must switch from listing complaints to creating a bulleted possible causes section. Systemic inflammation, meaning inflammation affecting the entire body or multiple organ systems. This is an advanced descriptive term. If you understand this concept, you know that the problem isn't isolated to one spot, it's widespread. Septic shock, meaning a life-threatening condition where infection causes a rapid drop in blood pressure and organ failure. When you hear serious outcomes like septic shock, treat it as the highest priority warning sign. Make sure to note the associated vital signs changes, as that's the clinical evidence. Listen again and fill in the missing words. The student needs to first blank key symptoms into groups for better analysis. Pause the video now and fill in the blank before we reveal the answer. The correct answer is group. In this context, group suggests categorization. Don't just write down a list, physically sort the information you hear for. Example, putting all pain descriptions under one heading. Next, they should blank their initial notes using different colored pens. Pause the video now and fill in the blank before we reveal the answer. The correct answer is color code. Using color coding is a visual organizational strategy. It helps your brain separate types of data for critical findings, blue for historical context. When summarizing the plan, they must use concise medical abbreviations like SOBs or BPs. Pause the video now and fill in the blank before we reveal the answer. The correct answer is abbreviations. Speaking and listening in medicine requires fluency with abbreviations. Practicing writing these out quickly is key to maximizing your note-taking speed. Finally, they should blank the entire discussion by creating a flowchart. Pause the video now and fill in the blank before we reveal the answer. The correct answer is diagram. Moving beyond simple bullet points and using diagrams or flowcharts shows advanced comprehension. It helps illustrate cause and effect relationships in the patient's condition. Here are 4 ways to practice. Active pre-listening. Before listening, predict the main topic and necessary vocabulary. This primes your brain for what to expect. Never listen passively. Before a lecture or case report begins, quickly scan the headings or ask guiding questions. This turns vague noise into predictable streams of information. Dictation practice. Listen for specific sentences and write them down exactly as you hear them, focusing on pronunciation. While full dictation isn't always practical in a fast-paced lecture, practicing it builds the neural pathways needed to capture precise sounds and complex grammar structures. Shadowing technique. Repeat what you hear immediately after the speaker, mimicking their pace, rhythm, and tone. Shadowing is excellent for fluency. It forces your mouth and brain to process language at native speed, improving both comprehension and speaking confidence simultaneously. Summarizing immediately. After every section of listening, pause and verbally summarize the main point in 1 or 2 clear sentences. This metacognitive step is vital. By forcing yourself to verbalize what you just heard, you confirm that your comprehension was deep enough, not just surface level. Now it is your turn to practice. Read or listen to the following passage carefully. The follow-up imaging revealed mild inflammation of the common bile duct, but no evidence of obstruction. The ultrasound also showed 3 small gallstones, which are non-calcified. Given these findings, the immediate plan is conservative management. We recommend an anti-inflammatory regimen and a detailed diet modification focusing on low-fat meals. Furthermore, the patient must schedule a follow-up appointment in 6 weeks to reassess their symptoms and repeat blood work. If pain recurs or if fever develops, they should contact us immediately, but otherwise, careful adherence to this modified lifestyle is paramount for successful recovery. Question 1. What was the primary finding regarding the common bile duct? Pause the video now and write your answer before we reveal it. The correct answer is mild inflammation, but no evidence of obstruction. This tests your ability to filter out negative information. The speaker mentions no evidence and mild, telling you that while there is an issue, it is not currently critical or blocked. Question 2. What are the 2 key components of the recommended management plan? Pause the video now and write your answer before we reveal it. The correct answer is an anti-inflammatory regimen and diet modification. In medical advice, look for explicit pairing words like and or as well as. These signal that you need to capture multiple equally important steps. Inferential listening is perhaps the most challenging skill in academic English. It requires you to listen not just for facts, but for meaning the unspoken ideas and implications presented by the speaker. Instead of simply repeating what they say, you must deduce why if they said it or what evidence supports their conclusion. Think of yourself as a detective piecing together clues rather than just a stenographer writing down every word. The key shift here is moving from comprehension to inference. When we talk about inference, we are asking students to read the subtext, the hidden message. Focus on signal phrases like, this suggests, or it appears that, because these markers tell you the speaker is guiding you toward an implied conclusion. You're about to hear a listening passage. Get ready to listen and take notes. Recent meta-analyses suggest a significant correlation between sleep deprivation and executive function decline in young adults. Specifically, the study tracked participants who reported less than 6 hours of quality rest over a 2-week period. While immediate cognitive tests showed minor dips in short-term memory recall, the more concerning findings appeared when assessing complex problem-solving tasks. Participants struggled significantly with multi-step decision trees and abstract reasoning puzzles. This suggests that sleep deprivation doesn't just make you tired, it fundamentally impairs your brain's ability to manage high levels of cognitive load. Therefore, simply managing time isn't enough. Optimizing restorative rest cycles seems critical for maintaining peak academic performance. Question 1. What is the primary finding regarding sleep deprivation? Pause the video now and try to answer before we reveal it. The correct answer is, it fundamentally impairs complex problem solving and abstract reasoning rather than just causing general fatigue. This question tests whether you grasp the nuance. The speaker explicitly separates minor dips from the more concerning findings. A strong answer must reflect this distinction to show true inferential understanding. Question 2. What does the passage imply about current time management advice? Pause the video now and try to answer before we reveal it. The correct answer is, it implies that simply managing your schedule or time allocation is insufficient if proper rest cycles are neglected. This requires you to read between the lines. When the speaker says, simply managing time isn't enough, they are directly contradicting a common assumption which shows high-level inference. Question 3. What specific type of cognitive skill was most affected? Pause the video now and try to answer before we reveal it. The correct answer is multi-step decision trees and abstract reasoning puzzles. This is a detail question, but knowing exactly what the passage mentioned allows you to confirm your listening focus. Pay attention to adjectives like complex and abstract because they define the scope of the impairment. Here are 5 examples. Meta-analyses suggest, used when summarizing findings from multiple previous studies. It indicates the evidence is broad and highly reliable. Calling out meta-analyses immediately signals to you that the information coming next isn't a single experiment, but an aggregation of complex research, requiring careful critical listening, significant correlation. A formal way of stating a strong relationship between two variables. Remember that correlation does not mean causation. When you hear the phrase significant correlation, write down both terms. This is crucial because in research, merely noticing a pattern isn't enough. You need to understand the statistical weight behind it. Executive function decline refers to high-level cognitive skills like planning, problem-solving, and decision-making. This is a specialized academic term. Instead of just hearing brain issues, recognizing executive function helps you categorize the type of difficulty. It's about management, not just memory retrieval. Multi-step decision trees, used to describe complex processes requiring sequential choices and planning. When you hear specific examples like decision trees, visualize the concept. This transforms an abstract academic phrase into a concrete mental model that aids retention. Restorative rest cycles implies deep sleep or quality recovery time necessary for cognitive repair. The word restorative is key here. It suggests that the rest isn't just downtime, it's an active process of rebuilding and repairing the brain, which is a deeper level of implication. Listen again and fill in the missing words. The study found that insufficient sleep significantly impacts your ability to blank complex problems. Pause the video now and fill in the blank before we reveal the answer. The correct answer is solve. Notice how solves fits perfectly here. This is a common gap where students might think of simpler synonyms, but understanding the academic context directs you to the most precise verb. Researchers recommend optimizing your sleep schedule by focusing on restorative rest blank. Pause the video now and fill in the blank before we reveal the answer. The correct answer is cycles. The pluralization here is important. We are talking about patterns or cycles, not just one instance of rest. Pay attention to the noun form that indicates ongoing processes. Early signs of cognitive impairment were detected during abstract reasoning blank. Pause the video now and fill in the blank before we reveal the answer. The correct answer is puzzles. The word puzzles is used here as a representative example. It helps anchor the abstract concept of abstract reasoning into something tangible that you can picture. This suggests we need to look beyond just time management and focus on blank quality. Pause the video now and fill in the blank before we reveal the answer. The correct answer is restorative. The adjective restorative is highly academic. It doesn't mean merely relaxing, it means actively returning something to its optimal state, which is vital for inference. Here are 4 ways to practice. Active pre-listening skimming. Before listening, read the questions and skim the passage title to predict key vocabulary or concepts. Don't wait until you hear the answer to start thinking. Use that pre-listening time to create mental hooks for specific keywords. This focused preparation dramatically improves your ability to filter out irrelevant noise. Shadowing technique. Immediately repeat what a native speaker says, mimicking their rhythm, intonation, and speed. This technique trains not just your ears, but your mouth muscles to process fast, natural speech. It bridges the gap between understanding English academically and speaking it naturally under pressure. Focused dictation. Transcribe short sections of academic speech verbatim, paying close attention to linking sounds and stress patterns. Dictation forces meticulous focus. You cannot guess the words, you must capture them exactly as they are spoken, which sharpens your ear for subtle pronunciation differences that often carry meaning. Paraphrasing practice. After listening to a complex point, immediately summarize it in your own words without looking at notes. This is the ultimate test of inference. If you can explain the concept back simply and clearly, it means you truly understood the underlying meaning, not just the surface vocabulary. Now it is your turn to practice. Read or listen to the following passage carefully. When discussing urban development, it's crucial to consider the impact of impermeable surfaces. These materials like concrete and asphalt can dramatically alter local hydrology patterns. Instead of rainwater naturally filtering through soil into groundwater reservoirs, these liquids run off rapidly into storm drains. This rapid runoff carries pollutants directly into waterways, significantly increasing water quality concerns downstream. Consequently, many city planners are beginning to mandate the use of permeable paving or green roofs. While this may represent an increased initial cost for developers, the long-term ecological benefits, such as reduced flood risk and improved groundwater recharge, appear to outweigh the upfront investment. Question 1. What is the main environmental problem highlighted by impermeable surfaces? Pause the video now and write your answer before we reveal it. The correct answer is, they prevent natural water filtration, causing rapid runoff that carries pollutants into waterways and negatively affecting water quality. The key here is connecting the cause, impermeable surfaces, to the immediate effect, rapid runoff pollution, and then to the ultimate consequence, water quality decline. Don't just list problems, show the causal chain. Question 2. What does the passage suggest about the adoption of green roofs? Pause the video now and write your answer before we reveal it. The correct answer is, it suggests that while there is an initial cost barrier, the long-term ecological and infrastructural benefits justify the expense. Listen for the contrasting phrases. The speaker introduces a problem cost, but immediately counters it with a solution and its advantages. This structure is designed to make you infer the speaker's overall conclusion. When listening to complex academic monologues like those discussing pathophysiology or epidemiology, the sheer density of specialized vocabulary can be overwhelming. We aren't just tracking words, we are tracking an entire argument, which means identifying the main claim, supporting details, and any shifts in perspective. The key strategy here is active mapping, mentally organizing the information into cause and effect relationships. Instead of trying to remember every fact, focus on understanding how the speaker connects one idea to the next. The most challenging part of these monologues isn't usually pronunciation, it's managing the cognitive load. Think of yourself as a flowchart architect. When you hear A leads to B, which is mitigated by C, you are building a relationship map in your mind. If you can successfully identify those relationships, even if you miss some jargon, you have grasped the core argument. You are about to hear a listening passage. Get ready to listen and take notes. Viral pathogenesis is a highly intricate process. Initially, the virus must breach the host cell membrane, often via receptor binding mechanisms that are unique to specific tissue types. Once inside, it hijacks the cellular machinery of ribosomes and polymerase ester replicate its genetic material efficiently. This initial phase of replication is critical because it dictates the viral load and the subsequent inflammatory response. A key factor in determining disease severity is how quickly the virus mutates. If the mutation rate is high, the immune system struggles to develop adequate neutralizing antibodies. Therefore, prophylactic measures such as rapid vaccine development or early antiviral deployment become absolutely essential public health imperatives. Question 1. What mechanism does the virus use to enter the host cell? Pause the video now and try to answer before we reveal it. The correct answer is, it uses receptor binding mechanisms unique to specific tissue types. This question tests your ability to pinpoint a specific detail within a general process. When listening, pay close attention immediately after key transition words like initiales or first. These signal the starting point of a crucial concept. Question 2. According to the speaker, what makes disease severity difficult to predict? Pause the video now and try to answer before we reveal it. The correct answer is the speed and rate of viral mutation. Here we are testing your ability to synthesize information. The speaker doesn't just list facts, they explain cause and effect chains. Look for linking phrases like a key factor in determining to find the answer. Question 3. What is the overall implication of a high mutation rate? Pause the video now and try to answer before we reveal it. The correct answer is, it makes it difficult for the immune system to develop adequate neutralizing antibodies. This requires understanding the consequence. You need to listen for the relationship between high mutation rate and the resulting problem. Always ask yourself, so what? After a piece of academic information, here are 5 examples. Pathogenesis. The process by which a disease develops. Use this when discussing the mechanism of illness. When you hear pathogenesis, don't just think of sickness, think of the sickness unfolds. It refers to the biological journey from exposure to full-blown disease. Neutralizing antibodies. Proteins designed to block a pathogen's ability to infect cells. This is highly specialized vocabulary. If you encounter technical terms like this, try to isolate the root meaning. It's about neutralizing, which means making something inactive or harmless. Prophylactic measures. Preventative actions taken before an illness occurs. This is a fantastic synonym for preventive. Remember that pro often means before, which helps you recall the meaning even if you've never heard the word before. Hijacks the cellular machinery. Takes control of a cell's internal mechanisms for its own use. This is an excellent descriptive phrase. Instead of translating it literally, visualize it. The virus is taking over the factory floor of the cell to start mass production. Public health imperatives. Absolutely necessary actions required for community well-being. This phrase elevates your language from simple description to authoritative academic writing. It signals that what follows is a non-negotiable priority for society. Listen again and fill in the missing words. Viral pathogenesis is an intricate process that requires a pathogen to first blank the host cell membrane. Pause the video now and fill in the blank before we reveal the answer. The correct answer is breach. The word breach implies a forceful entry, which is more specific than just entering. This level of precision is what you need when following scientific arguments. Once inside, the virus effectively blanked the cellular machinery to replicate its genetic material. Pause the video now and fill in the blank before we reveal the answer. The correct answer is hijacks. Understanding that the virus doesn't create new tools but rather takes over its existing ones is key. Hijacks perfectly captures that sense of forceful control. A high mutation rate makes it difficult for the immune system to develop adequate blank. Pause the video now and fill in the blank before we reveal the answer. The correct answer is antibodies. In scientific texts, nouns are often used as modifiers. Instead of saying antibody protection, you might hear antibody-mediated response. Pay attention to how these noun clusters function. Therefore, preventative measures like vaccines become essential public health blank. Pause the video now and fill in the blank before we reveal the answer. The correct answer is imperatives. The word imperative here means mandatory or critical. When you see words like essential or critical, always consider if a stronger, more formal synonym could be used. Here are 4 ways to practice. Active mapping the why. Why? Don't just listen for facts, listen for connections. Ask, why does this happen and what is the result? This forces you to track causality. This technique shifts your focus from passive reception to active analysis. Structure your notes around arrows, A term B because of C. It turns listening into problem solving. Shadowing. Immediately repeat what a speaker says after they say it, trying to match the rhythm and intonation perfectly. This improves fluency and processing speed. This is physical practice. You are training your mouth muscles and your brain simultaneously. It forces you to process language at native speaking speeds, which is crucial in these academic settings. Targeted dictation. Write down specific difficult phrases or technical terms several times. Don't just write the word, underline its meaning. Dictation helps solidify vocabulary in complex grammar structures. By focusing on one dense concept like receptor binding mechanisms, you build muscle memory for academic jargon. Pre-reading previewing. Before listening, quickly skim the topic title or a few key words. This primes your brain with expected terminology. Never walk into difficult content cold. If you know the talk is about apoptosis, your ear will be much more attuned to that sound and concept when it finally appears. Now it is your turn to practice. Read or listen to the following passage carefully. The rate of genetic mutation is fundamentally influenced by environmental factors. For instance, exposure to UV radiation or certain chemical pollutants can significantly increase the error rate during DNA replication. These mutations are not always detrimental. Sometimes they allow for beneficial adaptations that help a population survive a novel pathogen. However, an uncontrolled burst of random changes increases the risk of malignant transformation in host tissue. Scientists often study these mutation rates through phylogenetic analysis, comparing genetic markers across different species over vast periods of time. This research helps us understand both evolutionary pressures and potential points of human vulnerability. Question 1. What types of factors can increase the error rate during DNA replication? Pause the video now and write your answer before we reveal it. The correct answer is environmental factors like UV radiation or chemical pollutants. Notice how the speaker shifts from discussing mutation generally to providing concrete examples. When you hear, for instance, it signals that specific illustrative details are coming your way. Question 2. How does studying mutation rates help scientists understand evolution? Pause the video now and write your answer before we reveal it. The correct answer is by comparing genetic markers across different species through phylogenetic analysis. This question tests if you can follow the chain of academic reasoning. The process is mutation rate, study method, phylogenetic analysis, Musker, goal, understanding evolution, vulnerability. Always map the method to the goal. In ethical panel debates, tracking consensus means identifying moments when multiple speakers arrive at a shared understanding or agreement on a core principle. Conversely, conflict is marked by stark disagreement over the best course of action, despite agreeing on the basic moral dilemma itself. Skilled listeners must distinguish between simple differences in opinion and fundamental clashes regarding underlying values or priorities. We are looking for the pivot points where the discussion shifts from general theory to concrete policy implications. The key here is nuance. A disagreement over how to implement a policy isn't always the same as disagreeing on whether the policy should exist at all. Understanding this distinction allows you to accurately map the intellectual landscape of the debate. Here are 5 examples. While I agree with the premise, I must challenge its scope. Concession plus qualification. This phrase is highly useful because it acknowledges validity while immediately pivoting to critique. It's a polite way of disagreeing that keeps the conversation moving forward productively. To summarize the preceding points, it seems we are converging on one area. Summarizing convergence. When a speaker uses summarizing language like this, they are trying to force the group toward harmony. Listen for which specific point they choose to emphasize. However, that position fails to account for systemic inequities. A strong counter-argument. This is a powerful and direct way to challenge an idea. Notice the use of fails to account for. It implies a flaw in logic rather than just a difference in taste. It appears we have reached a consensus on the necessity of further study, stating de facto consensus. When speakers use this phrase, they are often ending a specific subpoint. It doesn't mean the entire debate is settled, just that that particular topic has found common ground. I respectfully disagree with the gravity of that conclusion. Soft disagreement. Using respectfully softens a potentially aggressive disagreement. It signals intellectual opposition while maintaining professional decorum, which is crucial in these formal panels. Here are 3 reasons why this matters. Identifying the sticking point. This is the core disagreement that prevents the panel from reaching a unified policy recommendation. The sticking point is rarely about facts. It's usually about values. For example, prioritizing individual rights versus collective public health. Locating this value conflict is your main goal. Distinguishing rhetoric from recommendation. Not every strong statement translates into a workable policy commitment. Speakers often use highly emotional or moral language to persuade, but that rhetoric might lack practical implementation steps. Always look for concrete verbs and actionable nouns. Mapping the power dynamic. Understanding who gains influence when a consensus is reached. Pay attention to which speakers are given the floor right before or after a major pivot. Their ability to frame the discussion can be just as important as their arguments themselves. Watch out for these 3 common mistakes. Misinterpreting openness, the speaker said, "We must consider all angles so the consensus is reached." Recognizing ambiguity, this phrase signals an open-ended discussion, not a resolution. A call to consider all angles usually means the panel is stalled. It's less about finding an answer and more about requesting more time for deliberation. Assuming expertise, if a speaker uses technical jargon, they must be correct. Questioning assumptions. Technical language requires validation through multiple sources or speakers. Just because someone sounds highly knowledgeable doesn't mean their premise is flawless. Always listen for supporting evidence, not just sophisticated vocabulary. Over-segmenting conflict. Every strongly worded disagreement represents a unique principle. Identifying root tension. Often, disagreements are variations on the same core tension point. Don't treat every dissenting voice as representing an entirely separate ideology. Instead, try to group them by what they are fundamentally worried about. Here are 4 ways to practice. The 3 who's note, taking method. For every key point, who said it? What was the claim? Why did they say it? This method forces you to track more than just arguments. It tracks authorship, intent, and underlying motivation. It provides a complete picture of the debate's dynamics. Mapping interjections. Note down short comments like "furthermore" or "I dissent." These signal shifts in focus. These small verbal cues are gold mines for listeners. They tell you exactly where the speaker is changing gears, giving you an early warning of a topic shift. Predicting the next speaker's concern. After a major point is made, anticipate which ethical principle or stakeholder group will be challenged next. This requires synthesis skills. If the panel just discussed economics, your brain should immediately start anticipating a challenge regarding social justice or individual autonomy. The synthesis summary. At the end of the debate, summarize the tension rather than listing the points. Instead of saying, "Speaker A said X and Speaker B said Y," try summarizing the core conflict. The debate ultimately struggled between maximizing individual liberty versus ensuring collective safety. This is a much stronger academic skill. Academic lectures require a specialized vocabulary that goes far beyond everyday conversation. This field of language is characterized by precision and formality. Learning these terms helps you understand complex scientific concepts instantly. We are focusing on medical terminology, which demands extreme accuracy in communication. When you encounter these words, remember that they aren't just random nouns. They represent specific academic fields of study. Mastering them means you can follow the argument, not just the individual words. Think of this specialized vocabulary as unlocking a higher level of comprehension. Let's go through 6 words. For each word, I will say it clearly, then explain how to produce it correctly. The word is etiology. Say it again, etiology. Always remember that etiologies refers to the cause cess. It is not the symptoms, and it is not the name of the disease itself. When you are discussing illness, if someone asks for the etiology, they want the root reason behind it. The word is pathophysiology. Say it again, pathophysiology. This word is often misunderstood. It doesn't mean pathology, which just means studying disease. Pathophysiology specifically describes how the normal body function goes wrong. It's about the mechanism of dysfunction. The word is mitigate. Say it again, mitigate. A common error is confusing mitigate with simply treat. Mitigating means reducing the severity or impact of something. It is preventative work that lowers the danger level. The word is comorbidity. Say it again, comorbidity. This is a crucial clinical term, meaning multiple conditions existing at the same time. If someone says you have comorbidity, they are telling you that your health issues interact and complicate each other. The word is prognosis. Say it again, prognosis. Be careful not to confuse prognosis with actual diagnosis. Prognosis is an educated guess, a likelihood assessment given by medical professionals regarding your future health trajectory. The word is dysregulation. Say it again, dysregulation. If a body system is experiencing dysregulation, it means the delicate balance, the homeostasis, has been disturbed. Think of it as a control panel that has suddenly lost its settings. Here are 5 examples. Understanding the etiology of heart disease requires looking at both genetics and lifestyle factors. Etiology, noun. Notice how etiology is paired with other academic concepts like genetics. It establishes a highly scientific context right from the start, making your speech sound authoritative. The research paper detailed the pathophysiology of high blood sugar levels. Pathophysiology, noun. Here, detailed is a strong academic verb. It suggests that the speaker didn't just mention the topic, they went into deep, complex specifics regarding the function. Dietary changes can significantly mitigate the severity of chronic inflammation. Mitigate, verb. Using mitigates instead of simpler verbs like lessen elevates your language. It suggests a controlled scientific effort to reduce symptoms or risk. The patient presented with comorbidity between type 2 diabetes and renal failure. Comorbidity, noun. In precise medical conversation, listing these conditions together using with comorbidities is the standard professional phrasing. It shows fluency in clinical language. Despite the early prognosis, follow-up monitoring showed signs of improving metabolic dysregulation. Prognosis, dysregulation, noun. This final example shows how 2 complex words can work together. The process of checking for improvement in metabolic dysregulation is a key part of determining the patient's improved prognosis. Let's compare 4 pairs. First, etiology. Because general. Register difference. While causes is perfectly understood, using etiology automatically signals that you are speaking in a highly academic or medical context. It adds instant gravitas to your speech. First, ameliorate. Alleviate, synonym. Focus of action. Both mean to ease pain or suffering, but ameliorates often suggests making a general condition better overall. Whereas alleviate focuses more on reducing the intensity of specific symptoms. First, pathophysiology. Mechanism, related term. Scope of study. A mechanism is how something works. Pathophysiology describes how it goes wrong. You can say the mechanism of failure, but you use pathophysiologies when describing the entire biological process of disease. First, dysregulation. Imbalance general. Scientific formality. Saying something is in imbalance is conversational, but using dysregulation shows a deep understanding of biological control systems. It's the precise scientific term required here. Here are 4 ways to practice. Contextual mapping. Draw a web linking the word to its related scientific fields. Don't just write definitions down, physically draw connections. For example, link comorbidities to diagrams showing overlapping circles, which helps cement the concept of coexistence. Flashcard storytelling. Create short stories or scenarios for each word. Instead of reviewing definitions, force yourself to build a narrative around the vocabulary. This activates your creative memory and makes the words far easier to recall in conversation. Collocation chaining. Practice using 3 specific words together naturally. Academic language thrives on strong collocation swords that naturally belong together. Practice linking prognosis with adjectives like guarded or mitigate with nouns like risk. Shadowing technique. Listen to medical podcasts and repeat the vocabulary immediately. This is perhaps the most effective method. By shadowing, you are forcing your mouth muscles and brain to reproduce the specific rhythm and pronunciation of high-level scientific speech naturally. Now it is your turn to practice. Read or listen to the following passage carefully. The initial study reviewed the etiology of autoimmune conditions. The pathophysiology reveals that chronic immune system dysregulation can lead to severe comorbidity with vascular issues. While treatment cannot eliminate all risk, lifestyle adjustments are crucial to mitigate symptoms and improve prognosis. Question 1. Find a word in the passage that means the cause or origin of a disease. Pause the video now and write your answer before we reveal it. The correct answer is etiology. When you read this paragraph, pause right at the beginning. If you can correctly identify the term for cause, you immediately set the authoritative tone for your reading and comprehension. Question 2. Use one of the target words in your own sentence. Pause the video now and write your answer before we reveal it. The correct answer is, the committee advised strategies to mitigate global warming effects on marine life. Remember that using a word correctly is more important than just knowing its definition. This final exercise requires you to shift from passive knowledge to active, conversational production. When dealing with rapid-fire questions, you cannot afford to read every word. Our strategy is a combination of targeted scanning and immediate synthesis. Scanning means quickly hunting for specific data points like dosages or reaction names. Synthesis involves mentally stitching together those isolated facts into a coherent answer. Think of it less as reading and more as information retrieval. You are mapping the text structure to locate answers instantly. Remember that high-stakes scenarios require an active reading approach, not a passive one. Before you even look at the passage, take 2 seconds to predict what kind of information you need. This pre-reading action drastically narrows your focus and makes scanning much more effective. Here are 4 examples. Interaction alert. Warfarin combined with St. John's wort significantly increases the risk of hemorrhage. Look immediately at interaction alerts and bolded drug names. Notice how the text uses visual cues like headings or capitalization to signal critical information. In a rapid-fire setting, these structural markers are your biggest time savers. Treat them as flashing neon signs. Primary symptom: gastrointestinal distress and excessive bruising. Scan the bullet points under symptoms rather than reading descriptive paragraphs. Bullet points are designed for quick assimilation of facts. If a question asks for symptoms, your eyes should naturally drop to these lists without processing any connecting text. Dosage adjustment protocol. Reduce initial dose by 25% if co-administered with CYP3A4 inhibitors. Identify the required action, reduce, and the condition, CYP3A4 inhibitors. This is crucial clinical data. When you see a rule or protocol, don't read it like a story. Extract the if A, then B format immediately. Contraindicated. Use must be avoided in patients with active hepatic failure. Look for strong negating terms like contraindicated, avoided, or absolute contraindication. These definitive statements are often the answers to yes-no rapid-fire questions. Train yourself to instantly spot these limiting phrases. They carry immense weight. Here are 2 reasons why this matters. Essential for communication. Understanding speed drills. Handling rapid-fire questions on drug interactions and symptoms helps you communicate more effectively. When you master speed drills, handling rapid-fire questions on drug interactions and symptoms, you will notice your conversations flow much more naturally. Commonly used in daily life. You will encounter speed drills, handling rapid-fire questions on drug interactions and symptoms frequently in everyday conversations. Pay attention to how native speakers use speed drills, handling rapid-fire questions on drug interactions and symptoms. You will start hearing it everywhere once you are aware of it. Watch out for these 2 common mistakes. Some learners say, I am confused about speed drills, handling rapid-fire questions on drug interactions and symptoms. The better way to say this is, I am confused about speed drills, handling rapid-fire questions on drug interactions and symptoms. The adjective needs the ed ending here because it describes how you feel, not what you are. Some learners say, she don't know speed drills, handling rapid-fire questions on drug interactions and symptoms. The better way to say this is, she doesn't know speed drills, handling rapid-fire questions on drug interactions and symptoms. With she, we must use doesn't instead of don't. This is one of the most common errors in English. Here are 4 ways to practice. Pre-question mapping. Before reading the passage, predict 3 possible question types: symptom, drug name, and mechanism. This primes your brain to look for specific patterns. This tip is about cognitive preparation. By anticipating the questions, you shift from simply decoding words to actively hunting for pre-identified pieces of information. Chunking information. Break complex drug interactions into smaller drug A interacts with mechanism units. Do not try to memorize long paragraphs. Our brains process chunks, not continuous text streams. By segmenting the information this way, you create distinct mental folders for each interacting pair, making recall faster and more reliable. Active question formulation. As you read, constantly ask yourself, if I were asked this passage a question right now, what would it be? This forces deeper engagement. This technique turns reading into an internal examination. You are playing the role of both the reader and the examiner simultaneously, which greatly improves retention. Simulating pressure. Practice timed drills using flashcards or recorded questions without pausing to check answers. Embrace the initial inability to recall everything. The goal of speed drilling is not perfection, but consistency under pressure. Simulating the actual stress helps build muscle memory for rapid information retrieval. Listening for details in clinical narratives is challenging because the information is often dense and delivered quickly. Unlike general conversation, medical records require pinpoint accuracy regarding names, specific dates, and operational protocols. Our goal here is not just to understand the main idea, but to capture every single factual data point mentioned. To prepare, we need to train our ears to filter out background noise and focus solely on these key structural elements. When listening for details, remember that your brain needs a roadmap. Instead of passively absorbing words, actively listen for signpost words like specifically, on date, or protocol requires. This technique helps you segment the information into manageable chunks, maximizing your retention rate. You are about to hear a listening passage. Get ready to listen and take notes. This is an update for Mr. Harrison's chart. Following his initial admission on October 12th, the primary care physician revised his medication schedule. The protocol dictates that he must restart the antibiotics by November 4th. And this dosage increase should only occur if blood pressure remains stable below 100/40 over a span of 3 days. Remember, Ms. Peterson scheduled a follow-up consultation with Dr. Evelyn Reed on December 9th to review potential physical therapy needs. Please ensure all lab results from the October 21st screening are filed by end of day next Tuesday. Furthermore, Mr. Harrison must adhere strictly to the dietary restrictions outlined in the initial discharge summary until his specialist visit. Question 1. What is the revised start date for the antibiotics? Pause the video now and try to answer before we reveal it. The correct answer is November 4th. This question forces you to filter out other dates and focus on the specific trigger word restart, which changes the context from the initial admission date. Question 2. Who is scheduled to review physical therapy needs? Pause the video now and try to answer before we reveal it. The correct answer is Dr. Evelyn Reed. Identifying names in a rapid-fire sequence tests your ability to isolate proper nouns amidst technical medical jargon, which is crucial for patient safety. Question 3. By when must the lab results from October 21st be filed? Pause the video now and try to answer before we reveal it. The correct answer is end of day next Tuesday. This tests your ability to track temporal deadlines. Pay close attention to phrases that define a specific time frame, like by end of day. Here are 5 examples. Admitted on October 12th establishes the non-negotiable start date of care. When you hear admitted on, immediately flag that date. This phrase signals a critical pivot point in the patient's timeline, establishing the initial baseline for all subsequent records. The protocol dictates that. Indicates mandatory procedure, no deviation allowed. This phrasing is your warning sign. It means what follows is a strict rule or guideline, not merely a suggestion. Always treat information following this phrase as absolutely necessary for the care plan. Scheduled a follow-up consultation. Pinpoints a future required appointment. Listen for verbs related to scheduling consultation, follow-up, or appointment. These words mark specific future dates and the purpose of the meeting, which are vital details. Filed by end of day next Tuesday. A hard deadline for documentation submission. This is a specific administrative detail. End of days means the absolute closing time, it's not indefinite. This level of precision is what differentiates good note-takers from excellent ones. Adhere strictly to. Requires complete compliance with rules or guidelines. If you hear adhere, it means compliance is mandatory. It's a stronger word than follow. When documenting protocols, always note the level of adherence required. Is it strict, partial, or recommended? Listen again and fill in the missing words. The patient must ensure all required forms are signed by their primary care physician before they can blank treatment at home. Pause the video now and fill in the blank before we reveal the answer. The correct answer is resume. Focusing on verbs like resume helps you capture the transition point in the narrative. It shows that the action is restarting something previously stopped, giving context to the detail. The nurse documented a temperature of 98.6 degrees and noted no signs of blank breathing. Pause the video now and fill in the blank before we reveal the answer. The correct answer is respiratory. Be ready for technical adjectives like respiratories or cardiac. These words provide immediate context when you hear measurements, helping you categorize the detail correctly. The specialist advised that all physical therapy exercises should be performed 3 times a week for at least 6 blank. Pause the video now and fill in the blank before we reveal the answer. The correct answer is weeks. This tests your ability to track duration. Not only is the frequency important, but the length of time 6 weeks, 2 months is equally critical data that cannot be missed. Please ensure that all blood work results are uploaded directly into the patient's blank profile. Pause the video now and fill in the blank before we reveal the answer. The correct answer is electronic. Knowing the system is important. Identifying if a document goes into an electronic versus a paper file changes its urgency and handling protocol, which is vital information to record. Here are 4 ways to practice. Active annotation. Don't just transcribe, paraphrase key details as you listen. Use abbreviations or symbols to save time. When taking notes, think like a professional recorder. Instead of writing out full sentences, use bullet points and labels like date, 10-12, or action, consult needed. This forces your brain to prioritize information structure. Dictogloss practice. Listen to a passage twice. First time, grasp the main ideas. Second time, fill in specific missing words. This technique is excellent for controlled recall. By knowing roughly what comes next, you can focus your attention very tightly on the exact vocabulary or number needed to complete the thought. Shadowing. Immediately repeat exactly what you hear after a native speaker, focusing on rhythm and intonation. While shadowing improves fluency generally, when applied to medical contexts, it helps you internalize the specific cadence of technical speech. Pay attention to how quickly they transition between names and dates. Predicting structure. After hearing an introductory phrase, e.g., the concern was, predict what kind of detail will follow, a symptom, a date, or a name. This is perhaps the most advanced skill. By predicting the type of information, is it a person? Is it a time? Is it an action? You prime your brain to listen specifically for that category of word. Now it is your turn to practice. Read or listen to the following passage carefully. We need a thorough review of Ms. Chen's current medication list before her discharge on May 20th. Her primary physician noted that the dosage for her blood pressure medication needs to be adjusted to 10 milligrams, taking it only in the morning. Furthermore, she must discontinue the use of vitamin K supplements immediately, as this conflicts with her new anticoagulant protocol starting next Monday. Please confirm if the pharmacy received the updated prescription from Dr. Kim by noon today. This documentation is critical because Ms. Chen has a history of delayed filing, and we cannot risk any medication errors before her follow-up visit. Question 1. What changes are required for the blood pressure medication? Pause the video now and write your answer before we reveal it. The correct answer is, the dosage must be adjusted to 10 milligrams, taken only in the morning. This question tests your ability to track quantitative details, dosage, and frequency. Always listen for numbers and time indicators combined with the verb adjust. Question 2. What specific action must Ms. Chen take regarding her supplements, and by when? Pause the video now and write your answer before we reveal it. The correct answer is, she must discontinue vitamin K immediately. The key here is recognizing conflicting protocols. When a speaker says something conflicts with, it means immediate stoppage is necessary. Pinpointing the exact substance and the required action are essential. When faced with dense scientific journals, reading every single word is inefficient. We need two key strategies, skimming and scanning. Skimming means reading quickly to grasp the overall main idea or general gist of a text. You are looking for the big picture, the thesis statement, or conclusion. Scanning is completely different. It involves moving your eyes rapidly over the text to locate very specific pieces of information, like a date, a name, or a percentage. It's like searching for a single phone number in a massive directory. Remember that skimming and scanning are not replacement skills, they are complementary tools. Think of it this way. First, you skim the introduction to understand what the paper is about. Then, you scan the results section specifically looking for the statistical evidence mentioned in your assignment prompt. This sequential approach saves massive amounts of time. Here are 4 examples. The study posits that chronic exposure to volatile organic compounds significantly increases the risk of respiratory inflammation. Skimming, identifying the main argument thesis statement. Notice how this sentence contains the entire paper's premise. When skimming, your goal is not understanding every word, but pinpointing the core claim, the what and the why of the research. Participants were divided into 2 groups, Group A, N50, and Group B, N50. Scanning, locating specific data points, numbers, N50. Here we are training our eyes to hunt. Instead of reading the context around the numbers, you immediately jump down your page looking only for numerical counts or identifiers. This is pure scanning technique. Statistical analysis revealed a p-value of 0.05, indicating significance. Scanning, identifying technical keywords and thresholds, p-value 0.05. In scientific articles, specific jargon like p-values or certain chemical names are your targets. When you know what keyword to look for, you can skip over descriptive text entirely, making the process incredibly fast. Therefore, future interventions should focus on mitigating systemic inflammation alongside pollutant reduction. Skimming, grabbing the key recommendation or conclusion. The concluding sentence is often where the authors summarize their most important takeaways. Always make sure to skim the last paragraph, because that's usually where the ultimate significance of the research lies. Let's compare 4 pairs. Skimming an abstract, goal, gist. Reading a full discussion section, goal, interpretation. Depth of focus. When skimming the abstract, you only care about 3 things: background, method type, and conclusion. However, reading the full discussion requires deep critical thinking. You must evaluate if the conclusions are strong enough to support the claims. Scanning for statistics, goal, numbers. Scanning for definitions, goal, concepts. Target type. Sometimes you're looking for a specific number, like 2023, and other times you are hunting for the definition of a term, such as oxidative stress. The physical act of scanning remains the same, but your mental target shifts from digits to complex vocabulary. Reviewing literature, goal, context. Reading the methods section, goal, reproducibility. Information type. A literature review gives you context, who said what and when. The methods section is entirely different. It tells you how they did it. Change your focus from names and ideas to specific equipment, measurements, and protocols. Reading for the hypothesis goal, testable prediction. Reading for limitations, goal, flaws. Perspective shift. When reading for a hypothesis, you are looking for the author's educated guess. When finding limitations, you need to adopt a skeptical reader mindset. You are actively searching for what they didn't measure or what constraints might weaken their argument. Complete the summary using words from the passage. Initial research suggested a strong correlation between pollutant exposure and lung damage, but further study was needed to confirm the precise blank. Pause the video now and fill in the blank before we reveal the answer. The correct answer is mechanism. In academic writing, words like mechanism are highly valuable. They represent the underlying process or cause and effect chain. Knowing these connecting nouns helps you build sophisticated summaries and explanations. The researchers found that dietary changes could effectively blank some of the negative effects observed in the animal models. Pause the video now and fill in the blank before we reveal the answer. The correct answer is mitigate. Mitigate is a fantastic word to learn for scientific writing because it means to lessen or reduce the severity of something. It helps you describe outcomes accurately and professionally. These findings suggest that intervention strategies must address both environmental sources and individual biological blank. Pause the video now and fill in the blank before we reveal the answer. The correct answer is factors. When summarizing, always look for generalized nouns like factors, variables, or components. These words signal a list or grouping of related elements that are important to the overall finding. Future studies should employ longitudinal designs to track changes over time and confirm long-term blank. Pause the video now and fill in the blank before we reveal the answer. The correct answer is efficacy. Efficacy means effectiveness, especially in terms of achieving a desired result. It is critical vocabulary when discussing medical or intervention research, so make sure you understand its precise meaning. Here are 4 ways to practice. Pre-read with a purpose. Before reading the article, look at the title, introduction, and conclusion. Formulate 2-3 questions you expect the text to answer. Never read without direction. If you have specific questions in mind, for instance, what is the dosage or who started this study, your brain automatically filters out irrelevant information, making your reading process exponentially faster. Use pointer techniques. Physically guide your eyes using a finger or a pen. This prevents you from rereading the same lines multiple times and keeps your focus linear. This sounds simple, but controlling eye movement is key to speed reading. By simulating physical guidance, you enforce a steady pace for yourself, training your brain to absorb information in chunks rather than word by word. The PQRST method. Preview title headers, question, what do I need to know? Read, skim, scan, summary, review the core points. This is a systematic framework. Don't just read, you must follow these steps. The question step is vital because it forces you into an active search mode, which is much quicker than passive reading. Active note taking. Do not transcribe sentences. Instead, write down connecting words and keywords, increased correlation between A and B. When you take notes in a scientific context, do not rewrite the text. Only capture the main actors, A, the action increased, and the link correlation. This trains your brain to synthesize information on the fly, which is the highest level of reading skill. Now it is your turn to practice. Read or listen to the following passage carefully. A longitudinal study tracked genome expression profiles in 5 cohorts over 10 years. The research determined that sustained exposure to environmental toxins significantly altered gene methylation patterns, particularly affecting genes responsible for metabolic regulation. These epigenetic changes suggest a critical link between modern pollution and chronic disease onset. Further investigation is needed to identify specific biomarkers that can predict the severity of these disruptions, paving the way for targeted nutritional interventions. Question 1. What is the main purpose or finding of this passage? Pause the video now and write your answer before we reveal it. The correct answer is, pollution causes epigenetic changes linked to chronic disease. To answer this, you quickly scanned the first sentence and then jumped straight to the key action in the second. The central message is that environmental factors physically change our genes over time, leading to health issues. Question 2. Find a word in the passage that means change in gene function or activity. Pause the video now and write your answer before we reveal it. The correct answer is epigenetic. This requires focused scanning for specific terminology. Rather than reading the whole phrase, you're only searching your mind's database for the concept of gene change, which leads you directly to the key scientific term. Paraphrasing scientifically means restating complex information using your own words and sentence structure. It is not simply swapping out synonyms. You must fully understand the underlying mechanism first. The goal is to maintain 100% of the original meaning while making the text flow naturally into your academic writing. Think of it as translating a precise scientific concept from one linguistic framework to another without losing any detail. Remember that paraphrasing in science requires extreme precision. You are acting like an editor who has fully internalized the source material. The key difference between summarizing and paraphrasing is that paraphrasing usually keeps the level of detail similar to the original, just reorganized. Here are 4 examples. Original. The binding of acetylcholine to nicotinic receptors initiates a cascade that results in membrane depolarization. Focus shift. Active to passive voice. Notice how this example changes the grammatical structure. Instead of saying what binding does, we are focusing on the result, the membrane being depolarized. This slight shift can help vary your sentence rhythm throughout a paper. Original. Through oxidative phosphorylation, ATP is generated primarily using energy derived from nutrient breakdown. Vocabulary swap. Using conceptual synonyms. Here we replace derived from with generated by and nutrient breakdown with metabolic processes. The core meaning remains the same, but the vocabulary used is more sophisticated for academic writing. Original. Because cellular respiration requires oxygen as a terminal electron acceptor, anaerobic conditions halt ATP production. Reordering clauses, changing sentence flow. The original sentence used because, which establishes cause first. By starting with the conditioned anaerobic environments, we shift the focus and build suspense around the consequence. Original. The enzyme acts as a catalyst, significantly lowering the activation energy required for the reaction. Combining ideas, linking concepts. If you find 2 short sentences describing related processes, try combining them into one complex sentence. This improves the flow and demonstrates a high level of synthesis in your writing. Here are 3 reasons why this matters. Academic integrity. Paraphrasing prevents direct plagiarism by demonstrating synthesis of ideas. This is the most important reason. Simply changing 3 words won't save you. Your brain must prove it understands and can rebuild the concept in its own voice. Think of paraphrasing as intellectual proof. Improving flow. Varying sentence structure keeps the reader engaged and prevents monotony. A paper that uses only one type of sentence, for example, only subject-verb-object structures, will sound robotic. Varying your syntax makes the writing more dynamic and readable. Deep understanding. The act of rewriting forces you to deeply process and internalize complex concepts. If you can successfully paraphrase a difficult passage for a friend, it proves that your knowledge isn't just memorization, it is true comprehension. Use this skill as a study tool. Let's explore the topic of paraphrasing techniques, rephrasing complex biological mechanisms accurately. This is an important concept to understand for learning English effectively. This is a foundational concept when learning English. Understanding paraphrasing techniques, rephrasing complex biological mechanisms accurately deeply will unlock many other areas of the language. Think about how often you encounter this in real life and try to notice it in the English you hear every day. The more you engage with this idea, the more natural it will feel. Here are 4 ways to practice. The 3-step process. First, read the source material to grasp the core idea. Second, wait 5 minutes before writing anything down. Third, write your version and then compare it point by point. Waiting is critical because it forces you away from memory recall of the original phrasing. This mental gap allows you to rebuild the concept using only your own vocabulary pool. Focus on verbs. Identify the main action words in the source text and replace them with stronger, more academic verbs. Weak verbs like shows or ises make your writing passive. Instead, use powerful alternatives such as elucidates, demonstrates, or mediates. Stronger verbs immediately elevate your scholarly tone. Mapping key concepts. Before rewriting, map the relationship between key terms, cause, mechanism, effect. Use arrows and labels. If you can visually organize the logical flow why behind the science, you will never lose a critical nuance when translating it into text. The audience test. Read your paraphrase aloud and ask, does this sound like me or does it still sound like the textbook? Adjust until it sounds natural. This final check is invaluable. If you stumble over a sentence while reading it out loud, that means the structure is too convoluted for smooth communication. Simplify it. When analyzing global health policy reports, remember that every argument has a distinct structure. It usually starts with a central thesis, the main problem statement or proposed solution. This thesis is then supported by several claims, which are the specific points the report wants you to accept as true. Crucially, these claims must be tethered to evidence. The strongest reports clearly delineate what they argue versus the data that proves it. Our goal today is learning how to spot the weak links in this chain. Understanding argument structure moves us beyond simply reading words. We are analyzing logic. Think of an argument as a legal case. There's the premise, the evidence presented, and the conclusion drawn by the policymakers. If you can map out these 3 components, you can evaluate the overall strength and trustworthiness of their recommendation. Here are 5 examples. Vaccine uptake dramatically reduced local transmission rates during the trial period. Urord. Claim. Conclusion. This sentence is a conclusion. It asserts that low vaccine rates caused fewer transmissions. We need to look for the specific data points like comparative incidence metrics or time series graphs that actually support this strong causal statement. A multi-state analysis showed a clear inverse relationship between water sanitation access and diarrheal disease prevalence. Evidence. Data summary. This is the evidence. It summarizes a finding from a complex study. Notice how it uses statistical language like inverse relationship rather than emotional terms. This signals that the statement is grounded in quantitative research. Therefore, immediate investment in decentralized purification systems must be prioritized globally. Recommendation. Action point. This sentence is the policy recommendation. It's the so what moment of the report. Always keep an eye on these strong verbs and directive language, as they tell you exactly what action the authors want you to support. Interventions that focus solely on distribution without accompanying behavioral change campaigns have proven insufficient. Counter. Argument. Limitation. A good report acknowledges its own limitations or the weaknesses of past studies. Spotting these counter-arguments is vital because they show intellectual honesty and often lead to more nuanced policy suggestions. The World Health Organization recommends establishing localized surveillance networks by year 2. Authority. Source. This establishes authority. If a recommendation is backed up by citing major international bodies or peer-reviewed consortia, it adds significant weight to the argument. Always ask, who is making this claim and are they qualified? Here are 3 reasons why this matters. To uncover underlying assumptions. Reports often assume certain conditions are always true without stating them. The biggest trap in policy reading is accepting unstated assumptions. For example, a report might assume stable political funding. If that assumption fails, the entire recommendation collapses. We must actively look for anything that must be true for their argument to hold up. To distinguish correlation from causation. Just because 2 things happen together does not mean one caused the other. This is perhaps the most critical skill. The report might show that poor sanitation and high disease rates are related, but we must determine if it's the lack of sanitation causing the disease, or if there is a third factor like malnutrition or poverty that is causing both. To identify scope limitations. Understanding what the data was not designed to measure. Every study has boundaries. Did they only survey urban areas? Were their statistics limited to a specific age group? By identifying these limitations, you can critique the policy's applicability and make your analysis much stronger. Watch out for these 3 common mistakes. Flawed reasoning, causation. Because region A has high rainfall and low malaria rates, we should conclude that rain prevents disease. Measured critique. While region A has high rainfall and low malaria rates, further investigation is needed to rule out confounding variables, such as improved public health education. This error assuming causation simply because 2 things correlate is extremely common in policy writing. A strong academic response never makes a definitive causal link. It always suggests the need for further, controlled study to isolate variables. False dichotomy. The cost of implementing this program is negligible compared to the total burden of disease. Balanced weighing. While the upfront costs are significant, they must be weighed against potential long-term economic benefits and the projected avoided costs associated with the disease. A false dichotomy presents only 2 extreme choices when multiple options exist. Skilled analysis requires moving beyond either this or that and considering a spectrum of cost-benefit solutions, incorporating feasibility and resources. Appeal to emotional authority. Everyone knows that global health equity requires universal vaccination. Pragmatic nuance. Achieving global health equity necessitates scalable strategies for vaccine distribution, addressing both logistical and socio-political barriers. Sometimes arguments rely on emotional appeals or overly broad statements of moral truth. We must rephrase these sweeping claims into actionable, measurable policy goals that acknowledge real-world resource constraints and political realities. Here are 4 ways to practice. Develop a 3-column note-taking system. Use columns for thesis claim, supporting evidence, data, and my critique, gaps assumptions. Maintaining this system throughout your reading forces you to engage critically rather than passively accepting the text. By physically writing down your critique in a separate column, you are practicing intellectual distance from the report's narrative. Ask how and under what conditions. Never accept a claim. Always ask for the mechanism or prerequisite factors. When you find an intervention recommendation, don't just accept it. Ask, how exactly will this be implemented in rural areas with limited infrastructure? This level of questioning transforms reading into actionable policy consulting. Summarize the argument using a single sentence. After finishing a section, force yourself to summarize its core argument and assumption in 1 clear sentence. This is an excellent metacognitive exercise. If you cannot reduce their entire complex point into 1 precise sentence for yourself, it means you haven't fully deconstructed the logic yet. This builds immediate comprehension. Cross-reference discrepancies. If a claim in Chapter 2 contradicts data presented in Appendix C, flag both sections. Global health reports are massive documents and can contain internal inconsistencies. Developing the habit of cross-referencing ensures that you build a complete picture of the argument, noting where the authors may have contradicted themselves. Inferential reading means going beyond the literal words on the page. It's about using the evidence provided by the text, combining it with your existing knowledge to draw a logical conclusion that the author did not state directly. In preventative medicine research, we often encounter statements of correlation, causation, and potential risk factors. Instead of asking, what does this say, you must ask, what must this mean? This skill is crucial because scientific writing rarely uses definitive language. It suggests, implies, or recommends. Remember that inference is not just guessing. It is a structured process of logical deduction. When you read studies, look for qualifying language like may suggest or is associated with. Those phrases are invitations to inferential thought, guiding you toward the deeper implications of the data. Here are 4 examples. The study noted a statistically significant decrease in incidence rates for condition X among participants who maintained high dietary fiber intake. Keyword, statistically significant, and decrease requires inferring effectiveness. When you see terms like statistically significant, it means the finding is unlikely due to random chance. Your task here is to synthesize that data point with your knowledge of health science. You are inferring a potential preventative benefit, even if the study didn't definitively prove cause and effect. Follow-up research focusing on genetic markers related to inflammation is warranted. Keyword, warranted, implies gaps in current knowledge. The phrase warranted is a powerful signpost for inference. It tells you that the authors themselves believe there are missing pieces of information. Your job is to fill those conceptual gaps by identifying what kind of research they need next. Intervention. A showed promise in early trials but requires replication in diverse populations. Showed promise and requires replication implies caution limitation. This segment asks you to read between the lines regarding reliability. The authors are being cautious, which means your conclusion cannot be absolute. You must infer that the findings are preliminary and need broader validation before clinical recommendation can be made. Observed outcomes suggest a strong correlation between regular exercise and improved metabolic markers. Keyword, correlation versus causation, requires cautious conclusion drawing. This is perhaps the most critical point in reading medical research. When you say correlation, do not jump to causation. You must infer that while a link exists, another factor or confounding variable could be responsible for both outcomes. Let's compare 4 pairs. Direct reading. Patients reported a reduction in symptoms. Inferential reading. The intervention likely improved patient quality of life. Fact versus interpretation. A direct reading simply reports what was perceived or observed. The inferential reader, however, translates that raw observation into a broader implication about the patient's overall well-being or health status. Text type, randomized controlled trial, RCT. Text type, observational cohort study. Strength of evidence. An RCT is the gold standard because it minimizes bias. When reading, if you know a study was observational, your inference must be much softer and more tentative than if the study design was an RCT. Reading strategy, summarizing main points. Reading strategy, inferring underlying assumptions. And what versus why. Summarizing focuses on what's the text says the facts and key findings. Inferring forces you to ask why the authors structured their argument the way they did, revealing the assumptions that underpin the entire study. Medical jargon, prevalence rate. Inferential use, population risk. Definition versus application. Understanding a medical term like prevalence is basic comprehension. But to infer population risk means you must apply that percentage to real-world demographics. For example, realizing that high child rates increase the overall regional risk. Complete the summary using words from the passage. Although initial results were promising, researchers must remain cautious because many studies are only observational and do not establish direct blank. Pause the video now and fill in the blank before we reveal the answer. The correct answer is causation. The word causation is the core concept you need to remember when reading research. It represents the definitive link that one factor actively creates another. Inferring that causation exists requires an extremely high level of evidence, typically only found in highly controlled studies. Therefore, future preventative efforts should focus on multimodal approaches rather than relying solely on a single blank. Pause the video now and fill in the blank before we reveal the answer. The correct answer is intervention. Here, we are moving from identifying a problem to suggesting a solution. The word intervention is broad enough that it suggests testing multiple types of treatments or lifestyle changes simultaneously, making the conclusion more robust. The analysis revealed that socioeconomic status acts as a major confounding factor, potentially mitigating positive effects from even strong blank. Pause the video now and fill in the blank before we reveal the answer. The correct answer is practices. A confounding factor is something else lurking in the background that makes it hard to prove anything. By identifying this word, you can infer that any conclusion about a single practice must be adjusted downwards because of external social variables. Ultimately, while these findings warrant further study, they suggest preventative medicine is highly effective when combined with robust community blank. Pause the video now and fill in the blank before we reveal the answer. The correct answer is outreach. This final sentence requires you to synthesize the entire passage, the promise of science, and the need for real-world action. Outreach suggests not just knowing the facts, but actively getting those facts into people's daily lives. Here are 4 ways to practice. The signpost technique. Look for signaling words, therefore suggests, implies, indicates. These phrases signal where the author expects you to draw an assumption. When reading academics, these signposting verbs are your roadmap. They don't just guide your reading, they guide your critical thinking process, pointing directly at the area that requires a logical leap rather than simple recall. The 3 passes method. First pass, skim for context. Second pass, identify claims. Third pass, challenge assumptions. Ask, how do they know this? This is a systematic approach to deep reading. The third pass, specifically challenging the assumptions, forces you into an active role as a critical thinker rather than a passive receiver of information. Differentiating evidence levels. Always classify claims. Is it anecdotal evidence, a story, correlation, or established causation? Not all evidence holds equal weight. By training yourself to immediately categorize the type of proof presented from a simple anecdote to peer-reviewed data, you greatly improve the intellectual rigor of your final. Delusion. Practicing null hypothesis thinking. Before accepting a finding, assume the opposite is true. This forces you to find flaws or counter-evidence in the argument. This is advanced critical thinking modeled after scientific methodology. By adopting this mindset, you become an internal skeptic, which is one of the most powerful tools for improving your ability to form balanced, accurate inferences. Now it is your turn to practice. Read or listen to the following passage carefully. A recent meta-analysis reviewed 10 studies on vitamin D supplementation and bone density in elderly populations. While initial results were encouraging, showing higher levels correlated with lower fracture rates, the authors cautioned that the dosage varied widely among trials, making direct comparison difficult. Furthermore, several participants had underlying vitamin K deficiencies, which may confound the true effect of vitamin D alone. The data suggests that while supplemental intake might be beneficial, it must be coupled with robust dietary calcium sources and regular physical activity to solidify any preventative benefit. Question 1. What is the main conclusion about vitamin D supplementation? Pause the video now and write your answer before we reveal it. The correct answer is, it is helpful but must be combined with diet and exercise. Standalone use is insufficient. The authors do not give a simple yes or no. Your job was to read for the necessary caveats. The key takeaway isn't the existence of vitamin D, but its role as one piece of a comprehensive preventative puzzle. Question 2. Find a word in the passage that implies uncertainty about research findings. Pause the video now and write your answer before we reveal it. The correct answer is confound. The word confound is excellent to spot because it means something else is mixing up or complicating the data. When you see this, your inference must immediately pivot. Don't trust the conclusion until those confounding variables are controlled for. When discussing health issues, simple words like sickness or fix often aren't precise enough for professional settings. We need vocabulary that conveys academic depth and clinical accuracy. This lesson focuses on recognizing synonyms for diagnosis, disease states, and therapeutic actions. Mastering these advanced terms will help you transition from basic conversation to truly sophisticated medical discourse. Understanding the nuance between words like symptom and sign or illness and pathology is key. The goal here isn't just memorization, it's shifting your register. Think of these target words as tools that allow you to be highly precise, which is crucial when discussing complex scientific topics. By learning synonyms, we improve not only the vocabulary, but also the overall sophistication and authority of your speech. Let's go through 6 words. For each word, I will say it clearly, then explain how to produce it correctly. The word is pathology. Say it again, pathology. When you talk about pathology, you are referring to the scientific discipline, not just a bad outcome. It emphasizes the detailed study required to understand why something is wrong. Remember that this word has an academic weight, making it ideal for formal presentations. The word is ailment. Say it again, ailment. Ailment is often used for less severe, more temporary issues than a full-blown disease. If you want to downplay the seriousness slightly while still sounding academic, ailments works perfectly. It has a gentler tone than describing a major condition. The word is assessment. Say it again, assessment. While diagnosis is this finding, the assessment is the process leading to that finding. Use this word when describing the comprehensive actions taken by a medical professional, like running tests or conducting interviews. It highlights the effort of evaluation. The word is morbid condition. Say it again, morbid condition. This phrase is excellent for academic writing because it sounds highly formal. It's more encompassing than just saying illness, covering the entire spectrum of persistent, serious health issues. When you see this in a report, know that they are talking about systemic problems. The word is therapy. Say it again, therapy. Be careful not to confuse therapies with the general term treatment. Therapy often suggests a specific, systematic approach like speech therapy or physical therapy. It implies rehabilitation and active recovery methods. The word is prognosis. Say it again, prognosis. Prognosis is all about prediction, which sets it apart from diagnosis. Diagnosis tells you what the problem is right now, but prognosis tells you what will happen next. This word requires careful phrasing since it deals with future uncertainty. Here are 5 examples. The first step in understanding the illness was a detailed psychological assessment. Assessment, N. Notice how assessment here is used to cover more than just physical tests. It shows that professional evaluation can be multifaceted, incorporating mental, emotional, and physical checks. This broad usage expands the word's utility greatly. Early detection of this rare ailment significantly improved the patient's recovery chances. In. The placement of early detection emphasizes that even a minor condition can be critical if caught quickly. Using ailments here keeps the tone manageable while still being formal enough for medical discussion. Understanding the underlying pathology is essential before recommending any treatment plan. Pathology, N. This sentence clearly shows that pathology serves as the foundational knowledge. You must know what is wrong at a deep cellular level test pathology before you can suggest the best fix. The goal of the long-term therapy was to rebuild muscle strength and mobility. Therapy, in. This example clarifies that therapies often involves active participation from the patient. It suggests recovery through structured exercises rather than just taking medication, which is a major distinction. Despite the chronic morbid condition, the prognosis remained cautiously optimistic. Prognosis, in. This sentence masterfully combines morbid conditions and prognosis. We know the problem is severe morbid condition, but we are still hopeful about the future outcome. Keeping the language balanced. Let's compare 4 pairs. First, diagnosis. Compare it with assessment. Finding versus process. Think of it this way. The assessments is the entire investigation, the interviews, tests, and observations. The diagnosis is just the final conclusion derived from that thorough process. One describes the method, the other describes the result. First, ailment. Morbid condition. Severity difference, mild versus chronic severe. This pair demonstrates controlled vocabulary use. If you are speaking casually or writing about something minor, ailment is appropriate. But for formal reports detailing long-term care, morbid conditions carries the necessary weight. First, diagnosis. Compare it with prognosis. Current state versus future outcome. This is perhaps the most common mix-up in clinical language. Always remember that diagnosis answers the question, what is it now? While prognosis answers, where will this go? It's a critical distinction for clear communication. First, treatment. Compare it with therapy. Broad action versus specific method rehab. While often used interchangeably in common speech, therapies implies a structured regimen aimed at restoring function, like physical or cognitive exercises. Use treatments for the broader concept of medical care itself. Here are 4 ways to practice. Word mapping, visualizing synonyms. Create mind maps connecting the core concept, e.g., illness, to related terms like ailment, morbid condition, and pathology. Don't just make a list, draw connections on your map arrows labeled with degree of severities or academic formality. This visual process helps cement the subtle differences between synonyms in memory. Collocation drills, noun-verb pairing. Practice pairing words like conduct and assessments or alleviate symptoms to build natural phrases. High-level language often relies on correct collocations. Instead of just knowing the word, practice saying it with common academic verbs. This makes your speech sound immediately more fluent and native. Contextual substitution, replacing words in texts. Take a simple paragraph and replace sickness or cure with our target vocabulary, ensuring the tone remains correct. This is the most effective way to build automatic recall. By forcing yourself to substitute terms while maintaining narrative flow, you train your brain for instant, accurate word retrieval in high-stakes situations. Spaced repetition, reviewing vocabulary over time. Schedule short reviews of these words days and weeks apart, focusing on definition and usage rather than just rote recall. Vocabulary retention is not linear. To make sure these sophisticated terms stick long-term, you must review them using spaced repetition. Focus your review questions on nuance. Why would I choose prognoses over diagnosis? Now it is your turn to practice. Read or listen to the following passage carefully. The initial assessment revealed signs of a rare ailment. Experts immediately ordered detailed pathology reports to determine the primary cause. While the diagnosis was challenging, the long-term prognosis appeared stable enough for specialized physical therapy. They advised that consistent treatment would manage the underlying morbid condition effectively. Question 1. Find a word in the passage that means a predicted course of health. Pause the video now and write your answer before we reveal it. The correct answer is prognosis. When you see prognosis, think forward. The other words describe what is happening now or what was found previously. This question tests your ability to distinguish between a current state and a future forecast, which is vital in medical summaries. Question 2. Use any of the target vocabulary words, pathology, assessment, therapy, etc. in your own sentence describing a non-medical situation. Pause the video now and write your answer before we reveal it. The correct answer is, the team conducted a thorough assessment of the marketing data to improve our strategy. To truly internalize these academic terms, practice cross-domain usage. By applying medical vocabulary like assessment or pathology to fields like business or writing, you demonstrate that your command of the word is conceptual, not just memorized. When reading about clinical trials, don't just read for facts, you must analyze the methodology itself. Think of it like being an auditing expert on paper. Your goal is to determine if the study design was robust enough to prove its claims. Always look for 3 key elements: randomization procedures, control groups used, and primary outcome measures. These components reveal the study's strength, potential biases, and overall validity. Remember that excellent science writing requires transparency about its limitations. When you are analyzing a methodology section, treat it like an investigation. Are they detailing how they assign participants? Is the control group truly comparable to the treatment group? Asking these deep questions turns reading into critical thinking. Here are 4 examples. Participants were allocated using a stratified randomization block approach. Identifying the specific type of randomization used. The term stratified randomization is highly technical. By spotting this phrase, you know the authors took extra care to balance known variables between groups. This detail significantly boosts the study's credibility. The primary endpoint was defined as a 6-month change in biomarker X concentration, pinpointing the measurable outcome variable, the what. An article can report many things: side effects, patient satisfaction, etc., but you must locate this primary endpoint. This is the one measure the authors claim proves efficacy. Everything else is secondary data. Both groups were assessed using a double-blind methodology. Identifying blinding techniques, who knows what? Double blinding means neither the patient nor the researchers administering the care know who got the placebo. Spotting this is crucial because it eliminates observer bias and vastly increases reliability. Statistical significance was set at a 2-sided alpha of 0.05. Locating the statistical threshold or test parameters. This phrase tells you exactly what mathematical standard they used to determine if their results were real or just due to chance. Understanding this helps you evaluate whether the findings are statistically sound. Let's compare 4 pairs. The methods section, protocol. The discussion section, interpretation. Focus, how the study was done versus what it means. The methods section is factual and directive. It answers how. The discussion, however, takes those facts and builds an argument around them. Answering so what? Always separate the evidence from the interpretation. First, controlled. Observational cohort study data. Causality, stronger claim of cause and effect. In a randomized trial, you control who gets what treatment. In an observational study, you just watch people naturally. This difference means the RCT can make much stronger claims about causality. Quantitative measures, numbers. Qualitative reports, interviews. Data type, objective versus subjective evidence. Quantitative data gives measurable proof, like a percentage reduction in symptoms. Qualitative reports give depth, the patient's lived experience, which is vital but cannot be statistically averaged. Study limitations, acknowledged weakness. Potential biases, your critical questions. Perspective, authorial admission versus reader critique. When authors list limitations, they are being honest. Your job is to validate if those stated limits truly undermine the main finding. Always question whether a limitation was adequately addressed. Complete the summary using words from the passage. The study utilized a randomized controlled trial design, ensuring the participants were allocated to groups using blank. Pause the video now and fill in the blank before we reveal the answer. The correct answer is randomization. When you see randomized, it means the assignment was based purely on chance, which is key for minimizing selection bias. This technique strengthens the entire study framework. The primary outcome measured was not just survival rates, but also a change in blank concentration over 6 months. Pause the video now and fill in the blank before we reveal the answer. The correct answer is biomarker. Focusing on the biomarker means you are looking beyond simple human outcomes. You are tracking objective biological markers that can be measured in blood or fluid. To ensure accuracy, researchers employed a double-blind protocol where neither staff nor patients knew which substance was blank. Pause the video now and fill in the blank before we reveal the answer. The correct answer is active placebo. The term double-blind is your immediate flag for high methodological rigor. It protects the results from subconscious influence or expectation bias. Therefore, while the findings are promising, future research must address potential confounding variables like blank status. Pause the video now and fill in the blank before we reveal the answer. The correct answer is dietary. The mention of confounding variables is a huge signal that the authors acknowledge external factors. These are details you should remember because they point to where further study is needed. Here are 4 ways to practice. Create a methodology map. Draw a flowchart detailing the study design, participants, exclusion criteria, allocation method, interventions, primary outcome. Don't just read the methods section, visually map it out. This process forces you to identify every single operational step, making the structure of the research crystal clear in your mind. Question: assumptions constantly. Whenever a result is presented, ask, what assumptions must be true for this finding to hold? For example, was compliance consistent? Every scientific conclusion rests on certain assumptions. By preemptively questioning these, you move past passive reading and become an active, skeptical critical thinker. Identify the gold standards test. Be aware of established benchmarks in the field, like PET scans or specific genetic markers when analyzing results. If a study claims to measure something, check if they are using the current industry gold standard test. If they are using an outdated method, their findings must be treated with extreme caution. Differentiate correlation from causation. Never confuse 2 things happening together, correlation, with one thing directly causing another, causation. Look for intervention groups. This is the most common logical error in interpreting scientific literature. If you cannot point to a direct manipulation or intervention that caused the change, treat it as correlation only. Now it is your turn to practice. Read or listen to the following passage carefully. A recent meta-analysis reviewed 3 large-scale randomized controlled trials examining the efficacy of compound Z versus standard care for type 2 diabetes. Key findings were derived from analyzing changes in HbA1c levels, which served as the primary endpoint. All included studies adhered to a double-blind protocol and utilized stratified randomization based on age groups over 50. However, the inclusion criteria excluded patients with complex comorbidities, potentially limiting generalizability to high-risk populations. Question 1. What is the most immediate strength of this study design? Pause the video now and write your answer before we reveal it. The correct answer is the use of randomized controlled trials and double-blinding. When you see randomized controlled trials combined with double-blind, these are your strongest markers. They indicate a massive effort to eliminate bias, making the results highly reliable. Question 2. If you were critiquing this study, what is its greatest methodological weakness? Pause the video now and write your answer before we reveal it. The correct answer is exclusion of patients with complex comorbidities. The phrase, potentially limiting generalizabilities, points directly to the flaw. This means that while the results are great for a select group, they might not apply universally. When approaching an academic medical abstract, remember that you are not reading a story, you are extracting hard data. Most abstracts follow a predictable structure. They state the objective, detail the methods used in the study, present key results, and conclude with implications. Focus your initial read on identifying these 4 sections quickly. This systematic approach prevents you from getting bogged down in overly detailed background information. Think of this process like using a scientific database search filter. Instead of reading every sentence linearly, you are trained to immediately locate the what, the how, and most importantly, the so what. Developing this habit will dramatically improve your efficiency when reviewing literature. Here are 5 examples. Relative risk increased by 3.5, PAs are 1. Statistical significance label. When you see p-value less than 0.01, it means the finding is highly unlikely to have occurred by chance alone. This suggests a genuine, statistically robust connection between the variables studied. Mortality rates were comparable, CI 95% to 102%. Confidence interval, CI, label. The confidence interval tells you the range where the true effect likely falls. If this range includes 1, it often suggests that there is no significant difference between two groups. Participants demonstrated a mean decrease of 15%, SD, 4. Descriptive statistic label. The mean is the average change observed in the group. The standard deviation gives you an idea of how spread out or consistent those individual results were. A correlation coefficient of RC0.78 was found. Correlation coefficient label. This number indicates the strength and direction of a relationship. A negative value means that as one factor increases, the other tends to decrease. Only 3 out of 50 participants completed the follow-up. Sample size attrition rate label. Always pay attention to sample size limitations. A very small number of completers suggests the results might not be broadly generalizable to a larger population. Here are 3 reasons why this matters. Efficiency in literature reviewing. You must quickly determine if a study is relevant to your topic. In academic medicine, time is severely limited. You cannot afford to spend hours reading every paper. You need to filter for actionable data points instantly. Establishing causal relationships. Understanding how correlation differs from causation. A common mistake is assuming that because two things happen together, one caused the other. Strong evidence requires careful analysis of study design and statistical controls. Informing clinical practice. Providing evidence for treatment protocols. Medical recommendations are built on aggregated data from multiple sources. Your ability to interpret abstracts directly informs your clinical decision-making abilities. Watch out for these 3 common mistakes. Don't assume causality. The treatment was highly effective because the results were positive. Focus on possibility. The study suggests a potential benefit that requires further research. Never let enthusiasm for a finding override methodological caution. Remember that an abstract is merely a summary, and the true conclusions must be drawn by the full study authors. Don't equate no finding with proof of failure. The negative p-value proves the treatment failed. Say insufficient evidence. A non-significant result means we lack sufficient evidence to claim a difference. Lack of statistical significance is not the same as proving zero effect. It simply means that, based on this sample size and methodology, the study could not detect a reliable difference. Don't generalize without boundaries. All patients in the abstract are suitable for my specific case. Apply clinical judgment. The findings should be considered alongside patient-specific risk factors. Every human study has limitations regarding demographics, comorbidities, and inclusion criteria. Always interpret data within the specific context of the cohort presented. Here are 4 ways to practice. The highlighter method. Only highlight numbers, statistical terms, and main conclusions. When you first read the abstract under time pressure, physically or mentally restrict your focus to these high-yield elements. This trains your brain to filter out filler text immediately. Prediction questioning. Before reading the results section, predict what outcome is most likely. This active technique forces you to engage with the material critically. If the actual result contradicts your prediction, you must pause and analyze why it might be different. Post-read summary writing. Write a 3-sentence summary: objective, key finding, limitation. This mimics the structure of an effective literature review entry. By forcing yourself to summarize rapidly and concisely, you solidify your understanding before moving on. Timed comparison drills. Read 2 abstracts back-to-back, comparing their methods or outcomes. To truly master interpretation, practice comparing studies. Asking, how does Study A's sample size compare to Study B's, significantly deepens your critical reading skills. Task 1 in scientific visualization requires you to describe, summarize, and report the main trends shown in complex data graphs. Unlike simple process diagrams, these visuals often involve multivariable changes over time or comparisons between groups. Your goal is not just to list numbers, but to synthesize patterns and highlight significant divergences. You must structure your response logically, moving from an overview statement to detailed evidence. When tackling scientific data, remember that summarize is a key instruction word. This means you should be selective. Do not report every single data point. Instead, group similar trends and dedicate your language to discussing the relationships between variables. For example, how one factor influenced another across different time periods. Here are 4 examples. The graph reveals a clear parabolic relationship. Incidence rates peaked in the late 1990s before declining steadily to their lowest point by 2015. This suggests a successful intervention period. Effective use of trend language and interpretation suggests. Notice how this example doesn't just state rates went up then down. It uses sophisticated verbs like peaked and the noun phrase parabolic relationship, which immediately elevates your academic tone. Always aim for a high level of descriptive vocabulary when discussing movement. In stark contrast to Region A, where consumption remained stable, Region B showed exponential growth between 2010 and 2020, nearly tripling its usage. Strong contrasting language, stark contrast, and quantification, tripling. When comparing multiple lines or bars, always structure your comparison using strong linking phrases like in stark contrast to or. Conversely, this shows the examiner that you can manage complex relational ideas simultaneously. While most demographics showed gradual improvement in biomarker levels, only the age group over 60 exhibited a statistically significant plateauing effect after the initial decline. Focus on specific groups and nuanced scientific terms. Biomarker, plateauing. Scientific writing demands precision. Instead of saying it got worse better, use technical language like statistically significance or exhibited a plateau. This specialized vocabulary is crucial for scoring highly in task achievement. Overall, the data indicates that while renewable energy sources are increasing steadily, their contribution still lags significantly behind fossil fuels, necessitating immediate policy shifts. A conclusive overview statement summarizing the main takeaway. Never leave your reader hanging. Every Task 1 response must conclude with a powerful overview paragraph that synthesizes the single most important message from all the data presented. This is often what separates a Band 6 from an 8. Let's compare 4 pairs. Consumption rose in the first quarter and then it dropped a lot. Consumption saw a sharp increase during the first quarter, which was followed by a marked decline throughout the subsequent period. Using academic verbs, saw declined instead of simple linking words. The key difference here is transforming casual spoken English into formal academic prose. Replacing dropped with marked decline immediately increases your lexical resource score and elevates the tone to a scientific register. Group X was higher than Group Y for most of the years shown. Throughout the period, Group X consistently maintained significantly higher values compared to those recorded for Group Y. Using adverbs and complex structures consistently throughout instead of simple comparisons. Avoid repetitive comparative phrases like was more than or higher than. Instead, use sophisticated intensifiers and adverbial clauses. This demonstrates fluency in handling abstract relationships between datasets. The graph shows 2 lines that went up at the same time. Both metrics demonstrated a parallel upward trajectory across the entire measured time frame. Using precise, specialized vocabulary, trajectory, metric for description. When variables move together, they are moving in tandem. Instead of saying went up at the same time, use terms like parallel or correlated. This demonstrates a deeper understanding of data relationships beyond simple plotting. Overall, people should do more renewable energy. In conclusion, while transition efforts are underway, the data strongly suggests that policy must prioritize accelerating investment in sustainable energy sources, providing an analytical recommendation rather than a simple restatement of the obvious. A top-scoring response doesn't just describe what happened, it implies what should happen based on the evidence. By framing your conclusion as a policy implication, you move from description to genuine analysis. Watch out for these 3 common mistakes. Weak. The number of cases increased from 10 to 20 over the period. Strong. The incidence rate rose sharply, increasing from an initial figure of 10 to 20 instances by the end of the period. A common mistake is being too numerical. The examiner doesn't want a list of numbers, they want narrative flow. By embedding the data points within a descriptive sentence, you improve coherence and avoid sounding like an enumeration. Weak, Group A was better than Group B in all years. Strong. Throughout the measured period, Group A consistently outperformed Group B across every monitored metric. Avoid using simple comparative adjectives like better or worse. Instead, use high-level verbs like outperformed, exceeded, or lagged behind. This vocabulary specificity is essential for reaching the highest band scores. Weak, the two lines showed a big difference in 2015. Strong, a marked divergence was observed in 2015 when the gap between the two metrics reached its widest point. When describing differences, use sophisticated nouns and phrases related to gaps or distances. Terms like divergence, discrepancy, or gap are much more academic than simply saying difference. This adds intellectual weight to your writing. Here are 4 ways to practice. Deconstruct the visual first. Identify the variables x and y axes, the units of measurement, and the time frame. Sketching this helps you organize your ideas. Before writing a single word, spend 2 minutes mapping the data's core components. Knowing what the axes represent allows you to use highly specific vocabulary when measuring concentration. Percentage? You'll go see. Use that unit in your description. Master signal versus noise. Distinguish between major, consistent trends, signals, and minor, temporary fluctuations noise. Focus only on the signals. In scientific data, everything is not equally important. The strongest trend, the one that dictates the overall meaning, is the signal. Your analysis must prioritize this main takeaway over describing every little blip or anomaly. Write a mental thesis statement. Before writing, formulate a single sentence summarizing the data's ultimate conclusion. This guides your entire structure. This thesis statement is your guiding star. If you lose focus during drafting, refer back to this central idea. Structuring your body paragraphs to prove or elaborate on this initial claim ensures coherence and logical progression. Vary your reporting language. Use synonyms for verbs increased, plummeted, stabilized, and adverbs significantly, marginally, drastically. The sheer breadth of your vocabulary is key. Don't repeat showed or went up. By having a repertoire of academic alternatives, you maintain high lexical variety even when describing similar data movements. Reviewing data visualizations requires a specific skill set that goes beyond simple reading. This process is called synthesis. It means taking multiple pieces of discrete information like different lines on a graph or separate sections of text and combining them into one coherent, high-level overview. When summarizing scientific graphs, your goal is never to list every single number. Instead, you must identify the primary trend and any significant deviations from that norm. Think of synthesis as being the executive summary for a graph. You are not listing data points, you are telling the story the data tells. Always ask yourself, what is the most important thing this graph shows? Focusing on trends, comparisons, and extremes, the peaks and troughs, is how you move from simple description to advanced academic analysis. Here are 4 examples. Overall, the graph demonstrates a clear inverse correlation between exposure level and recovery rate. Identifying the main trend relationship, the overviews. Notice how this sentence uses strong academic linking words like demonstrates and inverse correlation. This immediately sets up your conclusion. When you start a summary, always state the overall relationship first. Is it increasing, decreasing, or non-existent? A notable exception was seen in Group C, which maintained stable results throughout the trial, highlighting a significant outlier or deviation from the norm. If everything is following one trend, the exceptions are often the most important part of your summary. Phrases like notable exception or deviated significantly make sure that the reader knows this specific point contradicts the general rule. The highest rate was recorded during the second quarter, peaking at nearly 40%. Pinpointing the absolute maximum value, the peaks. Don't just say it went up, Be precise. Using verbs like peaking or nouns like maximum incidence gives your description academic weight and clarity about the scale of the finding. By contrast, Group A began with substantially lower figures than those observed in Year 1. Direct comparison between two separate groups or time points, contrast. The word contrast is your best friend when summarizing. It signals a direct comparison and allows you to structure your sentences using comparative language such as whereas or in contrast to. Let's compare 4 pairs. Describing raw data, listing facts. Summarizing findings. Identifying trends. Focus on the WHY, not just the WHA. Raw data description is simply listing numbers chronologically. Synthesis requires you to explain why those numbers matter. Instead of saying, it went from 5 to 10, say, there was a sharp increase, suggesting, this elevates your analysis. Focusing solely on the x-axis, independent variable. Integrating both axes, relationship. Always mention how one variable affects another. A graph has 2 dimensions, and you must address both. Don't just describe what happened over time. Explain how that change in time influenced the outcome shown on the y-axis. The relationship is key. Using simple vocabulary, up, down, big. Using academic register, increased, decreased, significant. Upgrade your verbs and adjectives. When writing for a Band 7 or higher score, the language must match the topic's formality. Replace general words with sophisticated academic vocabulary to sound authoritative and precise. Writing multiple short sentences. Using complex sentence structures, subordination. Combine ideas using conjunctions. Instead of writing 3 separate simple statements, combine them into one detailed sentence. Use subordinating conjunctions like although or while to show logical connections between your findings. Complete the summary using words from the passage. The initial phase showed a steady rise, suggesting that early intervention was poll-time for the patient group. Pause the video now and fill in the blank before we reveal the answer. The correct answer is effective. This blank requires you to synthesize the meaning of the data point. You are not just reporting it went up, you are interpreting what that rise implies about treatment success. Always link the trend back to a conclusion. However, by the final month, rates began to decline sharply, particularly in those who saw proper lifestyle changes. Pause the video now and fill in the blank before we reveal the answer. The correct answer is neglected. The key here is identifying the cause and effect relationship. The graph showed a drop. That drop must be linked to an action or inaction by the subjects. This requires deep reading and inference. Overall, while Group X performed well initially, its performance ultimately those of Group Y. Pause the video now and fill in the blank before we reveal the answer. The correct answer is lagged behind. The phrase ultimately lagged behind is a perfect academic summary. It efficiently compares the start and end points for 2 different groups in one powerful verb structure. Therefore, it can be concluded that prolonged exposure to low-level radiation has a Bean's quote impact on cellular division. Pause the video now and fill in the blank before we reveal the answer. The correct answer is detrimental. This final gap asks for a definitive conclusion based on the entire dataset. Your answer must summarize the long-term implication of all the observed data using strong academic adjectives. Here are 4 ways to practice. Pre-visualization planning, the 30-second scan. Before reading any text, quickly identify the graph's title, axis labels, and legend. This creates a mental map of the data structure. Never start summarizing before you know what you are looking at. Spending 30 seconds just labeling your internal map. Oh, this measures X against Y over time will dramatically improve your ability to organize your spoken summary. Structuring your summary, the 3-part rule. Follow a consistent structure. 1. Overview trend. 2. Supporting details peaks. 3. Conclusion a contrast. Structure is your safety net. If you follow this three-part pattern, even if you miss a minor detail, the overall flow of your summary will be logical and highly coherent. Always deliver the big picture first. Using linking phrases, signposting. Use phrases like, conversely, in comparison to, this suggests that, or overall, it is evident that. These linking phrases are crucial for sounding cohesive. They act as signposts for the listener, guiding them through your complex analysis and demonstrating high-level command of discourse markers. Paraphrase the data, don't quote it. Never read numbers directly from the graph into your summary. Rephrase the meaning of the change. Listing, the figure stood at 45% in June as weak writing. Instead, paraphrase, by June, the percentage had reached its zenith. Paraphrasing shows mastery and ensures you are interpreting data, not just reading it. Now it is your turn to practice. Read or listen to the following passage carefully. A recent study tracked the decline of rainforest canopy cover across 3 continents over 2 decades. The data consistently shows that while deforestation rates initially plateaued between 2005 and 2010, subsequent years saw a marked resurgence in clearing activities. Notably, tropical regions exhibited an average annual loss rate of 4%. This trend is strongly correlated with global agricultural expansion, suggesting that economic pressures remain the primary catalyst for habitat reduction. However, areas protected by strict international treaties displayed significantly lower and often stable levels of degradation. Question 1. What is the main idea or overall finding of this passage? Pause the video now and write your answer before we reveal it. The correct answer is, deforestation rates show a resurgence, primarily driven by agricultural expansion, but are mitigated in protected areas. The key here was identifying the central argument. Do not get lost in the dates or percentages. Synthesize the core message, what is driving the loss and what is preventing it. The overall trend dominates the specific data points. Question 2. Find a phrase that means increased sharply. Pause the video now and write your answer before we reveal it. The correct answer is marked resurgence. When you need to find vocabulary in context, look for strong academic verbs or nouns. Instead of just "it went up," the text used resurgence, which is a much more precise and formal way to describe that sharp increase. Describing trends involves more than simply listing numbers. It requires identifying the direction and speed of change over time. When analyzing public health statistics such as vaccination rates or incidence of chronic illness, you are looking for patterns, steady increases, sharp declines, or sustained plateaus. For IELTS writing, this skill is crucial because it moves you beyond simple data reporting into sophisticated analysis. You need to interpret what the data means, not just what the numbers are. When discussing trends, remember that strong academic vocabulary is key. Instead of saying, "it went up," use phrases like "experienced a marked surge" or "saw a gradual escalation." This elevated language immediately boosts your lexical resource score. Here are 4 examples. Between 2018 and 2022, the vaccination rate demonstrated exponential growth, rising from a modest 45% to nearly 92%, signaling a significant public health success. Using exponential growth and quantifying both start and endpoints is highly specific. Notice how this example doesn't just say the rate increased, it uses exponential growth. This precise vocabulary describes the natures of the shift, which shows a deeper level of analysis to the examiner. Conversely, reports indicate that cases of influenza declined sharply following the introduction of new preventative measures, suggesting policy effectiveness. Using contrast, conversely, and inferring cause effect is advanced writing. Great trend reporting often involves linking data to a probable cause or solution. By stating, suggesting policy effectiveness, you are moving into the analytical realm, which earns higher marks. The graph reveals that while mobility rates initially spiked during lockdown measures, they stabilized at a lower baseline than pre-pandemic figures. Identifying stabilization and establishing comparison points, lower baseline, is key. When trends stabilize, describing the new normals or baseline is much more sophisticated than just saying the numbers stop changing. It suggests a new equilibrium point. A noticeable plateau was observed in childhood immunization rates after 2015, indicating that further government intervention may be required to reverse this stagnation. Naming the trend, plateau, and offering a conclusion or implication is powerful analysis. The word stagnation paired with plateau gives the same meaning but sounds much more academic. Always look for precise synonyms related to movement or lack thereof. Let's compare 4 pairs. The rates went up a lot between these years. Rates saw a substantial and consistent upward trajectory throughout the period. Using academic verbs and nouns, trajectory, substantial. This swap replaces vague language like went up with formal vocabulary. Using words like trajectory immediately signals that you are writing at an advanced analytical level. The number dropped after the new rules started. Following the implementation of updated protocols, the incidence rate decreased significantly. Specifying the cause and using appropriate phrasing, incidence rate. Remember to use technical terminology like incidence rates or prevalence. Furthermore, saying following the implementations is much more formal than after new rules started. It stayed around the same number for a while. The data point remained largely stable, exhibiting a period of plateauing between 2018 and 2020. Using specific trend vocabulary, plateauing, stable. Instead of stayed around, always use academic descriptions like stables or plateau. This shows you have a specialized vocabulary for describing graphical data. The biggest change was in the last few years. The most dramatic shift occurred towards the end of the reporting period, accelerating rapidly in 2023. Focusing on where and how fast the change happened, accelerating. A strong description doesn't just point to the end, it describes the nature of the change. Using accelerating rapidly is much more vivid than simply saying the biggest change. Watch out for these 3 common mistakes. Weak, vaccination rates climb from 60% to 80%. Strong, vaccination rates increased from a baseline of 60% to reach 80%. The correction adds baseline and uses the phrase to reach. This subtle change helps frame the numbers, suggesting that 60% was the starting point from which growth occurred. Weak, graph shows a drop because of new measures. Strong, a clear inverse correlation can be observed. The decline in cases correlates strongly with the introduction of preventative measures. The biggest mistake here is implying causation too strongly. The correction uses correlates, which is scientifically accurate. Correlation means they happen together, but it doesn't mean one caused the other. Weak, in 2015 and after that, rates were high. Strong, from 2015 onward, immunization rates maintained an elevated level, demonstrating sustained public health concern. Avoid temporal vagueness like and after that. By using from, onward, and adding descriptive adjectives like sustained, your writing gains precision and academic weight. Here are 4 ways to practice. The funnel approach. Start general, the overall trend, move to specific details, key data points, exceptions, and finish with generalization, future implications. Think of your essay like a funnel. You broaden the scope initially, then narrow down to precise statistics, and finally widen out again for your concluding analysis, giving the reader a complete picture. Identify 3 core shifts. Do not try to describe every single data point. Instead, categorize the overall trend into 3 distinct phases. Phase 1, start. Phase 2, middle turning point. And Phase 3, end. By focusing on major turning points, you demonstrate high-level selection skills. This is far more efficient than listing data numbers chronologically. Abuse. Comparative language. Always compare the current state to a previous benchmark, e.g., compared to 5 years prior or a marked improvement over. Comparison is vital because data points are meaningless in isolation. By constantly anchoring your descriptions against another time period, you strengthen the narrative flow and depth. Pre-write a thesis statement for the trend. Before writing, write 1 sentence that summarizes the graph's main takeaway. Overall, the data suggests a successful reversal of the initial decline. Having this guiding statement ensures your entire essay stays focused. It acts as your internal compass, forcing you to select only the evidence that supports that single core argument. When analyzing comparative studies, your primary goal is moving beyond simple description. You must establish a clear relationship between the groups being studied. This requires specialized academic language to show how one variable relates to another. We are not just listing findings, we are constructing an argument about efficacy differences. Key structures include signaling contrast, indicating similarity, and attributing causality. Mastery here allows you to guide the reader through complex scientific comparisons effectively. Remember that linking words like conversely, similarly, or in comparison do more than just connect ideas. They signal a specific intellectual relationship between those ideas. This precision elevates your writing from mere reporting to genuine analysis. Always pause slightly after these transitional phrases to give the listener time to process the shift in argument. Here are 5 examples. The experimental group showed a markedly higher reduction in symptoms compared to the placebo arm. Direct contrast label. Notice how markedly higher is more impactful than simply saying better. Use strong adverbs and adjectives that quantify the difference. This level of specificity demonstrates deep comprehension of the data, not just surface-level reading. While both treatments improved outcomes, the drug efficacy was disproportionately greater in patients with severe comorbidities. Concession and specificity label. The phrase, while both, acknowledges shared ground before pivoting to a key difference. This structure is perfect for nuanced discussions where exceptions or specific subgroups must be highlighted. Adverse event rates were comparable across all 3 dosage levels examined. Similarity and equivalence label. When comparing things that are similar, use words like comparable, equivalent, or parallel. This avoids the implication of a difference when none exists. Maintaining rigorous academic tone. Unlike previous studies, this trial suggests that outcome improvement is dose-dependent. Contrast with prior research label. When contrasting your findings with established literature, always reference the source of divergence. Phrases like, unlike previous research, show you are engaging in a scholarly conversation. The long-term follow-up indicated sustained efficacy in both cohorts, though slightly lower than initial projections. Comparison of time duration label. This example shows how to incorporate a time element into the comparison. By contrasting sustained efficacies with initial projections, you are analyzing not just the data points, but the trajectory of that data over time. Here are 3 reasons why this matters. Maintaining academic objectivity. Effective comparison language ensures your conclusions are data-driven and unbiased. Your language should serve the evidence, not the hypothesis. Overly emotional or definitive wording weakens your argument. Focus on reporting what the data suggests, rather than stating definitively what it proves. Addressing nuance and limitations. Science rarely offers perfect answers. Strong language acknowledges uncertainty and scope. This involves using hedging language words like suggests, may indicate, or appears to be. This shows sophistication because you recognize the limits of the current study's parameters. Structuring a persuasive argument. The comparative structure allows you to build a logical case step by step. Think of your analysis as an argument, premise, evidence comparison, conclusion. By mastering these linguistic tools, you guide the reader through that logic flawlessly. Let's explore the topic of comparing data, analyzing comparative studies of drug efficacy across groups. This is an important concept to understand for learning English effectively. This is a foundational concept when learning English. Understanding, comparing data, analyzing comparative studies of drug efficacy across groups deeply will unlock many other areas of the language. Think about how often you encounter this in real life and try to notice it in the English you hear every day. The more you engage with this idea, the more natural it will feel. Here are 4 ways to practice. Create comparison pairs. Take any 2 scientific articles and force yourself to write 3 sentences comparing them using different connecting phrases. This active process trains your brain to recall these structures automatically rather than needing to think about them explicitly. Focus on variety in the linking words you use. Summarize methods first. Before comparing results, spend time summarizing why the studies might differ, e.g., different patient demographics or dosages. Often, apparent differences in data are simply due to differing study populations. Always mention potential methodological biases before concluding about efficacy. Use a thesaurus for connectors. Specifically look up synonyms for similar, differs from, and therefore. Don't just change one word, change the entire structure. Instead of restarting your sentence, try restructuring it using a different connective phrase. Record yourself analyzing data. Pretend you are presenting an abstract comparison to a committee and record yourself reading only your analysis section. Listening back is invaluable. You will immediately hear where your language becomes repetitive or too informal, allowing for targeted self-correction. When you need to explain a complex biological pathway or the stages of disease progression, your primary focus must be on chronology and causality. We are not just listing facts, we are showing how one event leads directly to the next. Effective descriptions use highly sequential language that guides the listener step by step through the mechanism. Think of it as building a narrative timeline where every action has a logical predecessor or successor. Remember, explaining a process is fundamentally about temporal and directional clarity. Instead of simply listing stages, you need to establish the relationship between them. That stage causes stage B, which then results in outcome C. This strong focus on linkage elevates your description from mere reporting to genuine scientific explanation. Here are 4 examples. Initially, the pathogen penetrates the epithelial layer, initiating an inflammatory response. Starting point initiation. Using adverbs like initiallys or subsequentlys is crucial because they orient the listener to where in time we are. They establish a clear starting point before you dive into the mechanisms of action. This subsequent inflammation triggers the release of chemokines, which then recruit immune cells. Cause and effect. The structure X triggers pi is invaluable because it directly establishes a chain reaction. Always try to connect the action, the trigger, with its consequence, the recruitment. As macrophages phagocytose debris, they simultaneously release pro-inflammatory cytokines. Simultaneous actions. When multiple things are happening at the same time like phagocytosis, and cytokine release using words like simultaneously prevents the description from sounding choppy. It paints a picture of ongoing activity. The ultimate outcome is immune system overactivity, leading to potential tissue damage. Conclusion. Result. This concluding phrase must summarize the final state or consequence. It signals to the listener that you are wrapping up a complex sequence and detailing the overall impact. Here are 3 reasons why this matters. Establishing temporal order. Our brains process sequence naturally. We need explicit language to guide the audience through time. When describing a process, the listener's ability to follow the timeline is paramount. Using strong temporal markers like following this, or in turn acts like signposts on a complex map, ensuring no one gets lost in the mechanism. Highlighting causality. It's not enough to say A happens and B happens, we must show A leads to B. Scientific writing is heavily reliant on cause and effect relationships. Therefore, vocabulary that emphasizes causality, such as consequently or as a result of, is more important than simply using conjunctions like and. This adds analytical depth. Maintaining cohesion. Smooth transitions prevent the explanation from sounding like disconnected bullet points. Cohesive devices are the glue of your description. They link ideas logically, making the entire text flow as one continuous narrative rather than a series of isolated facts. This is key for achieving higher scoring in process descriptions. Let's explore the topic of visual processes, explaining the stages of disease progression or biological pathways. This is an important concept to understand for learning English effectively. This is a foundational concept when learning English. Understanding visual processes. Explaining the stages of disease progression or biological pathways deeply will unlock many other areas of the language. Think about how often you encounter this in real life and try to notice it in the English you hear every day. The more you engage with this idea, the more natural it will feel. Here are 4 ways to practice. Practice mapping first. Before speaking, write out a flowchart or diagram. This forces you to identify the absolute starting point and end point. Never try to speak about a process without first visualizing it step by step. Drawing the path helps you organize your thoughts and ensures that you don't skip critical intermediate steps that are necessary for full understanding. Vary your verbs. Avoid repeating happens, moves, or shows. Use synonyms like accumulates, translocates, or induces. A rich vocabulary is key to sounding expert. Instead of relying on basic, general verbs, select precise scientific action words that accurately reflect the movement or change at hand. Record and listen critically. Listen back specifically for places where your transitions are weak or confusing. Self-correction is vital. When you listen back, don't just check grammar, critically evaluate this flow. Ask yourself, could I insert a clearer connecting phrase here? This active listening improves natural fluency. Simplify complexity for clarity. If the audience is general, use analogies. If they are experts, maintain technical detail. Expert speaking requires audience awareness. You must tailor your vocabulary and level of detail to who you are addressing. A simple analogy can make an incredibly complex concept instantly digestible. When writing a medical academic report for Task 1, your primary goal is not just to describe data, it's to synthesize findings objectively. You must maintain an impersonal, formal tone throughout the entire piece. Remember that observation and analysis are key, but speculation is strictly forbidden. The structure remains overview, body paragraphs, conclusion, but the emphasis shifts heavily toward presenting clear trends related to health metrics or disease progression. Always use specific academic vocabulary related to biology and healthcare. Remember, in this context, objective means you are a scientific reporter, not an expert giving an opinion. Avoid phrases like "I think" or "it seems." Instead, focus on quantifying the observations using precise language such as "the data suggests" or "a marked increase was observed." Here are 4 examples. The incidence rate for type 2 diabetes rose sharply from 5% in 2010 to a peak of 18% by 2020, demonstrating an alarming trend across all age demographics. Effective use of precise data points and strong verb choices rose sharply, demonstrating. Notice how this sentence packs maximum information into minimal words. By using verbs like spiked or surged, you create a sense of urgency that matches the seriousness of medical data, making your writing much more impactful than simply stating it went up. Furthermore, while cardiovascular illness peaked in females aged 30 to 45, pediatric reports indicated no corresponding rise during the same period. Using cohesive devices, furthermore, while, and comparative structures for contrast. The use of while is exceptional here because it allows you to present 2 contrasting facts simultaneously without needing a separate sentence. This shows sophisticated control over linking words, which is crucial for high band scores. Overall, the data clearly points toward dietary shifts contributing significantly to the prevalence of chronic respiratory conditions among urban populations. A highly synthesized overview that interprets the general pattern shown in the chart. An effective overview doesn't repeat numbers, it states the main conclusion. Instead of saying, "many people got sick," you synthesize it to an underlying cause, like dietary shifts. This moves your report from mere description into genuine academic analysis. The most notable area of decline was in childhood obesity rates after the implementation of subsidized school meal programs. Identifying a clear cause and effect relationship supported by the visual data. When you see an intervention or policy change mentioned alongside a major trend, always frame it as a potential cause and effect. This shows sophisticated analytical thinking and is exactly what academic reports demand. Let's compare 4 pairs. In the chart, many people had high rates of heart disease. It went up over time. Heart disease rates demonstrated a measurable upward trend throughout the surveyed decade. Using sophisticated academic vocabulary and formal tone. The difference here is formality and precision. Using demonstrated instead of went up or measurable upward trends instead of high rates immediately elevates your writing into an academic register that examiners expect. Children are getting more sick because they eat junk food. This is obvious. The correlation between poor dietary habits and increased childhood morbidity warrants serious investigation. Shifting from personal opinion to academic, objective language. Never state something as obvious. Academic writing requires you to couch your claims in cautious, professional terms. Phrases like warrants, serious investigation sound much more credible and authoritative. The two groups were different. Group A was better than Group B. Group A exhibited significantly superior outcomes compared with those observed in Group B. Replacing simple comparisons with advanced comparative structures. Instead of simply saying one thing is better, use strong academic comparatives like superior to C or significantly higher than. This variety helps score points for lexical resource, demonstrating a broad vocabulary. The graph shows that when the vaccine started, fewer people got sick. Following the introduction of the vaccine program, there was a clear decline in reported illness rates. Focusing on process and causation rather than just listing events. Good analysis links an action to its result. By framing it as following the introduction, you're establishing a temporal linker cause and effect sequence, which is far more complex and insightful than simple description. Watch out for these 3 common mistakes. Speculating on causation, the chart suggests that poor diets cause many diseases because the lines go up. Maintaining objectivity. While a correlation exists between diet and disease incidence, causation cannot be definitively established from this data alone. This is perhaps the most critical error in medical reporting. Never assume causation just because 2 things happen together. That's correlation, not causation. Always use cautious language to hedge your claims. Vague phrasing. In addition, overall, Group B was worst. Precision and specificity. Overall, Group B exhibited the lowest rate of recovery among all measured demographics. Avoid general words like overalls or worst. Be specific. What metric was low? Was it the grade of recovery or the percentage of patients who recovered? Naming the exact variable shows mastery of the data. Overly informal dramatizing tone. This chart is very clear that smoking kills people. Academic detachment. The dramatic decline in life expectancy among smokers highlights a strong inverse relationship with non-smoking groups. You must remove all emotional language. Words like very clear or kills people are too dramatic and informal for a scientific report. Focus instead on measurable relationships such as inverse relationships or significant decline. Here are 4 ways to practice. The data selection rule. Do not try to report everything. Select 3 key points, the highest, the lowest, and the most dramatic trend. Before writing a single word, spend 5 minutes isolating those top 3 takeaways. If you can boil the entire graph down to these few facts, your report will be focused, concise, and extremely high scoring. The overview strategy. Write your overview paragraph first. This acts as a roadmap for the reader, stating the 2 or 3 main conclusions immediately. By writing this summary early, you force yourself to synthesize the entire dataset before diving into descriptive details. It ensures that every subsequent body paragraph supports the thesis statement you made in the introduction. The vocabulary bank. Keep a list of academic verbs, e.g., plummeted, plateaued, fluctuated, and linking phrases specific to trends. Don't just memorize words, memorize patterns. For example, instead of just increased, practice using saw a sustained upward trajectory or experienced a rapid escalation. This variety boosts your lexical score. The thesis structure. Plan the structure, introduction, paraphrase, overview, key trends, overview, key trends, body 1, main dataset, body 2, comparison secondary data. This rigid 5-part framework ensures you cover all necessary ground logically. Always remember that body paragraphs must support a specific point, rather than just describing separate sections of the graph. Task achievement refers to how successfully you address all parts of a prompt or dataset. It is about making sure your writing fully covers every piece of information provided in the stimulus material. When reporting on data, this means identifying and describing every key trend, figure, and comparison mentioned. Simply summarizing general themes isn't enough. You must show that you have accounted for all major components of the task. Think of task achievements as ensuring your report is comprehensive, not just eloquent. If a prompt asks about 3 specific elements, mentioning only 2 will result in incomplete coverage. Your goal is to demonstrate thoroughness by systematically addressing every required element. Here are 5 examples. The chart shows a steady rise in cases from January through March. Basic trend identification. This is a good start because it identifies the general movement. However, it only covers one period and misses any sharp changes or specific dates that might be crucial for full coverage. In addition to the main trend, we must also note the significant outlier in July and the corresponding dip in September. Covering exceptions outliers. This is much stronger writing. By specifically mentioning the outlier and the corresponding dip, you show that you didn't just report the average trend, you reported the detailed fluctuations as well. The first graph details sales of product A, while the second compares product B's market share. Structuring comparison. When you structure your writing this way, you show that you understand the distinct components being analyzed. This clear separation helps the reader follow complex comparisons across multiple data types. Furthermore, a comparison of regional spending reveals that Region C consistently spent more than all others despite its smaller population. Synthesizing multiple data points. Notice how this sentence combines 3 distinct data elements: the region, C, the metric spending, and the comparative factor, smaller population. This demonstrates deep data linkage. The overall trend indicates a gradual decline, but the year-on-year comparison reveals a sharp spike in Q3. Incorporating contrast. Using contrast words like but or however is key. It ensures you report both the general picture and the specific exceptions that contradict it, achieving full data coverage. Here are 3 reasons why this matters. Maintaining academic credibility. Leaving out data points makes your analysis appear incomplete or biased. In academic writing, thoroughness is synonymous with objectivity. If you omit a significant trend, the reader will assume it was unimportant, which undermines the credibility of your entire report. Preventing misinterpretation. A gap in data reporting can lead to an inaccurate understanding by the audience. Your role is to be a neutral reporter. If you only focus on positive trends, you might mislead your reader about underlying systemic issues that were clearly visible in the source material. Building argument strength. Addressing all points allows for a much stronger and more nuanced conclusion. When you have covered every facet of the data, your conclusions are based on undeniable evidence. This makes your arguments robust, detailed, and far harder to challenge. Let's explore the topic of task achievement focus, ensuring all data points are adequately covered. This is an important concept to understand for learning English effectively. This is a foundational concept when learning English. Understanding task achievement focus, ensuring all data points are adequately covered, deeply will unlock many other areas of the language. Think about how often you encounter this in real life and try to notice it in the English you hear every day. The more you engage with this idea, the more natural it will feel. Here are 4 ways to practice. Create a checklist based on the prompt's requirements. Before writing, list every specific data point or comparison asked for by the task. Treat your assignment like an inventory check. If the prompt asks about 3 things, A, B, and cure, written report must have a dedicated section or sentence addressing A, B, and C separately. Use signposting language to signal data inclusion. Start paragraphs with phrases like turning now to or in contrast to this trend. Signposting is crucial for guiding your reader. It tells them, pay attention because I am now addressing the second required element. This makes your comprehensive writing feel organized rather than overwhelming. Practice summarizing in 3 distinct groups. Instead of one long paragraph, break data analysis into trends, exceptions, and comparisons. Structuring your ideas this way helps you systematically cover all bases. Dedicating specific sections to general trends, sharp deviations, and cross-regional comparisons ensures no major piece of information is lost. The reverse outline method. After drafting, review the prompt again and check off every single required element against your written text. This final step is indispensable. By physically checking off each requirement, you create an accountability loop that guarantees you have achieved complete task coverage before submitting your report. Medical essays require you to move beyond simple description and embrace sophisticated argumentation. You must take a clear stance on a complex issue, for example, the ethical merits of preventative medicine versus reactive treatment. The key rule here is maintaining an objective, academic tone while presenting a strong thesis. Remember that simply listing facts isn't enough. Your essay needs depth, exploring the nuances and counter-arguments surrounding health policy decisions. When tackling these prompts, think like a medical journal reviewer. Your goal isn't just to inform, it's to persuade an academic panel of your intellectual capability. Always structure your argument around specific supporting points instead of broad generalizations. Here are 4 examples. While some advocate for mandatory vaccination policies due to herd immunity concerns, a critical examination reveals that public trust and individual autonomy must be addressed holistically. Therefore, governmental initiatives should prioritize transparent educational campaigns alongside vaccine mandates. Highly nuanced language and balanced argument, concession plus counter-argument. Notice the phrase critical examination. This signals academic depth immediately. We aren't just stating an opinion, we are analyzing a debate, which significantly boosts your lexical resource score. The escalating prevalence of lifestyle-related diseases underscores a systemic failure in modern urban planning. Policy changes, such as incentivizing pedestrian zones over vehicular infrastructure, represent a crucial public health intervention. Strong topic sentence linking policy to public health outcomes. This example uses sophisticated cause and effect phrasing. Instead of saying people are sick because, we use academic verbs and nouns like escalating prevalence and underscores a systemic failure. This elevates the writing. The incorporation of telemedicine has revolutionized remote patient monitoring. This technological shift allows for continuous data collection from vulnerable populations, drastically improving early intervention capabilities. Effective use of transition words and specialized vocabulary, telemedicine, data collection. Always check your transitional phrases to ensure smooth flow between ideas. Words like furthermore or consequently don't just connect sentences, they guide the reader through a logical progression of thought. Given the economic strain on healthcare systems, preventative screening programs must be viewed not as an expense, but rather as a vital long-term investment in community resilience. Shifting perception, redefining expense as investments. This is excellent persuasive writing because it reframes the entire debate. Whenever you can redefine a negative concept into a positive one, your argument becomes much more compelling and sophisticated. Let's compare 4 pairs. Smoking is bad for your health and people should quit. The detrimental impact of nicotine on pulmonary function necessitates comprehensive public awareness campaigns to encourage cessation. Using advanced vocabulary, pulmonary, detrimental, and formal structure. Compare the simple statement with this academic phrasing. Notice how we swapped out bad for detrimental impact. This small change instantly raises your perceived level of expertise. If we spend more money on doctors, things will get better. Increased governmental investment in primary care infrastructure is crucial for mitigating the current strain and improving overall community wellness outcomes. Using concrete nouns, infrastructure, and abstract concepts, wellness outcomes. Instead of vaguely saying things will get better, we pinpoint what needs improvement. The infrastructure. Specificity makes your argument sound researched and credible. Vaccines are good because they stop diseases. Vaccination programs represent a vital public health tool, significantly mitigating the incidence rates of infectious pathogens in localized populations. Replacing informal verbs with formal academic mitigating incidence rates. Think about what an expert would say. They wouldn't use simple words. They would use specialized vocabulary that shows mastery of the subject matter without sounding like you are reading from a textbook. It is important to teach people how to be healthy. Promoting health literacy through educational initiatives empowers individuals to take charge of their preventative care and overall well-being. Focusing on empowerment and agency health literacy. The key difference here is moving from a vague obligation. It is important to teach to defining the mechanism, promoting health literacy. This shows you understand how the problem can be solved, not just that it exists. Watch out for these 3 common mistakes. Weak. Many people think that exercise is the only cure for stress. This is wrong. Strong. While physical activity undoubtedly mitigates acute symptoms of stress, it should be understood as one component of a comprehensive mental wellness strategy. The biggest mistake here is being too absolute. Instead of outright rejecting an idea with, "This is wrong," use hedging language like "while" or "it should be understood as." This nuance shows critical thinking. Weak. Doctors need to talk more to patients so they know what's going on. Strong. Enhancing the depth of patient-doctor communication is imperative for establishing trust and ensuring comprehensive adherence to treatment protocols. We corrected vague phrasing like "talk more" to professional terminology such as enhancing the depth of communication. Always aim to make your writing sound authoritative, even when discussing simple concepts. Weak. Poor diet leads to lots of stomach problems. Strong. A nutritionally deficient diet significantly correlates with an increased susceptibility to various gastrointestinal complications. This fix replaces casual vocabulary like "lots of" and "stomach problems." By using precise academic diction, you are not just writing English, you are performing expert discourse. Here are 4 ways to practice. The thesis mapping. Don't just write a single thesis statement. Map out 3 distinct arguments and 1 counter-argument to ensure comprehensive coverage. Before writing the introduction, sketch out your main points like an outline for a play. This forces you to acknowledge complexity early on, which is what top scorers do. The concession bridge. For every point supporting your argument, dedicate time to acknowledging the opposing viewpoint and then immediately refuting it. Use transition phrases like "although" or. Admittedly, prayer. This technique is called concession, and it's gold for essays. It shows you have considered all sides of a complex issue, making your final stance much more robust. Vocabulary clustering. When studying medical topics, group related academic words together, e.g., pathogenesis, mitigate, incidence. Practice using them in context. Don't just memorize lists of synonyms. Practice building short sentences that force you to use those high-level words naturally. This helps move vocabulary from passive knowledge to active writing. The why chain. For every claim you make, ask yourself, "and why is that true?" and build a subsequent sentence explaining the mechanism or consequence. This exercise ensures your sentences are logically linked. Every point must have causality if A happens, then B results because of C. This builds sophisticated argumentative flow. A medical academic introduction must do more than just introduce the topic. It must establish a precise intellectual space for your argument. Think of it as a funnel. Start broad enough to engage the reader, then quickly narrow down to your specific focus area within medicine. The primary goal is to provide necessary context and identify a knowledge gap or debate that your essay will address. This sets up the inherent tension that your thesis statement will resolve. The thesis statement itself is not just an opinion, it is a clear, concise, declarative sentence that presents your main argument. It tells the reader exactly what position you are taking and what scope the rest of your discussion will cover. Remember that while our previous lessons covered the general structure for writing Task 2 essays, mastering the introduction is about precision. The thesis should be arguable, meaning someone could reasonably disagree with it. If it's a simple statement of fact, you don't need an essay to prove it, you just need a paragraph to state it. Here are 4 examples. While advancements in cardiology have dramatically improved survival rates, current diagnostic protocols often fail to adequately address early-stage cardiac inflammation. This essay argues that integrating advanced salivary biomarker analysis can significantly improve the predictive capability for myocardial infarction. Effective immediately identifies a specific problem, diagnostic failure, and proposes a concrete solution, salivary biomarkers. Notice how this example doesn't just say heart disease is bad, it pinpoints a very niche, researchable flaw gap in current diagnostic protocols. This specialized focus shows the marker of expert writing. The global rise in antibiotic resistance presents one of modern medicine's most urgent crises. Despite decades of research, stewardship programs remain inadequate. Therefore, this paper posits that a mandatory shift toward personalized microbiome-based antibiotics is necessary to curb rampant antimicrobial resistance. Effective uses strong academic vocabulary and frames the issue as an undeniable global crisis requiring immediate policy change. This example effectively raises the stakes by using global rise and naming it a crisis. When tackling large public health issues, your thesis needs to propose a systemic or structural solution, not just list problems. Although preventative measures like vaccinations are foundational to public health, pediatric care often overlooks the role of gut-brain axis dysfunction. This essay contends that early intervention strategies focusing on dietary and psychological support should be mainstreamed into routine childhood checkups. Effective narrows a broad field public health down to an overlooked subtopic gut-brain axis in pediatrics. A key skill is identifying the overlooked aspect. By suggesting that existing care overlooks this area, the writer instantly justifies their entire essay and provides clear direction for their arguments. The traditional understanding of hypertension views it solely as a cardiovascular issue. However, recent epidemiological data suggests a profound link to chronic stress management. This discussion will explore how behavioral medicine interventions can be crucial in managing blood pressure long before pharmaceutical treatment is required. Effective challenges conventional wisdom, traditional understanding, and shifts the focus from biology to behavior policy. This type of introduction, which challenges a foundational assumption, creates immediate intellectual tension. It proves that your essay will be critical thinking, not just summarizing known facts. Let's compare 4 pairs. Antibiotics are very important for treating infections. They help people get better and save lives. While antibiotics have revolutionized infectious disease treatment, their overuse has created a global crisis of resistance that necessitates immediate policy reform. Moves from general statement to specific problem and argument. The weak version is too descriptive. It merely states facts. The strong version immediately identifies the conflict, the overuse leading to resistance, and establishes an academic, argumentative tone for the entire piece. Smoking is bad for your lungs and causes cancer, which is why people should quit. Despite decades of public awareness campaigns, smoking continues at alarming rates. This essay will analyze the socio-economic factors that maintain tobacco use and propose multifaceted interventions to curb addiction. Focuses on why the problem persists socioeconomics rather than just stating it is bad. Don't write a PSA, write an academic essay. The goal isn't persuasion through emotion, but analysis through structured argument. The strong example tells us how it will analyze the issue. Diabetes is a major health problem that affects many people around the world and requires diet changes. The current management of type 2 diabetes often focuses narrowly on pharmacological intervention, neglecting the critical role of lifestyle modification. This paper argues for integrating comprehensive dietary counseling as a primary therapeutic pillar, narrows the scope from diet to integrating comprehensive dietary counseling. The key here is specificity. Instead of telling us that diet changes are needed, the strong version specifies how they should be implemented as a primary therapeutic pillar-giving structure to the essay. Sleep deprivation causes many health issues, such as weight gain and poor concentration. The relationship between chronic sleep deprivation and metabolic dysfunction is increasingly recognized. This discussion contends that targeted chronotherapy interventions offer a superior preventative approach compared to simply recommending increased sleep duration. Replaces vague claims, poor concentrations, with specialized academic terminology, metabolic dysfunction, chronotherapy. Academic writing requires precise vocabulary. Using terms like metabolic dysfunction or chronotherapy signals that you are engaging with expert literature and elevating the discussion beyond common knowledge. Watch out for these 3 common mistakes. Too broad or vague, climate change is making many diseases worse. This essay will talk about different ways it affects health. Specific and arguable, rising global temperatures are increasing the geographical range of vector-borne diseases, notably dengue fever. This essay argues that proactive international surveillance networks must be implemented to preempt outbreaks in previously unaffected regions. A common mistake is being too broad. You cannot cover all of climate change and health. The correction immediately narrows the focus to a single, measurable concept: vector-borne diseases and proactive surveillance. Restating the prompt says we should discuss vaccination rates in the last century. I will discuss some high and low numbers. Arguing a thesis, while historical data confirms fluctuating vaccination rates, this paper contends that infrastructural disparities rather than public adherence alone are the primary determinant of vaccine equity across developing nations. Never repeat or summarize the prompt in your thesis. The reader knows what they asked you to discuss. Your job is to argue why that discussion matters, focusing on a specific causal factor like infrastructural disparities. Stating conflict, non-argumentative. Some people think diet is important for heart health. Others think genetics are more responsible for high blood pressure. Proposing a solution, while the interplay between genetics and lifestyle determines cardiovascular risk. This essay posits that pharmaceutical interventions must be redesigned to better account for personalized epigenetic markers, moving beyond a one-size-fits-all model. Simply listing opposing viewpoints is not an argument, it's a debate summary. A strong thesis takes that conflict and advances a unique solution or new line of inquiry, suggesting redesigned interventions. Here are 4 ways to practice. The funnel method. Start with a general statement about the field, e.g. public health, then narrow down to the specific mechanism or debate your essay addresses. Think of this physically. You start wide and gradually funnel your reader's attention toward one single point. Never skip from the big picture straight to your conclusion. Guide them gently. The gap identifier. When drafting, ask yourself what is currently missing or misunderstood about this topic. This gap becomes your unique contribution. This requires critical reading skills. Rather than just summarizing what is known, you must pinpoint what the existing literature has failed to adequately address. That is your essay's niche. Drafting practice. The thesis first. Write your thesis statement as a standalone sentence immediately after outlining. This forces focus and clarity before writing supporting paragraphs. Treat your thesis like the contract you sign with the reader. It must be crystal clear from the start. Writing this first ensures that every single point you plan to discuss later directly supports this one core argument. Vocabulary mapping. Before writing, list 3 to 5 specialized terms related to your topic, e.g. epigenetic, vector-borne. Using these elevates the academic tone. To sound expert, you must use precise terminology. Don't try to include every big word. Rather, choose the most accurate and field-specific vocabulary to describe your mechanisms. Now it is your turn to practice. Read or listen to the following passage carefully. Prompt. Discuss the emerging role of artificial intelligence, AI, in diagnosing rare neurological disorders. To what extent can AI tools replace human diagnostic expertise in specialized medical settings? Question 1. What is the core conflict this prompt sets up for an introduction? Pause the video now and write your answer before we reveal it. The correct answer is the tension between technological capability, AI, and established professional judgment, human experts. This is where your gap identifier comes into play. The debate isn't just if ethic AI works, but rather defining the boundaries of its usefulness versus human intuition. Question 2. What must your thesis statement ultimately achieve? Pause the video now and write your answer before we reveal it. The correct answer is It must avoid a simple yes-no answer and instead establish a nuanced position such as AI is complementary to, but not a replacement for. Specialized human expertise because it excels at pattern recognition in datasets that humans cannot process. A strong medical thesis rarely takes an extreme stance. Instead, it proposes a balanced, complex relationship of synergy which demonstrates sophisticated critical thinking and depth. Effective academic writing demands more than just stating facts. It requires weaving evidence directly into your argument. This process is called evidence integration. It means smoothly incorporating scientific data, statistics, or even hypothetical scenarios to logically back up every claim you make. Instead of presenting evidence and then explaining it later, you must build the explanation around the support material. Think of your claims as the main pillars and the integrated evidence as the structural beams holding them up. The key takeaway here is seamlessness. Don't let your evidence feel tacked on or disconnected from your flow. Successful integration makes the data an inseparable part of your thinking process for the reader. This elevates your writing from mere reporting to genuine argumentation. Here are 5 examples. The study demonstrated a significant correlation between reduced vitamin D levels and increased incidence of metabolic disorders. Citing specific research findings. When you cite specific studies, always name the core finding rather than just mentioning the paper's existence. Be precise about the statistical relationship they found. This gives your argument immediate credibility because it points to real-world scientific rigor. If a compound were tested in a simulated environment, preliminary data suggests a potential reduction in inflammatory markers by up to 20%. Using hypothetical simulation data? It is fine and necessary to use hypothetical data when the research hasn't been completed. However, you must include strong qualifying phrases like if, simulated, or preliminary. This manages the reader's expectations and maintains academic honesty. Furthermore, longitudinal data collected over 2 decades indicates a clear trend reversal in patient recovery rates following intervention X. Referencing longitudinal trends. Longitudinal data is powerful because it shows change over time. When using this type of evidence, focus your language on the trajectory words like gradual, accelerating, or reversal are much more impactful than simple nouns. For instance, a controlled trial involving 50 participants showed that intervention A outperformed standard care by a margin of 3-1. Providing quantifiable comparison. Always aim for quantification when making comparisons. Instead of saying, it was better, use numbers and specific ratios like 3-1. This makes your argument undeniable and measurable, which is the goal in scientific writing. This aligns with theoretical models, suggesting that cellular regeneration pathways are heavily influenced by nutrient availability. Connecting evidence to theory. The most advanced integration links empirical data back to established theory. You aren't just presenting facts, you are showing how those facts confirm or challenge existing scientific knowledge. This demonstrates critical synthesis. Here are 3 reasons why this matters. Building authoritative credibility. Evidence moves your writing beyond mere opinion toward established expertise. In academic contexts, simply stating an opinion is insufficient, you must prove it. By correctly integrating high-quality evidence, you adopt the voice of a scholar who has thoroughly reviewed the existing literature and can withstand peer review. Maintaining logical flow. It prevents your argument from becoming a series of disconnected points. Good integration creates a narrative flow, guiding the reader logically from your claim to the evidence that supports it, and finally to your interpretation. Think of it as a carefully constructed funnel or ramp, not a list of bullet points. Addressing counter-arguments proactively. You can integrate data that addresses potential criticisms within your body paragraphs. A strong writer anticipates objections. By bringing in evidence that mitigates known counterpoints, you preemptively strengthen your position and show the reader that you have considered opposing viewpoints thoroughly. A hallmark of advanced scientific writing is acknowledging uncertainty. Never present data as absolute truth unless it has been universally proven. When discussing hypothetical or preliminary findings, you must use precise hedging language. This shows intellectual maturity and critical thinking. Remember to distinguish between correlation and causation. This distinction is non-negotiable. Hedging isn't admitting weakness, it's demonstrating scholarly caution. Phrases like suggests, may indicate, or is consistent with are far stronger than overly definitive statements. This nuance is what separates a strong student essay from truly expert academic writing. Here are 4 ways to practice. The claim evidence analysis sandwich. Start with your claim, insert the evidence, and then write a substantial analysis connecting the two. Never stop at presenting the evidence. The most critical step is the analysis. You must always interpret what the data means for your argument. This interpretation is where your voice as an expert truly shines through. Varying integration verbs. Use strong reporting verbs like suggests, confirms, challenges, or demonstrates. Repetitive language weakens your prose. By varying your verbs, you keep the reader engaged and provide a richer tapestry of academic engagement. Choose a verb that accurately reflects the strength of the evidence. Using signposting language. Use transition phrases like in contrast, correspondingly, or this observation is further supported by. Signposting language acts like a helpful GPS system for your reader. It tells the audience exactly how your current piece of evidence relates to the point you just made, keeping them oriented within your argument structure. The "so what?" test. After every piece of evidence, ask yourself, so what? If you cannot answer that question in one sentence, elaborate. This simple test is the ultimate editor's tool. It forces you to move past summarizing data and into synthesizing meaning. Making that so what's connection is the difference between reporting facts and making an argument. In academic writing and professional debates, especially concerning health policy, simply being correct isn't enough. You must be precise. High-level lexis allows you to convey complex ideas with sophistication. Today, we are focusing on vocabulary that helps you analyze trends, propose solutions, and discuss systemic issues in public health. Mastering these words will significantly elevate the academic register of your speaking and writing. Think of high-level lexises not just as big words, but as powerful words. They give you surgical precision. Instead of saying the problem got worse, you can say it was exacerbated. Your goal is to move beyond basic description toward analytical diagnosis. Let's go through 6 words. For each word, I will say it clearly, then explain how to produce it correctly. The word is mitigate. Say it again, mitigate. Remember that mitigate is often paired with risk, effect, or impact. It implies a measurable effort to reduce severity. A common error is using it when you mean prevents. Mitigation suggests lessening the damage already underway. The word is prevalent. Say it again, prevalent. When using prevalent, always ensure you are describing the frequency of something, not its severity. For example, a condition can be prevalent but still easily managed. The word is exacerbate. Say it again, exacerbate. Be careful not to confuse exacerbates with simply worsen. Exacerbating suggests making an existing underlying issue significantly aggravated. This word is key for demonstrating causality in policy debates. The word is disparity. Say it again, disparity. This word is excellent for discussions about social justice in medicine. While inequality refers to the unjust nature of the gap, disparities focuses more on the observable difference in statistics or outcomes. The word is pivotal. Say it again, pivotal. Pivotal means it acts as the central point around which everything else rotates or depends. When you use this word, you are signaling that the concept you are about to name is non-negotiable for success. The word is pragmatic. Say it again, pragmatic. This word is perfect when you want to argue for a balance between ideals and reality. If your policy proposal sounds too theoretical or utopian, using pragmatic grounds it in achievable action. Here are 5 examples. Policymakers must develop strategies to mitigate the risks associated with aging populations. Navigate VB4. Notice how mitigates is linked directly to a noun like risks. This structure of a plus prepositional phrase is very common in high-level academic arguments. It adds weight and formality. The disparity in access to basic healthcare across different economic strata is alarming. N. Here, disparities works because it points out a quantitative imbalance. It's stronger than just saying there are differences. It implies that the difference itself is unjust or unacceptable. Improving public education is pivotal to controlling the spread of infectious diseases. Pivotal, aj. When you say something is pivotal, you are giving it immense importance. It's not just an important factor, it is the single necessary fulcrum for success. We must avoid measures that might exacerbate underlying chronic conditions in vulnerable communities. Exacerbate, VFA. This sentence demonstrates cause and effect. The structure suggests a potential negative action, measures leading to an outcome, worsening the conditions. This is essential for policy recommendations. A pragmatic approach requires considering both scientific ideals and budgetary realities. Pragmatic, aj. The contrast embedded in this sentence is key. It sets up a tension between the ideal world of science and the real world of budgets, which is often where policy debates become heated. Let's compare 4 pairs. First, mitigate. Compare it with alleviate. Scope of action, mitigation is systemic, alleviating is symptom-based. While both mean to lessen something bad, mitigate suggests changing the overall conditions or source of the problem. Alleviate, however, often refers specifically to reducing symptoms like taking medicine for pain. First, disparity. Compare with inequality. Focus on observable differences versus unjust distribution. This is a fine but important distinction. A disparity might simply be an observed lack of resources, while inequality carries the moral judgment that the imbalance is wrong or unfair. First, prevalent. Compare it with endemic. Frequency versus geographic confinement. If a disease is prevalent, it means it's common in the area right now, but it doesn't specify its origin. If it is endemic, it means it is consistently present in a specific geographical region. First, exacerbate. Compare with aggravate. Slightly more medical clinical tone. These 2 words are often interchangeable, but exacerbate tends to be favored in formal scientific writing and policy reports. Both convey the meaning of making something much worse. Here are 4 ways to practice. Collocation mapping. Group words that naturally appear together, for example, mitigate risks, public disparity, or pivotal role. Don't just learn the word, learn what it likes to sit next to. When you practice collocating these high-level terms, your speech instantly sounds more natural and sophisticated. Thematic substitution drill. Take a simple paragraph from an article and try replacing 5 adjectives or verbs with our target vocabulary. Review the fitness of each replacement. This exercise forces you to think critically about register. You're not just substituting, you are elevating the tone, making sure the new word fits the authoritative voice required for policy debate. Speaking prompts. Prepare short arguments using if X happens, it will exacerbate Y unless we implement Z. This builds fluency. The best way to secure new vocabulary is through active recall under pressure. Preparing structured talking points with these advanced terms ensures they come out naturally during a debate. Spaced repetition. Review the 6 words and their definitions daily for 1 week, ensuring you can use them in different contexts, e.g., noun, subject, object. Consistent exposure is key to moving vocabulary from your short-term memory into functional, long-term academic usage. Try writing a sentence using each word every day this week. Now it is your turn to practice. Read or listen to the following passage carefully. The World Health Council recently analyzed the persistent disparity in vaccination rates between high-income and low-income regions. They noted that climate change exacerbates malnutrition, making certain diseases more prevalent globally. To mitigate this crisis, the Council suggests a pragmatic overhaul of global supply chains. This requires treating infrastructure development as pivotal to public health outcomes. Question 1. Find a word in the passage that means a lack of similarity or equality. Pause the video now and write your answer before we reveal it. The correct answer is disparity. The context here is global vaccination rates, and reading disparities immediately tells you that the Council is addressing an observable gap. It frames the problem as an imbalance that needs intervention. Question 2. Use one of the target words in your own sentence. Pause the video now and write your answer before we reveal it. The correct answer is: a proactive public health program can mitigate potential outbreaks before they become a crisis. Notice how I paired mitigate with potential outbreaks. This shows that you are not just defining the word, but actively demonstrating its power by embedding it into a realistic policy recommendation. When writing about systemic failures, your essay must guide the reader through a complex chain of cause and effect. Simple transitions are not enough. You need cohesion devices that show relationships like consequence, mediation, or causality. These advanced devices help link entire ideas, proving that one failure directly leads to another. They move beyond just listing points and instead build an integrated argument. For IELTS, demonstrating this sophisticated level of textual control is key. It shows the examiner you can manage complex discourse structures. Remember that cohesion isn't just about using therefores or. Consequently, this skill means structuring your entire paragraph to reflect a logical flower movement from premise to effect, for instance. Think of yourself as a guide leading the reader through a sequence of events, and your linking words are the structural signs pointing the way. Here are 4 examples. Initial infrastructural neglect has created a vulnerability. Consequently, when the localized climate event occurred, the entire power grid failed. This failure then crippled emergency response efforts. Effective use of consequently and BAT, this failure shows direct cause and effect chains. Notice how the writer doesn't just list failures. They establish a primary condition, the neglect, and show it as the necessary precursor to the secondary amplified effect. This layered approach is much stronger than simple listing. While inadequate public education may not be the root cause, its failure to disseminate proper safety protocols exacerbated the initial crisis. The phrase exacerbated the initial crisis uses sophisticated verbs and implies a worsening rather than just an addition of problems. This example demonstrates how linking doesn't always require an explicit transition word. By using strong relational verbs, you can imply cause or consequence with greater academic weight, making your argument feel more seamless. Given that municipal oversight was already lax, the sudden influx of demand from the pandemic overwhelmed local resources. Furthermore, this led to critical rationing. The use of given that establishes a foundational condition, while furthermore's adds an escalating consequence. Starting with, given that immediately anchors your discussion in an existing state or assumption. This structure is perfect for systemic failure topics because it sets up the unavoidable background conditions before presenting the main argument. The inability to coordinate services across borders constituted a major hurdle. Moreover, this jurisdictional gap meant that only fragmented local responses were possible. Using moreover and specifying jurisdictional gaps links abstract concepts, coordination, with concrete results, fragmentation. A powerful linking technique involves linking conceptual failure, linking a lack of coordination to the resulting political or logistical boundary. This shows high-level critical thinking beyond mere data reporting. Let's compare 4 pairs. The system had problems. The government was slow to react. There were many people affected. Because the governmental response was sluggish, a large portion of the population remained vulnerable and unprotected. Using because creates clear causality rather than listing facts. The shift here is from merely stating 3 separate facts to establishing one fact, the slow reaction, as the direct cause of the negative outcome. This immediately elevates your writing's logical depth. Climate change happened, food shortages resulted, people got sick. The onset of rapid climate shifts triggered severe food shortages, which subsequently fueled a wave of malnutrition and disease outbreaks. Using triggered and subsequently fueled shows a dynamic process, not just a list. In systemic writing, you must show how one problem feeds into the next. Verbs like trigger, fuel, or exacerbate are far more powerful than simple linking words because they describe the action of the failure. The poor infrastructure was a factor. It made movement difficult. Trade suffered. Poorly maintained infrastructure severely hampered commodity movement, thereby causing significant disruption to regional trade networks. Combining ideas and using sophisticated phrases like thereby causing is much more academic. Notice how the strong version combines two simple clauses into one complex sentence. This shows you can manage multiple linked concepts without making the writing sound choppy or disjointed. People needed help. Aid was not available. The situation worsened. The lack of immediate humanitarian aid meant that rescue efforts stalled, thus allowing the crisis to deepen considerably. Using meant that, and thus allowing, creates a direct logical flow from cause to inevitable consequence. When describing failures, you are often discussing absent the lack of something. Phrases focusing on this void, like lack of aid meant or absence led to, make your argument feel highly precise. Watch out for these three common mistakes. Weak. The first problem is the budget cut. Also, there was a rise in illness rates. Strong. Furthermore, budgetary cuts coincided with an undeniable surge in localized illness rates. Avoid simple additive conjunctions like also's or in addition. Instead, use transition phrases that show how the two ideas related they happen together. Did one cause the other? Weak. Systemic failure is bad. It leads to economic problems and social unrest. Strong. Should a systemic failure occur, it invariably precipitates economic collapse alongside heightened levels of social unrest. The mistake here was using leads to. Advanced writing requires verbs that suggest inevitability or severity. Words like precipitate, fuel, or exacerbate are much more impactful. Weak. Workers lost jobs because of the downturn. The government did nothing. Strong. The economic downturn resulted in mass job losses, a situation which was then compounded by governmental inactivity. Here, we correct the separate conjunctions. By restructuring the sentence to use compounded by, you create a single, sophisticated statement that shows multiple forces acting together, building momentum in your argument. Here are 4 ways to practice. The cause-effect chain map. Before writing, list your main point A, the immediate cause, B, and the resulting outcome failure, C. Use arrows to visualize the flow. Don't jump straight into drafting. Spend 5 minutes mapping out these chains visually on paper. This process forces you to establish the logical connection before worrying about perfect grammar or vocabulary. The transition bank. Create a bank of advanced transition phrases based on your topic, e.g. .g, howing to, consequently stemming from, in light of. Instead of writing the phrase, write down the relationship it expresses like cause or escalation. This way, you can select the perfect linking structure even if your initial sentence phrasing changes. The topic sentence blueprint. Ensure every paragraph begins with a strong topic sentence that explicitly announces the logical relationship to the previous paragraph. Your opening line should act as a cohesive bridge. Instead of just saying, next, try starting with, building upon this initial vulnerability. This immediately signals to the reader how you are continuing the discussion. The summary loop check. In your conclusion, do not summarize points. Instead, reiterate the S-cohesive chainese that was established. Link the cause back to the effect. A powerful concluding paragraph loops back to your introduction by summarizing the interconnectedness of the failures you detailed. This leaves the reader with a sense of completed, irreversible logical weight. A critical analysis essay does not mean simply listing pros and cons. It requires developing a nuanced argument that acknowledges complexity while maintaining a central thesis. This means moving beyond simple agreement or disagreement. Instead, you must evaluate the scopes and limitations of any given intervention. For instance, when discussing AI diagnosis, you must balance its statistical accuracy against potential biases in training data. But remember that balance here is not 50-50 physical space on the page. True academic balance means showing how two opposing ideas interact or compromise each other to form a more comprehensive understanding. The goal is synthesis, not just summation. Here are 4 examples. While AI excels in pattern recognition for retinal scans, human expertise remains crucial for interpreting ambiguous or multi-systemic diagnoses that require contextual patient history. Effective because it uses while X is true, Y is also necessary, creating immediate tension and balance. Notice the structure. It praises the strength of AI first, but immediately pivots to defining where human limitations or superior skills still apply. This shows a mature, multifaceted understanding. The immediate benefit of remote telehealth is increased accessibility, yet this convenience risks excluding marginalized populations lacking reliable internet infrastructure. Strong because it addresses the socio-economic implications, not just the medical ones. Great critical analysis always expands beyond the technical or biological. By bringing in marginalized populations, you shift the focus to ethical and infrastructural barriers, greatly deepening your argument. Should AI take over initial diagnosis? Perhaps not entirely. It should function best as a diagnostic co-pilot, augmenting rather than replacing the physician's judgment. Excellent use of qualifying language, perhaps best as. This manages expectations and avoids absolute claims. Qualifying your statements is key to high scores. Phrases like, it appears that, suggests, or should function best as make your argument sound thoughtful and measured. Although machine learning speeds up data processing exponentially, the ethical accountability for any diagnostic error remains firmly with the supervising human practitioner. Focuses on accountability, the non-clinical implication of the technology. This example successfully shifts the focus from capability, what AI can do, to liability, who is responsible. This level of ethical consideration demonstrates advanced critical thinking. Let's compare 4 pairs. AI is better than human doctors because it analyzes data faster and more accurately. While AI significantly speeds up data processing, its reliance on training sets means that diagnoses for atypical or rare conditions may remain incomplete. Replaces a simplistic claim with a conditional statement that acknowledges limitations. The weak version is judgmental and dismissive. The strong version avoids sweeping judgments by introducing the concept of atypical conditions, forcing you to consider edge cases. Telemedicine is good because it connects doctors globally, making care available everywhere. Telemedicine offers unprecedented global reach. However, policymakers must simultaneously address issues of digital equity and jurisdictional medical law. Adds complexity by introducing policy and legal dimensions beyond mere convenience. Strong writing doesn't just state the benefit, it immediately introduces a necessary counterbalance, in this case, policy challenges. This shows you are thinking systemically. We should adopt AI in medicine because it reduces human error and burnout. Adopting AI can mitigate diagnostic fatigue for overworked clinicians, provided that new protocols are implemented to ensure proper oversight and data validation. Uses sophisticated verbs mitigate while inserting a crucial if clause, the condition. Notice how the strong version is not just positive, it sets up conditions for success. Academic analysis always demands recognizing prerequisites or necessary safeguards. AI diagnosis is inevitable and will solve all medical problems. The integration of AI into medicine is likely, yet its efficacy remains contingent upon careful regulatory oversight and ongoing validation in diverse clinical settings. Replaces definitive prediction with conditional possibility, contingent upon. Never use language that sounds like a guarantee. By using words like likelies or contingent, you ground your predictions in reality, which is the hallmark of mature academic writing. Watch out for these 3 common mistakes. Overgeneralization. AI will eliminate all human doctors because it is superior. Qualification and nuance. It is unlikely that AI will fully replace human doctors, but rather transform their roles by automating specific data-intensive tasks. The mistake here is making an absolute claim or never. A better approach uses modal verbs like mays or could, showing possibility rather than certainty. Hasty conclusion. The benefits of AI far outweigh the risks, so we must implement it immediately. Balanced prioritization. While the potential benefits are clear, immediate implementation requires a thorough study of long-term ethical and social impacts before widespread adoption is considered. Avoid telling the reader what they must do. Instead, guide them toward an action by detailing necessary preparatory steps like further study or regulatory review. Blind acceptance. The technology is always unbiased and objective. Critical skepticism. A major concern remains the potential for inherent bias in algorithms, which can perpetuate health disparities if training data lacks diversity. Never treat technology as inherently good or perfect. Always question its underlying assumptions and the data it relies upon to achieve a truly critical analysis. Here are 4 ways to practice. The pro-con matrix refinement. Don't just list items. For each pro, immediately identify the corresponding potential, con, or limitation. Think of this matrix as a conversation, not a checklist. When you find an advantage, force yourself to ask, under what conditions does that advantage fail? This builds immediate depth. The counterargument first draft. Before writing your main argument, spend time drafting the single strongest counterargument, then refute it. This technique is powerful because it forces you to argue against your own initial idea. By acknowledging and then rebutting a strong opposing view, your own thesis gains immense credibility. Defining scope limitations. Explicitly state what the topic will not cover, e.g., this essay focuses on diagnosis, not treatment protocols. Limiting your scope is an advanced skill that makes you seem highly academic. It manages reader expectations and helps maintain focus on a narrow, controllable argument. The implications bridge. After presenting a point, dedicate 1 sentence to discussing the real-world consequences. This implies, consequently, don't let your ideas float in academic space. Always bridge your theoretical points back to human impact policy, ethics, or patient life. This connects theory to reality. Persuasive academic writing requires more than just stating an opinion. It demands building a compelling case supported by credible evidence. When discussing global health initiatives, your goal is to convince the reader of the urgency and necessity of your proposed stance. This means moving beyond simple description into deep critical analysis. The key rule here is maintaining absolute focus. Every sentence must directly support your central thesis statement. Remember that while you have previously covered building body paragraphs, today we are focusing on elevating the rhetorical force-making, so your argument resonates with real-world policy implications. The difference between a good essay and an excellent one often lies in its rhetorical impact. Don't just report facts, analyze the consequences of those facts. Think about framing the problem. Instead of saying vaccine distribution is slow, try arguing that current funding models create unacceptable bottlenecks in equitable vaccine deployment. This shift changes your writing from passive description to active critique. Here are 4 examples. The current reliance on national borders severely restricts the rapid deployment of medical resources during pandemics. A globalized health security framework involving shared resource pools and preemptive international cooperation is therefore paramount to saving lives. Effective use of strong academic verbs restricts paramount and policy language. Notice how this paragraph uses high-level vocabulary paired with specific policy concepts. It doesn't just say it needs better cooperation, it names the failure point. The National Border Fund proposes a concrete solution, which is always stronger for IELTS, to genuinely mitigate health disparities. Funding mechanisms must shift away from philanthropic donations towards sustainable global taxation. This ensures that aid programs are insulated from the volatile political cycles and economic downturns that currently undermine their longevity. Offers a clear, actionable solution, taxation, while analyzing its weakness, volatility of donations. This example shows excellent cause and effect thinking. By identifying philanthropic donations as the problem and proposing global taxation as the structural fix, you are operating on a macro level, which examiners highly reward. Furthermore, investing in localized primary healthcare facilities is significantly more cost-effective than maintaining centralized hospital models. Decentralization empowers local communities. With immediate access to basic care, thereby reducing the overall economic burden on national health systems. Uses comparative logic, more cost-effective, and focuses on practical economic benefits. When arguing for policy change, always include an economic justification. Linking improved public health outcomes to reduced governmental costs adds weight and practicality to your argument, making it irresistible to the reader. The failure to standardize data collection across different nations creates dangerous blind spots in epidemiological tracking. A unified digital platform is not merely a convenience, but an absolute necessity for accurately forecasting disease outbreaks and allocating resources preemptively. Identifies a systemic flaw, lack of standardization, and proposes a technological solution. This shows mastery of identifying systemic, operational failures. Instead of focusing on the illness itself, you focus on the information flow regarding the illness. This critical layer of analysis demonstrates advanced thinking. Let's compare 4 pairs. Many countries need more money for health programs. To achieve true global equity, international bodies must implement mandatory carbon-neutral funding streams dedicated solely to primary healthcare infrastructure. Moving from general statements to precise policy mechanisms and strong determinative language. The weak version is a common generalization. The strong version immediately specifies who, international bodies, what's mandatory, carbon-neutral funding streams, and why's primary healthcare infrastructure. Specificity is your greatest asset. Vaccines help people not get sick from diseases. Widespread vaccination campaigns are essential public health tools that build herd immunity, critically reducing the viral load and preventing severe community transmission. Using scientific terminology, herd immunity, viral load to lend authority and precision. An examiner wants to see if you can use specialized vocabulary naturally within an argument. Using terms like viral load or herd immunities instantly elevates your lexical range and demonstrates subject mastery. Governments should help poor countries with medicine. Developed nations bear a moral and economic responsibility to reform intellectual property rights for critical pharmaceuticals, thereby ensuring affordable access in developing economies worldwide. Shifting the focus from vague help to concrete structural reforms (IPR). Never use vague verbs like should help. Instead, identify the actual mechanisms of failure like overly protective intellectual property rights. This proves you understand the complex policy landscape. It is important to have good research on diseases. Investing in advanced genomic sequencing and longitudinal epidemiological studies provides the predictive data necessary for prophylactic measures. Moving us beyond reactive treatment models, focusing on how knowledge is gathered, genomic sequencing, rather than just stating that it's needed. This contrast teaches you to be technically specific. Instead of saying, better research, name the specific scientific tools like genomic sequencing. This level of detail shows depth and credible understanding. Watch out for these 3 common mistakes. Vague causality. Global warming causes sickness in poor people because they live near the ocean. Precise mechanism. Elevated sea levels driven by climate change disproportionately threaten coastal populations, exacerbating waterborne diseases and malnutrition rates. The first mistake is creating a causal chain that is too simplistic. The correction doesn't just say it causes sickness, it specifies the mechanism, sea levels leading to waterborne diseases. Always explain the pathway. Over-reliance on one idea. Many people think medicine is important for health. Balanced thesis scope. While medical intervention remains crucial, a necessary paradigm shift must prioritize preventative public health measures, such as improved sanitation and nutritional education to achieve sustainable wellness. Avoid creating arguments that are too narrow. The correction acknowledges the importance of medicine, but pivots to a broader, more sophisticated argument, prevention over cure. This shows nuanced critical thinking. Passive weak directive. Research has shown that aid workers must travel to places with problems. Actionable policy recommendation. Effective humanitarian intervention demands the establishment of secure, permanent medical corridors to ensure reliable and safe passage for specialized aid personnel into conflict zones. The biggest weakness is issuing a weak command. Instead of saying must travel, the strong version proposes a tangible policy solutions, secure, permanent medical corridors. This elevates your writing from complaint to proposal. Here are 4 ways to practice. The reverse outline method. Instead of outlining points, write out the core thesis statement and 3 supporting topic sentences first. This locks in your argument scope immediately. When you are under a strict time limit, do not waste time brainstorming general ideas. By locking down your main claims, your tripods, you ensure that every single word written during the exam is directly relevant to supporting those 3 points. The counter-argument preemption. Dedicate 1 sentence in your introduction or conclusion to acknowledging and immediately refuting a potential opposing view. This shows comprehensive analysis. Examiners love seeing that you are aware of the counterpoints. By preemptively addressing an objection, you demonstrate intellectual maturity and make your own argument seem unassailable. Topic sentence powering. Ensure every body paragraph begins with a topic sentence that contains both your main claim and a relevant limiting factor or qualifier, e.g., while X is true, Y must take precedence because Z's. A good topic sentence isn't just a statement, it's an argumentative mini-thesis for that paragraph. Including qualifiers makes your argument sophisticated and forces the reader to follow complex logic. The "so what" test. After writing any claim, ask yourself, so what? Why should the reader care about this specific point? If you can't answer, cut it or strengthen its link to global impact. This is your ultimate editing tool. It forces you to move beyond merely listing facts and instead focus on significance. Every claim must ultimately tie back to a compelling "so what?" the massive human or policy consequence. Now it is your turn to practice. Read or listen to the following passage carefully. Task type: argumentative essay, academic. Prompt: many argue that global health funding should prioritize vaccine development over preventative infrastructure like clean water sanitation. To what extent do you agree with this statement? Write a persuasive essay outlining your position and supporting it with detailed reasoning. Question 1. What is the key requirement of this task? Pause the video now and write your answer before we reveal it. The correct answer is, the prompt requires you to take a definitive stance, agree, disagree, or partially agree on the allocation debate between vaccines and sanitation infrastructure. You must argue why your chosen priority is superior. Remember that "to what extent" means there is no single right answer. You must define the scope of your agreement yourself. Do not merely discuss both sides. You must build a focused, defensible argument for one side while acknowledging the other. Question 2. What would a Band 7 response focus on first? Pause the video now and write your answer before we reveal it. The correct answer is, a high-scoring essay will establish its core thesis by defining priorities and infrastructure. It should argue that sustainable prevention like clean water is not merely an alternative, but the foundational necessity upon which effective vaccination programs must ultimately rely. Focusing on sanitation as a foundation is a complex argument because it forces you to link 2 seemingly separate topics. By arguing for interdependence, you elevate your analysis beyond simple comparison and achieve true depth. When you encounter a "to what extent" question in biomedical ethics, it is not asking for a simple yes or no answer. Instead, it demands that you explore the degree of validity or agreement regarding a specific ethical principle. You must argue your position by acknowledging limitations and nuances. Think of it as finding the shades of gray rather than just black and white. Your response needs to demonstrate proportionality in your critical thinking. The key takeaway here is moving beyond binary arguments. To what extent signals that your professor expects a measured, proportional discussion. You aren't arguing if something is ethical, you are debating how much of it is ethical under specific circumstances. Here are 4 examples. To what extent should patient autonomy supersede institutional safety protocols? Focus on conflict of duties. This example pits personal rights against collective good. Your answer must establish a hierarchy in which specific scenarios does one right ethically trump the other. Don't just list both sides, weigh them. To what extent is genetic screening morally justifiable for preventative care? Focus on predictive ethics. Here, the ethical challenge lies in predicting future harms and rights. You need to discuss not just the medical capability, but also the social pressure or stigma that might arise from knowing potential conditions. To what extent should resource allocation prioritize efficacy over equity? Focus on distributive justice. This is a classic ethical tension. Efficacy suggests giving resources where they work best, while equity demands fair distribution regardless of outcome likelihood. Your argument must propose a framework for resolving this conflict. To what extent does technological advancement erode the traditional patient-physician relationship? Focus on human elements. This question requires you to balance progress against humanity. You must analyze how technology changes interaction. Is it just information transfer, or is it fundamentally changing trust and empathy? Here are 3 reasons why this matters. Demonstrating critical depth. It proves you could hold 2 conflicting ideas simultaneously. Academic ethics rarely has perfect answers. By showing that you understand the validity of both sides, you elevate your writing from mere description to genuine critical analysis. Avoiding ethical reductionism. This prevents oversimplification into simple moral absolutes. Reductionism is treating a complex issue as if it only has 2 poles. Advanced writing demands that you acknowledge the variables, the context, the culture, and the specific population involved. Achieving thesis sophistication. Your thesis must be an argument, not a statement of fact. A strong to what extent thesis doesn't just say yes and number, it argues when the answer shifts. For example, while X is crucial, its value diminishes significantly when Y factor is present. Your body paragraph should adopt a concessional structure. First, fully address the opposing view that seems most compelling. Second, concede its validity under certain conditions or contexts. Third, introduce your main argument by setting clear boundaries for when and why those limitations apply. This 3-part process builds undeniable argumentative momentum. Think of this model as a sophisticated pivot point within your essay. You are not just listing pros and cons, you are building an intellectual bridge from the opponent's strongest point directly into yours, making your own thesis feel inevitable. And here are 4 ways to practice. Identify key variables first. Before writing, list 3 factors that change the ethical outcome. Never treat ethics as a monolithic field. Always ask, what is the population? What is the resource level? And what is the regulatory environment? These variables are your strongest points of analysis. Use qualifying language. Phrases like under certain circumstances or to a limited degrees are essential. These phrases signal sophistication to the reader. They show you understand that ethics are rarely absolute and require careful contextual framing. Structure, paragraphs by conflict. Dedicate each body paragraph to resolving a specific ethical tension. Instead of writing paragraph 1 on autonomy, write paragraph 2 discussing the conflict between autonomy and public health. This makes your structure clearer and more argumentative. Refine your thesis statement. Always make your thesis a complex statement of partial agreement. Do not leave room for ambiguity in your introduction. By making your final thesis highly specific, you guide the reader through the exact boundaries of your argument from start to finish. When explaining complex scientific concepts, examiners are listening for more than just accuracy, they listen for structure. You need to guide the listener through your logic as if you were teaching them. This requires clear signposting telling the audience exactly where you are going next. Furthermore, when defining a complicated process, use transitional phrases that help connect one idea to the next smoothly. Think of yourself as narrating an educational documentary. The key here is managing transitions between different levels of detail. Instead of just listing facts about DNA replication, for example, you must signal whether you are moving from a general overview to specific molecular step. Practicing these signposting phrases will make your speech sound deliberate and highly organized. Let's go through 5 words. For each word, I will say it clearly, then explain how to produce it correctly. The word is, to illustrate this point with an example. Say it again, to illustrate this point with an example. Dia. Never just state a concept, always ground it in a practical or hypothetical illustration. Using to illustrate signals that you are about to pause the theoretical discussion and provide tangible proof, which significantly boosts your coherence score. The word is, from a biochemical perspective. Say it again, from a biochemical perspective. When a concept has multiple viewpoints, say, an economic versus biological impact, use this phrase to signal a distinct shift in your analysis framework. It shows the examiner that you are thinking multidimensionally about the topic. The word is, this mechanism suggests that. Say it again, this mechanism suggests that. Simply stating this means can sound weak. By using suggests, you maintain an academic tone while effectively drawing a logical inference from the data points you just presented. Always follow this phrase with your main argument. The word is, to elaborate on the role of genetics. Say it again, to elaborate on the role of genetics. If the prompt asks for more detail on one specific component, do not just ramble. Use this phrase to politely and academically tell the listener exactly which part of the concept you are about to expand upon. It keeps your speech focused. The word is, conversely, we must also consider. Say it again, conversely, we must also consider. When contrasting 2 scientific models or theories, converselys is much stronger than simply saying but. It establishes a clear symmetrical opposition between 2 concepts, ensuring your argument remains balanced and well-developed. Let's compare 4 pairs. It's like when the body kinda uses energy. The physiological process can be understood as requiring metabolic energy. Precision in terminology. In academic speaking, specificity is everything. Notice how replacing kinda with formal technical terms elevates your register instantly. Always aim to use the precise scientific vocabulary rather than simple descriptions of function. So basically, it means that this suggests that there is a direct correlation between formalizing conclusions. Avoid casual qualifiers like basicallys also. These weaken your authority. Instead, use sophisticated verbs and nouns to formalize your conclusion, making your argument sound definitive and well-researched. Because of the environment stuff. Due to environmental factors, we observe a significant increase in elevating causal language. When discussing cause and effect in science, upgrade your conjunctions. Phrases like due to or consequently signal a higher level of linguistic control than simple connecting words. Like, genetics, it changes things. Genetics plays a pivotal role in determining systemic traits and outcomes. Using academic verbs, nouns. Instead of vague actions like changes things, use powerful academic verbs such as determines, influences, or regulates. This makes your explanations sound much more authoritative and scientifically grounded. Watch out for these 3 common mistakes. And vague language. So the gene thing is like it turns off. Precise signposting. To explain this mechanism, we can observe that the gene's expression is subsequently downregulated. The biggest mistake under pressure is falling back on filler words. To combat this, replace them with a sophisticated pause marker or, better yet, use a signposting phrase like to elaborate, to buy yourself time and sound prepared. Weak grammar, we should try to make sure that the protein work fast enough. Stronger modals and nominalization. It is crucial that we ensure the protein can fold rapidly enough for proper function. When discussing necessity in science, use formal modal verbs and nominalizations. Say, it is crucial that instead of we should, which instantly raises the formality and academic tone of your speech. Topic, drift and simplicity, and also climate change affects food because it makes things weird. Coherent topic linking. Furthermore, climate change impacts global food security by altering predictable seasonal patterns. If you start discussing one point and drift to a related but unlinked concept, pull yourself back with a linking phrase. Use returning to the core issues or to circle back to regain focus gracefully. Here are 4 ways to practice. Self-recording and analysis. Record yourself explaining a complex concept like photosynthesis and then listen back specifically for weak transitions or repetition. When reviewing your recording, don't just focus on what you said, analyze how you linked the ideas. Did you pause too much? Was your signposting clear? This metacognitive step is critical for improvement. Targeted IELTS Part 3 practice. Use discussion questions that require comparison, e.g., is technology better than traditional methods, and force yourself to use contrasting language. IELTS Part 3 is perfect because it demands abstract thought, which is exactly what scientific explanation requires. Constantly forcing yourself to compare X versus Y will naturally improve your ability to structure complex arguments. Shadowing expert speakers. Listen to TED Talks or university lectures on science and immediately repeat phrases and linking structures you admire. Shadowing isn't just repeating words, it's adopting the rhythm, intonation, and flow of highly fluent speakers. Pay attention to where, as they pause, those pauses are often used for dramatic emphasis or clear structural breaks. The teach it back method. Pretend you are teaching a layperson about a scientific topic. Structure your explanation from general principles to specific examples. This method forces you to adapt your language register instantly, moving from highly technical jargon to accessible metaphors. This ability to modulate complexity is the hallmark of truly coherent and fluent high-level speaking. Now it is your turn to practice. Read or listen to the following passage carefully. You are asked to explain the concept of epigenetic modification. You have 3 minutes and must cover 1. What epigenetics is in simple terms, 2. How it differs from genetic mutation, and 3. 1 real-world implication for health. Question 1. What is the most important thing to include in your answer? Pause the video now and write your answer before we reveal it. The correct answer is a clear distinction between gene sequence changes and environmental modifications that affect gene expression. Remember, defining the difference the how versus the what of genetics is, where you demonstrate superior coherence. Use those contrastive phrases we practiced to make this differentiation crystal clear. Question 2. What language feature should you demonstrate? Pause the video now and write your answer before we reveal it. The correct answer is structured signposting and complex causal linking, e.g. gone, consequently, thereby leading to. When delivering your answer, actively use a distinct phrase every time you move from point 1 to point 2 or when moving from the cause to the effect. This constant signposting acts as an invisible map for your listener and boosts your fluency score. When we talk about health in English, there are several ways to phrase the same idea. Sometimes, the clinical language is precise but difficult for a layperson to understand. Paraphrasing isn't just finding a synonym, it's adjusting your register and tone based on who you are talking to. Your goal should be clarity paired with confidence. We want your medical descriptions to sound authoritative yet approachable. Remember that mastering these phrases is about audience awareness. If you are speaking to a patient, use the conversational language. If you are presenting at a conference, then the technical jargon is appropriate. Learning this shift makes you sound like a true expert in communication. Let's go through 6 words. For each word, I will say it clearly, then explain how to produce it correctly. The word is hypertension. Say it again, hypertension. While this word is academically perfect, it should be reserved for formal settings. When speaking casually, remember to use phrases like high blood pressure instead. The word is elevated. Say it again, elevated. This is one of your most useful words because it's versatile. You can use elevated for anything from risk to blood sugar, making your language much richer. The word is cardiovascular. Say it again, cardiovascular. This adjective is a fantastic way to group many related concepts together. Instead of listing several body parts, you can use this single word for efficiency. The word is measurements. Say it again, measurements. This word is much broader than readings and is excellent for formal reports or discussions. It implies the process of taking the data, not just the number itself. The word is readings. Say it again, readings. This is the most natural conversational word to use when talking about numbers. It's perfect for dialogue because it sounds less stiff than measurements. The word is incidence. Say it again, incidence. This advanced noun helps you sound highly academic when discussing public health trends. Use it when comparing rates over time, rather than just describing one person's condition. Here are 5 examples. Instead of saying, he has hypertension, you can say that his blood pressure is consistently elevated. Uses elevated, hypertension, adjective noun. Notice how we smoothly transition from the technical term to a descriptive phrase. This makes your speech sound much more empathetic and natural. The doctor reviewed his latest cardiovascular measurements and was concerned by the readings. Uses cardiovascular, measurements, readings, AGN-RN. Here we are stacking 3 related vocabulary items in one sentence. This shows strong fluency because all the words fit together perfectly. The study noted a sharp increase in the incidence of respiratory issues among smokers. Uses incidence noun. When discussing public health, remember that incidence is your best friend. It allows you to quantify trends accurately without sounding like a textbook. We need to track all the patient's vital measurements over time to determine if the readings are stable. Uses, measurements, readings, NNN. This example demonstrates how measurements refers to the general process, while readings refers specifically to the resulting numbers on the screen. Maintaining a healthy diet is crucial for reducing cardiovascular strain and managing elevated risks. Uses cardiovascular elevated AGH. This sentence gives you advice, which is often the most natural context. Using elevated risks here makes sure your tone remains advisory rather than strictly clinical. Let's compare 4 pairs. High blood pressure. Compare it with hypertension. Informal casual versus formal clinical register. When you are in conversation, always lean toward the conversational phrase. Using hypertension too often can make your speech sound overly formal or even unnatural. Increased risk. Elevated incidence. General warning versus academic statistical reporting. If you are speaking to a group of peers, increased risk is fine. But if you are presenting data at a medical conference, using elevated incidence adds significant academic weight. Showed reading. Recorded measurement. Simple action versus formal documentation of results. We often use showed when speaking, but if you are writing a report or presenting formal findings, using verbs like recorded or indicated is much stronger. Heart problem. Cardiovascular dysfunction. Layperson phrase versus technical academic terminology. Do not use the technical term unless absolutely necessary. If you are explaining a condition to someone who is worried, stick with heart problem for immediate understanding. Here are 4 ways to practice. Collocation, completion. Complete common pairs, hearts, bloods, vessels, vessels. Focusing on collocations is key to fluency. Instead of just knowing the word cardiovascular, you need to know what words pair well with it, like system or disease. Word mapping, related concepts. Map out all terms related to blood pressure, e.g., systolic, diastolic, cuff, reading. This strategy helps you build a conceptual network around a topic. By linking words visually, you improve recall and can generate ideas quickly during speaking tasks. Contextual substitution drill. Rewrite sentences, replace very highs with elevated, or replace bad heart condition with cardiovascular risk. This is a direct way to boost your register. It forces you to think of the most precise academic word rather than relying on common adjectives. Spaced repetition review. Review today's words: hypertension, incidence, tomorrow, and then next week. Vocabulary is muscle memory. Don't try to memorize everything in one session. By reviewing these advanced terms over several days, they will move into your long-term active vocabulary. Now it is your turn to practice. Read or listen to the following passage carefully. Recent studies show that the incidence of cardiovascular issues is rising rapidly. The doctor noted that while the patient's readings were slightly elevated today, she must continue monitoring her blood pressure at home. Proper measurements and lifestyle changes are crucial to managing this gradual increase in risk. Question 1. Find a word in the passage that means the rate of appearance of a disease. Pause the video now and write your answer before we reveal it. The correct answer is incidence. The context here is about tracking how often something happens. If you substitute incidence with rate, it loses the formal academic flavor we are aiming for. Question 2. Use one of the target words in your own sentence discussing preventative healthcare. Pause the video now and write your answer before we reveal it. The correct answer is, we need to educate people about how lifestyle changes can lower their cardiovascular risk levels. Example: a strong answer like this shows that you aren't just recalling definitions, you are genuinely integrating the word into a complex, natural-sounding thought. Today we are focusing on conditional structures, the grammar tool that allows us to speculate about possibilities. We aren't just talking about, if this happens, then that will happen. Mastering the difference between 0, first, second, and third conditionals is crucial for academic writing. In medicine, we often discuss what might have happened or what could change. For IELTS, demonstrating control over these structures shows a high level of grammatical sophistication. Using them correctly elevates your score beyond simple factual reporting. Remember that the choice of conditional isn't just about grammar, it dictates the tone and time frame of your argument. If you are speculating about policy changes in the near future, the first conditional is strongest. However, if you are challenging current scientific consensus, shifting to the second conditional immediately adds weight and nuance to your perspective. Here are 4 examples. If gene editing technology becomes widely accessible, personalized medicine will revolutionize treatment for inherited disorders. Effective use of the first conditional, real possibility. Strong prediction based on current trajectory. The structure is clear and highly academic. Notice how this example doesn't just predict, it establishes a direct cause and effect relationship, linking technological progress to systemic change. This level of detailed causality is exactly what high-scoring essays require. If human immune responses were more predictable, vaccine development would accelerate significantly. Second conditional, hypothetical, unlikely reality. This suggests a current deficiency and posits an ideal state of affairs for better science. The second conditional allows you to argue from a position outside the present truth. By saying, if they were more predictable, you are effectively critiquing the current limitations in our understanding, which is excellent critical writing. Had AI been integrated into diagnostic screening earlier, many fatal misdiagnoses would have been prevented. Third conditional, impossible past. This is a powerful regret or counterfactual statement about historical failures. It shows critical hindsight. The third conditional uses the perfect structures had and would have, which immediately signals to the reader that you are discussing a major divergence from known history. Use this sparingly, but powerfully. Should funding for rural research increase, we would see breakthroughs in preventative care addressing health disparities. Inversion, formal alternative to first conditional. Starting with should is highly formal and sophisticated, suitable for academic writing. Using inversion like starting with should funding instead of if funding increases is a high-level marker of proficiency. It allows you to sound more authoritative and academically polished while maintaining the conditional meaning. Let's compare 4 pairs. If medicine gets better, people will live longer. Should longevity treatments become feasible, humanity would witness a profound shift in demographic patterns. Using formal vocabulary and advanced structures, inversion modal verbs. The key improvement here is moving from simple conversational language to academic register. Replacing gets better with longevity treatments become feasible. instantly elevates the perceived complexity of your writing. They did not study gene therapy before, so we lost chances. If they had studied gene therapy earlier, significant advances in genetic understanding might have been achieved. Using the third conditional to discuss missed opportunities, this provides a sophisticated framework for critique. We moved from simple past statements of fact to an academic counterfactual using might have. This subtle change allows you to criticize historical policy decisions without making overly aggressive claims. If we knew more, we would fix the problem now. Were we equipped with better diagnostic tools, we could mitigate many current health crises immediately. Using were for formal second conditional inversion, this sounds highly academic and sophisticated. Starting a conditional clause with were is simply an alternative to the standard if I were. It signals extreme formality and shows that you have mastered structural variation, which examiners notice. The vaccine will help people if they get it. If public compliance reaches a certain threshold, the vaccination program would drastically reduce community transmission. Using specialized vocabulary, compliance, threshold, and complex conditional framing, focus on scope. Notice how we shifted from a simple action, getting the vaccine, to a systemic measure, public compliance. This depth of analysis linking individual actions to population dynamics is crucial for high-level IELTS writing. Watch out for these 3 common mistakes. Incorrect tense mixing, mixed conditional error. If the funding will increase, we can research more. Correct first-second hybrid. If funding increases, we could research more. The primary mistake here is mixing the future tense, will, with the present conditional structure. Remember that the if clause must use a simple present or past form, never will. This small correction makes your entire sentence sound much more natural. Weak phrasing, informal register. If I had known about the side effects, I would not have agreed to this study. Stronger academic verb choice. If I had known about the side effects, I wouldn't have consented to the study. While grammatically correct, would not have agreed, is weak. By substituting a precise academic verb like consented, you maintain the high clarity of the third conditional while demonstrating a specialized vocabulary range. Missing subjunctive incorrect tense pairing. We would feel better if they cures this disease. Correct second conditional form. We would feel better if they cured this disease. This is a classic error where the main clause uses would, but the if clause reverts to a simple present. The second conditional requires the past tense in the if clause, regardless of whether the scenario is currently possible or not. Here are 4 ways to practice. Start with counterfactual thinking. Don't just write what is true. Spend 5 minutes brainstorming the ideal but impossible medical scenario to force yourself to use the second conditional. Think about a disease that currently has no cure, and then structure your opening argument around the ideal condition needed for its treatment. This primes your brain for sophisticated conditional grammar. Use had or were to open sentences. Practice intentionally starting 20% of your sentences with formal inversions like had research been adequate or were resources unlimited. These inverted structures are powerful rhetorical tools. They immediately signal a high level of fluency and grammatical mastery to the examiner, making them excellent points for score boosts. Map out your argument's timeline. Before writing, decide if you are discussing 1 current reality, first conditional, 2 ideal change, second conditional, or 3 historical failure, third conditional. This planning step prevents you from mixing conditional types haphazardly. By pre-selecting the grammar needed for each paragraph's main point, your writing will feel much more cohesive and intentional. The if, then sentence expansion. Take simple cause-effect statements, e.g., pollution causes illness, and expand them into full conditional structures to practice the flow. Think of this as sentence scaffolding. Start with a weak premise, apply one of the 3 advanced conditionals, and then follow up by explaining the scope and limitations of that prediction. Now it is your turn to practice. Read or listen to the following passage carefully. Task type, discussion essay. Prompt. The advancements in CRISPR gene editing technology promise cures for inherited diseases. To what extent should global research funding prioritize individual curative treatments over preventative public health measures, and what ethical considerations arise? Approx. Only 50 words. Question 1. What is the key requirement of this task? Pause the video now and write your answer before we reveal it. The correct answer is, the response must balance two competing ideas, curative versus preventative, while consistently using advanced conditional structures to discuss hypothetical outcomes. Because this prompt asks to what extent you cannot take a simple side, your thesis needs to argue for a measured balance. Use conditionals like, if we prioritized cures, then, and however, if we focused on prevention, to show the tension between these two ideas. Question 2. What would a Band 7 response focus on first? Pause the video now and write your answer before we reveal it. The correct answer is, a strong answer would start by acknowledging current successes, first conditional, but quickly pivot into discussing the massive ethical unknowns and limitations of today's technology, second, third conditionals. Do not just list pros and cons. Instead, structure your argument around if X were true. This demonstrates that you are thinking critically about the conditions under which these technological advancements can actually be successful or ethical. In Part 3, examiners aren't just looking for grammatical complexity, they are assessing your ability to navigate ambiguity. They want you to sound like a sophisticated policy analyst who understands trade-offs and inherent conflicts within large systems. This means going beyond simply saying something is good or bad. Instead, you must discuss the underlying mechanisms, the unintended consequences, and the necessary compromises. Think of your answer as presenting a well-researched academic paper, even if you are speaking it aloud. Remember that high band scores aren't reserved for perfect grammar. They belong to those who demonstrate intellectual maturity in their response. When discussing policy, always try to introduce counter-arguments and then refute them gracefully. This technique of acknowledging complexity proves a depth of thought far beyond simple agreement or disagreement. Let's go through 5 words. For each word, I will say it clearly, then explain how to produce it correctly. The word is, while it is true that, we must also consider. Say it again, while it is true that, we must also consider. Use this phrase when you want to show balance and fairness in your argument. It signals to the examiner that you have considered both sides of the debate, which is highly valued in complex policy discussions. The key is to use while accurately, so it doesn't sound like a mere concession. The word is, the underlying structural issue here seems to be. Say it again, the underlying structural issue here seems to be. Instead of just criticizing the visible failures, this phrase allows you to dissect why Hugh in the first place. This shows analytical depth. You aren't just complaining, you are diagnosing a system problem. Use it when discussing systemic flaws. The word is, on balance, I believe that the most critical factor is. Say it again, on balance, I believe that the most critical factor is. When you feel like you've listed many points but need one strong takeaway, this phrase helps you summarize your complex thoughts. It suggests careful consideration and prioritization among competing ideas. This is perfect for wrapping up the main body of your argument. The word is, to extrapolate from this point. Say it again, to extrapolate from this point. This marker elevates your response from descriptive to predictive. You are using the information provided to hypothesize about future trends or necessary changes in policy. This is excellent for discussing long-term reform outcomes and showing forward thinking. The word is, it's imperative that we distinguish between. Say it again, it's imperative that we distinguish between. Many policy debates conflate two different things, for instance, access to care and quality of care. Use this phrase to clarify your thinking and prevent the examiner from misunderstanding which concept you are actually addressing. Clarity is paramount in deep discussion. Let's compare 4 pairs. It's just too expensive and complicated. The inherent structural challenges regarding cost-effectiveness are significant. Shifting from emotional complaint to academic analysis. Notice how the revised version replaces vague feeling words like twos with precise, formal terminology. Good policy argumentation requires replacing emotive language with objective, analytical nouns and adjectives. The government should just make it free for everyone. Universal coverage necessitates comprehensive governmental intervention to ensure equitable access. Changing simple demands into formal policy statements. We move from a colloquial demand to specific academic concepts like universal coverage and equitable access. This shows that you're discussing established global health principles, not just personal wishes. If we change the rules, people won't use it right. If incentives are misaligned, there is a high risk of non-adherence among patients and providers. Using technical vocabulary to describe behavioral issues. Instead of blaming people for misuse, the sophisticated approach identifies structural failures like misalignment of incentives. This frames the problem as an economic or systemic flaw rather than a moral one. It's hard, right? We need more money. Addressing this requires substantial fiscal reallocation and sustainable long-term funding models. Replacing generic requests with specific economic solutions. A high-band response doesn't just state that something needs more money, it suggests how the money should be acquired, whether through reallocation or new funding mechanisms. This demonstrates a practical understanding of public finance. Watch out for these 3 common mistakes. Overgeneralizing leading. Many people say that private insurance is best because it's faster, balanced and qualified. While proponents argue for the efficiency of private insurance, its inherent disparity risks widening socioeconomic gaps. The mistake here is taking a common belief as truth. A better approach qualifies that belief using while proponents argue. This shows you are aware of the argument, but not convinced by it, which is crucial in deep debate. Addressing symptoms, surface level. Because people are sick now, we need more doctors. Identifying systemic solutions, given the increasing prevalence of chronic diseases. A paradigm shift toward preventative care is more critical than simply increasing physician numbers. A common error is stopping at the most obvious solution. To excel, you must look deeper, not just more doctors, but preventative care models or policy changes that address root causes of illness. This demonstrates true analytical depth. Vagueness, lack of specificity. If we fund this way, it will be okay. Hypothetical and measurable. Should funding adopt Model X, the projected outcome suggests a measurable improvement in patient outcomes within 5 years. Never make vague predictions. By introducing specific models or timeframes, you transform a mere opinion into a testable, hypothetical policy proposal. This structured thinking makes your arguments sound authoritative and well-researched. Here are 4 ways to practice. The 3 layers response method. Structure your answer by addressing the immediate issue, the surface, then the root cause, and finally, a long-term policy recommendation. Don't just talk about what is happening, always elevate your discussion. By systematically moving from symptom to cause to solution, you create a deeply layered argument that naturally fills time while maintaining intellectual rigor. The contradict and refutes drill. When practicing, force yourself to argue the opposing side in the first minute, then dedicate the second minute to refuting it. This builds argumentative agility. This technique forces you out of your comfort zone and into rapid critical thinking because you have to anticipate counterpoints immediately. It's an excellent way to simulate the natural back and forth of a high-level academic debate. Preemptive rehearsal. Identify 3 complex policy phrases on healthcare reform, e.g., fiscal sustainability, resource allocation, and practice integrating them into unrelated topics. By preloading your vocabulary, you make high-level language feel natural rather than forced. This ensures that when the topic shifts suddenly, your advanced lexicon is immediately available to maintain fluency. Self-correction recording. Record yourself debating a policy point and then listen back specifically for moments where you used filler words or paused due to lack of lexical options. The goal here is not just fluency, but controlled pausing. A well-placed deliberate pause while gathering a complex thought sounds academic. A pause due to searching for basic grammar can break your rhythm. Now it is your turn to practice. Read or listen to the following passage carefully. You are discussing the future funding models for global health initiatives. You must discuss whether wealth-based contributions, rich nations paying more, or Mandatory international taxation is the most effective way to fund universal care in developing nations. ETS cover, ethical obligations versus economic feasibility. SECA points, funding sources, taxation, donations, loans. To time, speak for 2 minutes. Question 1. What is the most important thing to include in your answer? Pause the video now and write your answer before we reveal it. The correct answer is a balanced assessment that recognizes the ethical imperative while offering a pragmatic, multi-source funding solution. Do not commit solely to one model. The key here is synthesis. You cannot pick just taxation or donations. You must build an argument showing how these different sources can cooperate. This holistic approach demonstrates that you view the problem as a complex system needing multiple inputs. Question 2. What language feature should you demonstrate? Pause the video now and write your answer before we reveal it. The correct answer is advanced conditional structures, e.g., if funding was structured this way, it would mitigate, and concession clauses, although X is appealing, Y is more realistic. By using advanced conditionals, you can explore hypothetical scenarios without presenting them as absolute facts. This allows for sophisticated speculation that maintains a highly academic tone. Focus on the structure, if. Then, to build complex logical links. When you are asked to define a complex ethical term like autonomies or beneficence, the examiner is not just listening for a dictionary definition. They want to hear your ability to elaborate and show critical depth. Your response must move beyond simple definitions by discussing boundaries, exceptions, and real-world conflicts between these concepts. A strong answer will define the term, acknowledge its ambiguity, and provide at least one specific example of where it might break down or conflict with another ethical principle. Remember that deep understanding isn't about knowing a single perfect definition, it's about showing nuance. If you can discuss when a concept is difficult to apply, for instance, when beneficence conflicts with autonomy, you demonstrate the higher levels of critical thinking required for advanced speaking scores. Let's go through 5 words. For each word, I will say it clearly, then explain how to produce it correctly. The word is. When we talk about X, we must first delineate. Say it again. When we talk about X, we must first delineate. Use this phrase when you need to establish the precise limits of a term. It signals that your answer will be structured and highly academic, immediately elevating your discourse. The word is. A key distinction here is the difference between. Say it again. A key distinction here is the difference between. This phrase is invaluable when two similar ethical concepts are in conflict. It shows you understand that these terms don't operate in a vacuum and forces a detailed comparison. The word is. To illustrate this point, consider the scenario where. Say it again. To illustrate this point, consider the scenario where. Never just state an idea, you must prove it. Leading with a specific hypothetical scenario forces your speaking to become more vivid and concrete for the listener. The word is, however, we must also consider the implications for. Say it again, however, we must also consider the implications for. A truly advanced answer recognizes that there are always counterpoints. This phrase allows you to pivot and demonstrate comprehensive thinking without losing your main argument. The word is, ultimately, the concept hinges on whether or not. Say it again. Ultimately, the concept hinges on whether or not. This is a powerful concluding phrase. It helps wrap up a complex discussion by boiling down all your detailed points into one central, memorable deciding factor. Let's compare 4 pairs. The patient needs to make their own choice. The principle of autonomy requires that the competent individual must retain self-determination. Precision and jargon use. Notice how we moved from a simple statement to specialized vocabulary. Using precise academic terminology, directly related to ethics, shows fluency in the subject matter. It's better for them to do this. We must weigh potential paternalistic actions against safeguarding their best interest. Nuance and ethical framing. Simple phrases sound judgmental. By using weighing, you adopt a neutral, academic tone that suggests careful ethical consideration rather than just giving advice. Does this rule really help people? To what extent does this protocol genuinely contribute to beneficence in practice? Formal questioning techniques. Instead of asking a simple yes or no question, framing it with "to what extent" demands a measured, detailed response that is perfect for high-level discussions. This means we ignore their wishes. Ignoring the patient's stated preferences would constitute a direct infringement upon their rights. Stronger verbs and noun forms. We are replacing weak verbs like ignores with stronger, more formal equivalents like constitute an infringement. This makes your speech sound authoritative. Watch out for these 3 common mistakes. Oversimplification. Autonomy means doing what you want. Depth and qualification. Autonomy implies the capacity and freedom to make informed decisions based on one's self-perceived values. The biggest mistake when discussing philosophy is oversimplifying it. Always add qualification words like capacity, informed, or self-perceived to show you understand the limits of the term. Circular reasoning. Beneficence means doing good, so we just do what is best. Acknowledging conflict. While beneficence aims for benefit, determining what constitutes good often requires balancing competing ethical duties. Don't define a term solely using the word itself. Instead, immediately introduce potential conflicts or challenges to that definition. This shows depth of thought. Absolute statements. We should always prioritize patient choice. Conditional language, hedging. While prioritizing patient autonomy is ideal, exceptions must be considered, such as in public health crises. Never use absolute words like always, never, or must. Use conditional language often. May tends to make your argument sound more balanced and academically cautious. Here are 4 ways to practice. Simulated ethical dilemma response. Choose a modern ethical conflict like vaccine mandates or genetic screening and deliver an answer defining the key principles at play. This is excellent practical training because it forces you to combine definition, comparison, and example delivery all in one continuous speech. It mirrors high-stakes academic speaking. Concept mapping and speaking. Take a difficult term, write down 5 related concepts, and then speak about how they interact with the main term. This structured approach helps mitigate topic drift. By linking your ideas using strong, cohesive devices, you demonstrate sophisticated organizational skills that examiners highly reward. The 3 layers definition. Practice defining any ambiguous term in 3 distinct ways. 1. Simple definition. 2. Academic definition. 3. Practical limitation. This technique ensures your answer has depth. By consciously moving from simple to complex, you demonstrate that you can adjust your register and level of detail depending on the prompt's expected formality. Shadowing expert discourse. Listen to experts debating bioethics or medical policy, focusing only on how they transition between ideas. Mimic their pacing and linking phrases. Intensive listening helps you internalize high-level academic cadence. Don't just repeat the words. Focus on how they pause, emphasize key terms, and build rhetorical momentum. Now it is your turn to practice. Read or listen to the following passage carefully. You are discussing the ethical principle of patient care. Define paternalism and contrast it with autonomy. What is the primary conflict between these 2 principles? Provide a specific example, e.g., mandatory vaccination or lifestyle changes. Suggest conditions under which one principle might legitimately override the other. Question 1. Most important inclusion? Pause the video now and write your answer before we reveal it. The correct answer is, do not simply define both terms separately. You must focus on the tension that between them, demonstrating where they conflict and why that conflict is ethically difficult to resolve. This shows mastery of the topic. The goal here is synthesis, which means pulling together multiple ideas into one cohesive argument. Try to structure your answer around the struggle rather than listing facts. Question 2. Language feature to demonstrate? Pause the video now and write your answer before we reveal it. The correct answer is, the use of conditional structures and qualifying language might suggest could be viewed as throughout the response. This maintains an objective, academic distance. Because this is a highly subjective debate, your tone must remain impartial. Using conditionals prevents you from making definitive statements that might sound overly strong or biased. When discussing personal experiences, especially health-related ones, your goal is not just to report facts, it is to tell a story. The most effective structure follows an arc. Start with the setup, the before picture of your life or condition. Next, describe the pivotal event or challenge that occurred. Finally, and perhaps most importantly, conclude by detailing the resolution, the recovery, and the key lesson you learned from it. This framework immediately elevates your response beyond simple description into reflective storytelling. Remember that IELTS speaking tasks often require depth of thought, not just factual accuracy. By using this story arc setup, conflict, resolution, you naturally guide the examiner through your thought process. It demonstrates coherence and sophisticated narrative control, which are crucial for scoring highly in fluency. Here are 4 examples. Initially, I considered my diet routine, but when the flare-up began last year, I realized how unsustainable my old habits were. The subsequent commitment to Mediterranean cooking wasn't just about losing weight. It fundamentally shifted my relationship with food and energy. Effective because it uses before-after contrast and elevates the topic from a diet change to a lifestyle shift. Notice how this writer doesn't dwell on the difficulty of the flare-up. Instead, they focus on the transformation. This shows critical insight. The experience led them to a profound life lesson, which is what test markers want to hear. My initial response to receiving the diagnosis was pure panic. However, I quickly learned that proactive medical consultation and adhering strictly to my physical therapy schedule were far more powerful tools than sheer willpower. Strong because it moves from emotional reaction, panics, to practical action, proactive consultation, showing accountability. This example successfully navigates a difficult topic by balancing vulnerability with agency. You acknowledge the struggle, but you immediately pivot to what you did about it. This confident tone is key in an interview setting. It took months of consistent effort, early morning walks, and learning stress management techniques to feel normal again. The biggest change wasn't the physical recovery, but rather realizing that consistency trumps intensity every single time. Powerful because it emphasizes process, consistent effort over a single dramatic event. It provides a quotable takeaway. This response excels by providing a universal truth. Gradual progress is better than sudden bursts of effort. Remember, your final lesson, the takeaway message, is often the most memorable part for the listener. While others focused on medication, I found that building a strong social support network was equally vital. The accountability from friends and family provided a different kind of medicine entirely. Excellent because it broadens the scope beyond purely medical solutions to include psychological or social factors. When discussing health, don't limit yourself to biological answers. By including social support, you demonstrate a holistic understanding of wellness. This shows high-level thinking and an ability to synthesize complex ideas. Let's compare 4 pairs. I got sick last year. I went to the doctor and took pills. After falling ill last year, my journey started with a thorough consultation that helped me understand the root causes of my symptoms, leading to a comprehensive treatment plan. The strong version uses precise vocabulary, thorough consultation, root causes, instead of vague statements. It also specifies the action taken. Notice how the weak side simply states facts, while the strong side explains how those actions were helpful. Always aim to explain the mechanism or the outcome. Don't just list what happened. I now exercise daily because I feel better. The realization that physical activity was essential prompted me to integrate daily walking into my routine, which significantly improved both my mood and energy levels. The improvement connects the action, exercise, to a deeper consequence, improved mood, realization. This shows cause and effect. We want to move beyond simple cause A leads to effect B. Better responses explain why that connection exists. Use phrases like, which subsequently led to, or this resulted in the discovery that. I had a bad back. I just rest now. My chronic back pain forced me to reassess my posture and physical habits, leading me to adopt targeted stretches and changes in my daily ergonomics. The strong version identifies the specific problem, posture, ergonomics, rather than generalizing it as bad back. Specificity is your friend when writing or speaking. Instead of saying you felt bad, describe where's and how you felt restricted. This level of detail makes your story believable and engaging for the listener. My family helped me change my life. The unwavering support from my family was pivotal. They held me accountable to appointments, making it easier to sustain the difficult routine required for recovery. This version uses powerful verbs and adjectives, unwavering support, pivotal instead of weak nouns. It also explains the mechanism of help. Avoid using generic phrases like, my family helped me. Instead, specify how they were helpful. Were they providing logistical help? Emotional encouragement? Using active verbs makes your descriptions much more vivid. Watch out for these 3 common mistakes. Vague language. It was really bad. I just felt terrible for a long time. Descriptive and nuanced. The initial period of recovery was challenging. There were days when the symptoms flared up intensely, requiring me to adjust my expectations and pace. Avoid vague intensifiers like really bad or terrible. Instead, use precise vocabulary to paint a picture of the intensity. Phrases like flared up intensely are much more academic and descriptive. Blaming over simplicity. I was diagnosed with it because I ate junk food. Nuanced and balanced. While my diet certainly played a role in exacerbating my condition, the diagnosis stemmed from an underlying genetic predisposition that required lifestyle adjustments to manage effectively. Never accept simple causation. Good speakers understand that health is multifactorial. By introducing complexity, you show critical thinking and a deep understanding of the subject matter. Poor sequencing. First I did this, then I ate better, and then the doctor gave me medicine. Logical flow and chronology. My journey began with lifestyle changes, specifically incorporating morning walks. This initial step allowed me to build momentum before consulting a specialist who then refined my care plan with specific medication. When telling a sequence of events, don't just list them. Use transition phrases like subsequently, following this, or initially. This creates a clear, professionally paced narrative flow. Here are 4 ways to practice. The pivot point strategy. Identify the single moment in your story where everything changed for better or worse. Center 70% of your preparation around describing this pivotal juncture. Don't let the incident itself be the climax. Make the realization about the incident the climax. The pivot point is where you transition from being a passive victim of circumstances to an active participant in your own recovery. The 3 levels vocabulary list. For every key concept, e.g., fatigue, risk, write down 3 versions, basic, intermediate, and advanced vocabulary. This builds instant lexical flexibility. This strategy directly tackles lexical resource. If you start to feel flustered during the interview, having a list of 3 synonyms ready means you can maintain high-level language without pausing or stumbling. Anticipate follow-up questions. For every anecdote you plan, write down at least 2 anticipated why questions. Planning your answers to those questions builds deep confidence. In advanced speaking tasks, examiners rarely let a story end neatly. They will always follow up with, what did that mean for your future? Or how long did it take? Prescripting these extensions prepares you for conversational depth. Use the emotional anchors method. When describing an experience, don't just describe physical symptoms. Anchor every description with a strong emotion, fear, relief, determination. Emotions make narratives engaging. Instead of saying, I felt tired, say I was constantly battling profound exhaustion. By integrating emotional language, you create immediate rapport and interest with your listener. Now it is your turn to practice. Read or listen to the following passage carefully. Task type, speaking writing prompt. IELTS style. Instructions, describe a time when you had to significantly change your lifestyle or routine due to a health concern, whether minor or major. You should detail the initial struggle, the steps you took, and what lasting lesson this experience taught you about self-care. Question 1. What is the key requirement of this task? Pause the video now and write your answer before we reveal it. The correct answer is the ability to structure a personal narrative using a clear before, during, and after arc. The focus must be on reflection and lesson learned, not just relaying facts. Remember that simply writing a good story isn't enough. You need to demonstrate the structure. Use signposting phrases like, initially, however, I soon realized, and ultimately, this taught me. This signals excellent cohesion. Question 2. What would a Band 7 response focus on first? Pause the video now and write your answer before we reveal it. The correct answer is establishing the initial context, the before state, with vivid detail. Then, critically analyzing the struggle before presenting the resolution and its lasting impact. A high band answer spends equal time on 3 elements: describing the challenge vividly, explaining your active role in solving it, and articulating a philosophical or personal takeaway that applies to life beyond health. When discussing scientific topics, precision is everything. We need to ensure our consonants are sharply defined and that our vowels maintain consistent length. Pay close attention to the transition points between sounds. A clear articulation means minimizing slurring or blending. Think of your mouth like a finely tuned instrument. Every muscle must work together for maximum clarity. The goal here isn't just speed, but audibility. Scientific jargon is often loaded with complex clusters that require precise tongue placement to prevent the sounds from mushing together. If you can isolate and exaggerate these difficult consonants slowly, your natural speech will benefit automatically. Let's go through 6 words. For each word, I will say it clearly, then explain how to produce it correctly. The word is sight. Say it again, sight. Focus on that long eyes vowel sound. Your mouth should open wide and maintain a steady position throughout the word. Remember to hit that final sound sharply. Don't let it soften. The word is sight. Say it again, sight. Notice how both of these words use the exact same vowel sound. The key difference is often just the surrounding consonants that follow it. Practice keeping your jaw relaxed while maintaining crisp airflow. The word is cell. Say it again, cell. For this short vowel, feel the tension in your cheeks. The sound comes from a quick, contained burst of air. Avoid letting the sound drag out. It needs to be clipped and immediate. The word is seal. Say it again, seal. Here we contrast the short vowel from cells with the long vowel of seal. Spread your lips wider for that extended E sound. This muscular difference is what separates these 2 words. The word is scope. Say it again, scope. When you pronounce this word, your mouth must transition smoothly from a wider opening to a narrower one. Don't stop the movement. Let the sound glide naturally through those 2 vowel positions. The word is sleep. Say it again, sleep. This pairs up nicely with the previous word. The main difference is often that initial consonant cluster. Focus on separating and articulating every single syllable clearly. Let's compare 4 pairs. First, data. Compare it with datum. Focus on the vowel sound and initial stress. The difference between these 2 words is subtle but critical for accuracy. Think about data as having a quick, neutral syllable in the middle. For datum, ensure your pronunciation reflects that singular, precise unit. First, hypothesis. Compare it with hypothetical. The emphasis shifts and the final syllable changes. While they sound similar, the stress placement is completely different. When you say hypothesis, the focus must be up front. This shift in rhythm helps guide your listener to the correct meaning. First, mechanism. Compare it with mechanics. The final syllable must differentiate between ism and isix. This pair highlights a common difficulty in academic speech. The The ending sound drastically changes the meaning, so you must consciously adjust your mouth shape for that final consonant cluster. First, correlation. Compare it with causation. Avoid confusing correlation relationship with direct cause. These words are frequently misused in scientific discussions. Remember, saying correlation correctly helps you build credibility by showing an understanding of nuanced connections versus absolute links. Watch out for these 3 common mistakes. Wrong, diagnose. Right, diagnosis. A very common error is blending the end of the word. When you say adagnosis, make sure you clearly pronounce that final ss sound and don't trail off into a vague echo. Wrong, photograph. Right, photograph. Remember that the initial phase makes an audible of sound, not a p. Breaking this word into 2 distinct syllables also helps reinforce the correct rhythm and clarity. Wrong, accommodate. Right, accommodate. Syllable count is crucial for these longer, complex words. Focus on maintaining equal length and clear articulation across all the separate parts of the word. Don't rush through those middle syllables. Here are 4 ways to practice. Twister drill. Repeat phrases like phylogenomic findings frequently fail. These drills force you to rapidly switch between difficult consonant sounds. Start slowly, focusing on the crispness of each initial sound before building up to a natural pace. Minimal pair focus. Practice saying etiologies and ontology back to back. This exercise isolates one small point of confusion. By forcing contrast, you build muscle memory for the correct phoneme difference. Make sure you are consciously feeling the placement change in your mouth. Shadowing technique. Listen to a scientific podcast expert and immediately repeat what they say. This is excellent for natural rhythm or prosody. You are training yourself not just on sounds, but on the speed and intonation used by native domain experts, which drastically improves fluency. Mirror work. Watch your mouth while reading complex passages aloud. Watching yourself provides instant visual feedback that hearing alone cannot. If you see your lips rounding or your jaw slackening, make a conscious mental note to correct that physical habit immediately. Discourse markers are linguistic tools that act like signposts in spoken English. They don't carry the core meaning of your argument, but they signal to your listener how that meaning is organized. Think of them as verbal traffic signals. They tell the examiner whether you are adding a point, changing direction, or providing evidence. Mastering these markers moves your speech from simply listing ideas to constructing a sophisticated, cohesive narrative. It's crucial to remember that these markers are about rhetoric as much as grammar. A simple conjunction like "and" just connects 2 ideas, but using a marker like "furthermore" elevates the connection, making it sound deliberate and academically rigorous. They demonstrate not only your vocabulary range, but also your ability to structure complex thought processes under pressure. Here are 4 examples. On the one hand, preventative screening is highly effective. Introducing a viewpoint. Using "on the one hand" immediately frames your argument as balanced. This signals to the examiner that you are prepared to consider multiple sides of the medical issue. It prevents your response from sounding like a single-sided opinion. However, logistical issues can prevent equitable access. Introducing contrast. The word, however, is one of the most powerful contrasting markers. It doesn't just negate what you said, it introduces a counter-argument that forces a deeper level of critical analysis in your response. Think of this as pivoting your entire perspective slightly. Consequently, policymakers must address infrastructure gaps. Showing result consequence. When you use a consequence marker like consequently, you're establishing a clear cause and effect relationship. This means your argument is logical and actionable. You aren't just describing problems, you are recommending solutions based on those problems. To conclude, the combination of both approaches is necessary. Summarizing or concluding. Never let your final statement just fade out. Start it with a strong summarizing phrase like ultimately's or to summarize. This gives the examiner a clear signal that you've finished presenting all points and are delivering your final overarching judgment. Here are 3 reasons why this matters. Structuring thought clearly. They provide explicit signposts for the listener. For an examiner who is listening to multiple candidates, clear markers are a navigational aid. They help the grader follow your complex train of thought without getting lost in dense medical terminology or elaborate clauses. It makes your argument feel organized and effortless. Boosting fluency and coherence. They prevent abrupt topic shifts. Smooth transitions are a hallmark of high-level fluency. By using these markers naturally, you demonstrate that you have internalized the structure of academic argument. It allows your speech to flow like a carefully edited essay read aloud, enhancing authority and tone. They project competence and careful consideration. When you speak with controlled, structured language, you sound more authoritative. It conveys that you aren't just reciting facts, you are actively analyzing them and guiding the listener through your specific interpretation of the data. Let's explore the topic of connecting ideas, using discourse markers to guide the examiner through a medical argument. This is an important concept to understand for learning English effectively. This is a foundational concept when learning English. Understanding, connecting ideas, using discourse markers to guide the examiner through a medical argument deeply will unlock many other areas of the language. Think about how often you encounter this in real life and try to notice it in the English you hear every day. The more you engage with this idea, the more natural it will feel. Here are 4 ways to practice. Prescript, your connectors. Memorize transition phrases, not whole paragraphs. Instead of memorizing specific sentences, practice internalizing the structures of your answer. Know that after point A, you will use a contrast marker. Before concluding, you will use a summary marker. This flexibility is what saves you in real-time speaking. The bridging technique. Using a physical or conceptual link between ideas. When practicing, physically point to an imaginary structure or pause with a gesture. This helps train your brain to make the transition feel natural and gestural rather than mechanical and recited. Record and review your flow. Listen specifically for monotone transitions. Record yourself arguing a topic and listen back immediately. Do you sound like you are listing connectors? If so, try to integrate them by embedding the marker into a natural explanatory clause, making it feel less like an inserted phrase. Use markers in Q&A simulation. Treat every question as a starting point for a structured response. Practice receiving vague or complex questions and framing your opening answer with, "That is a multifaceted issue." Firstly, we must consider this immediate structural mapping demonstrates control over the entire discourse. One way to elevate your academic writing is through nominalization and the strategic use of participle clauses. Nominalization involves turning verbs or adjectives into abstract nouns, for instance, changing investigates into investigation. This process allows you to summarize an entire action as a single point of focus. Participle clauses do something similar, allowing you to condense information that would otherwise require a full subordinate clause using words like because or, which. They often start with ing verbs, drastically improving the flow and density of your prose. Remember that these tools are about conciseness, not complexity for its own sake. While nominalization is crucial in academic speech to maintain formality, overuse can lead to ambiguity or overly dense writing. Think of it as tightening up sentences, making them sound authoritative while keeping the meaning crystal clear. Here are 5 examples. The implementation of new guidelines was necessary. Nominalization, action, noun. Instead of saying, because we implemented new guidelines, using the implementation immediately elevates the tone. It moves from a conversational cause and effect structure to a more formal, objective statement, finding clear evidence of climate change patterns. Participle phrase, gerund start. Here we start the sentence with finding, which acts as an introductory clause. This structure is highly efficient because it ties the action directly to the subject without needing a simple conjunction like and or because. Students studying advanced biology concepts often require supplementary reading. Participle clause, present participle. We replaced a full subordinate clause like because students are studying with the simple participle studying. This makes the sentence feel much more compact and rhythmically sophisticated for academic writing. The discussion about ethical mandates led to significant policy revisions. Nominalization, process, noun. Notice how discussion captures the entire process of talking through ideas. This is a powerful way to summarize lengthy verbal exchanges into a single, formal noun phrase. Monitoring global resource depletion requires immediate international cooperation. Nominalization, action, noun. This example shows monitoring as the subject. It gives weight and gravity to the activity itself. When you make an action a noun, it forces the reader to treat that action with academic importance. Let's compare 4 pairs. Using a full subordinate clause, example, because the data indicated. Using a participle clause, example, indicating that the data was solid. Conciseness and flow. The key difference here is rhythm. While both are grammatically correct, starting with a participle clause immediately makes your writing feel more advanced because it streamlines the connection between ideas. Simple noun usage, example, the conclusion of the study was. Nominalization, example, concluding that the data was solid. Action versus event. If you can start a sentence with an ing verb phrase to describe how something happened, try it. It moves your writing beyond merely stating facts and begins describing the process of those facts being discovered. Using which for relative clauses, example, the theory which suggests. Using a participle phrase, example, suggesting this, the theory proposes. Integration over separation. Sometimes using a full clause with which creates a slight pause. By turning it into an introductory participle, you weave the information directly into the sentence's main action, creating seamless academic prose. Stating simple facts. Example, the results showed that. Nominalizing the focus. Example, showing clear evidence of the results. It was found that. Active voice shift. This shift helps maintain a highly objective tone. Instead of letting the subject show something, you frame the showing itself as the academic action under discussion. Fill in the blank with the correct nominalization or participle clause opener. Every third's text promenade, A's to probable Z, was a never seconds finding carburation for altered non-kind. Pause the video now and fill in the blank before we reveal the answer. The correct answer is analyzing the recent. The prompt requires a phrase that acts as the subject, explaining what caused the changes. By using analyzing, you condense the entire action of examining data into one powerful academic opening. The necessity of international collaboration was highlighted by Thursical. Pause the video now and fill in the blank before we reveal the answer. The correct answer is the recent pandemic. Here, we need a strong noun phrase to act as the agent or cause. This structure makes our writing feel more robust and academic than merely saying, because of the pandemic. But I had ethical limitations. Researchers adjusted their methodology. Pause the video now and fill in the blank before we reveal the answer. The correct answer is confronted with. We are using a past participle, confronted, to show that this was the condition under which the action took place. This is far more sophisticated than writing, because they were confronted by. The committee voted unanimously on the new protocol. Pause the video now and fill in the blank before we reveal the answer. The correct answer is having reviewed all proposals. The perfect participle, having reviewed signals that this action happened before the main event. This sequence is critical for showing logical progression in complex academic arguments. Watch out for these 3 common mistakes. Incorrect. The investigation, having finished its analysis, showed alarming findings. Correct. Having finished its analysis, the investigation showed alarming findings. This is a classic dangling modifier error. The phrase having finished must immediately precede and modify the subject it describes, in this case, the investigation, not some abstract concept. Incorrect. Due to the excessive amount of data collected, we had difficulties in drawing conclusions. Correct. Given the large volume of data collected, we encountered difficulty drawing conclusions. The phrase due to is often overly casual or vague. Replacing it with stronger academic prepositions like given, considering, or in light of instantly boosts your writing formality. Incorrect. Researchers finding new genetic markers published their findings yesterday. Correct. Finding new genetic markers. Researchers published their findings yesterday. The error here was word order. We need to ensure the participle phrase modifies the correct noun researchers. Moving the modifier closer makes the sentence clear and highly precise. Now it is your turn to practice. Read or listen to the following passage carefully. Please read this short paragraph. It describes a complex scientific finding. Your task is to identify all instances where an action could be made more concise using either nominalization or a participle clause. Question 1. Find and correct the grammar error in this sentence. The theory, which suggests that human behavior changes with environment, was initially met with skepticism. Pause the video now and write your answer before we reveal it. The correct answer is, suggesting that human behavior changes with environment, the theory was initially met with skepticism. Notice how we condensed which suggests into a participial phrase. This not only makes the sentence shorter, but also integrates the description of the theory directly at the front, improving flow and academic rhythm. Question 2. Write your own sentence describing the necessity of global waste management using this grammar point. Pause the video now and write your answer before we reveal it. The correct answer is, facing mounting pressure from climate change, effective international policy planning is essential for sustainable growth. When crafting your own sentences, always ask yourself, can I start this idea with an ing verb phrase? If the answer is yes, you are likely making your writing more sophisticated and punchy. Remember to keep the subject clear. Subject-verb agreement is a foundational rule of English grammar that dictates whether a verb must match its subject in number. Simply put, if the subject is singular, the verb must also be singular. If the subject is plural, the verb must be plural. This basic concept applies even when the sentence structure becomes complex with long phrases or multiple modifying clauses. When writing academically, maintaining perfect agreement isn't just about passing a grammar test, it signals meticulous attention to detail and professional credibility. Examiners are looking for consistency across your entire piece, so keep this rule top of mind as you draft. Here are 4 examples. The increasing prevalence of climate change necessitates immediate policy adjustments. The subject is prevalence, singular, requiring the singular verb necessitates. Notice how the phrase of climate change is modifying the subject but does not affect its singularity. The core subject remains prevalence, which dictates that single verb form. Many researchers argue that early intervention programs improves long-term health outcomes. The plural subject researchers is the focus. It requires a plural verb form like argue. In this example, the structure of the clause helps clarify who or what is doing the arguing. Always look back to the main noun at the beginning of your thought. The committee, which met last week, determines that further funding is crucial. Since committee functions as a single unit here, it takes a singular verb, determines. This addresses the tricky concept of collective nouns. If you are treating the group as one unified entity, use the singular verb form to maintain strong agreement. Data collection and analysis, crucial for this study, suggests a clear correlation between the variables. The compound subject, collection and analysis, is treated as a single concept, data handling, making it singular. When multiple nouns are linked by and, but they function together to describe one single process or idea, treat them as a singular unit. This shows sophisticated structural understanding. Let's compare 4 pairs. The impacts of globalization are affecting local economies. The impact of globalization affects local economies. correcting the verb form to match the singular subject impact. Here, we corrected a common confusion between cating and fecting by changing the singular subject noun impact to its correct grammatical single form. The agreement immediately follows. Neither the government nor the citizens is satisfied with the current policy. Neither the government nor the citizens are satisfied with the current policy. When using neither nor, the verb must agree with the subject closest to it, the rule of proximity. This is a classic structural test. Since citizens is plural and closer to the blank, we switch to the plural verb are. Always check the noun immediately preceding the verb. Analyzing these variables show a distinct pattern of migration. Analyzing these variables shows a distinct pattern of migration. The entire gerund phrase, analyzing these variables, acts as one singular subject. Remember that an entire action or concept, when phrased as a noun, a gerund, counts as one single unit. Therefore, it requires the singular verb form shows. The study, along with several supporting documents, recommend further research. The study, along with several supporting documents, recommends further research. Phrases introduced by along with or as well as are parenthetical and do not affect the main subject-verb agreement. When you see phrases like along with, treat them like commas. They simply add extra information but do not change the number of the core subject. The verb must agree only with the noun that came first. Watch out for these three common mistakes. Weak. The development of new technologies are changing our lives. Strong. The development of new technologies is changing our lives. When you have a long subject starting with the development of, the core noun determining agreement is development. Since it's singular, we use is. Focus your attention on that initial main noun. Weak. Every student and every professor have submitted their assignment. Strong. Every student and every professor has submitted their assignment. The key here is the word every. When you use everys or each, it forces singular agreement, even if you are listing multiple people. Treat the entire list as individual units. Weak. One of the primary reasons for this policy change are economic concerns. Strong. One of the primary reasons for this policy change is an economic concern. This one of the structure is notoriously difficult. The subject is never reasons. It is always the singular word preceding the preposition, which in this case is one. Always look for that single number. Here are 4 ways to practice. The subject isolation technique. Mentally remove all intervening prepositional phrases and clauses to find the true subject. When you feel confused grammatically, literally cross out the supporting details. What structure remains is your core statement, and that remaining structure dictates the verb choice. The read aloud check. Read your draft aloud slowly, pausing before the verb. This forces you to hear whether the sentence feels correct. Our brains often auto-correct errors when writing, but reading it out loud makes the clunky grammatical connections audible. If the rhythm feels wrong, your grammar likely is as well. The 2-pass editing system. When editing, do not check for flow and argument in a single pass. Dedicate one entire pass solely to checking subject agreement. Revision should be systematic. By dedicating an entire grammatical police pass just to SVA, you significantly reduce the chance of missing these structural errors. Rephrasing for clarity. If a complex sentence causes agreement doubt, break it into 2 simpler, clearer sentences. Sometimes, the best solution isn't finding the single correct verb, it's making the writing easier to read. Splitting long, convoluted thoughts drastically improves both clarity and grammatical accuracy. Inversion involves reversing the standard subject-verb order to create dramatic emphasis. For instance, instead of saying, the patient was severely ill, you might write, not only was the patient severely ill, but this technique immediately signals a shift in focus. Cleft sentences use structures like it is X that yis or what is X is yis to isolate and highlight specific pieces of information. Mastering these tools elevates your writing from descriptive to highly persuasive. They are crucial for achieving high scores because they demonstrate not just grammatical knowledge, but advanced rhetorical mastery. remember that the goal here isn't merely complexity, it's impact. You must use inversion and clefting strategically only when you truly need to draw the reader's attention to a specific point of argument. Overuse makes your writing sound forced or overly academic, so always aim for balance. Here are 4 examples. Hardly had the surgical team stabilized the patient when the complications became evident. The use of hardly had creates dramatic pacing and emphasizes the immediate sequence of events. Notice how starting with a negative adverb like hardly's forces that inversion. This is much stronger than simply saying the surgical team barely stabilized the patient before. It gives your writing narrative momentum. What appears to be an allergic reaction is, in fact, a systemic inflammatory response. This cleft structure clearly separates and defines 2 opposing ideas, the perceived versus the real diagnosis. Cleft sentences are perfect for medical writing because medicine often involves distinguishing between appearances and underlying truths. This technique helps you guide the reader's understanding precisely. Never before has such a rapid decline in immune function been observed in this demographic. Starting with never before is a powerful way to establish unprecedented severity or rarity of findings. This specific inversion pattern highlights the novelty of your research finding. It immediately signals to the reader that what you are about to discuss is unusual, which suits scientific reporting perfectly. It was the timely intervention that drastically altered the patient's prognosis. This structure isolates the timely intervention, making it the undeniable subject of importance. Here, we are using the dummy subject, it, to emphasize the cause or action. When your argument hinges on a specific factor like rapid diagnosis or early treatment, this is the grammatical tool you should employ. Here are 2 reasons why this matters. Essential for communication. Understanding advanced structures, mastering inversions, and cleft sentences for emphasis in medicine helps you communicate more effectively. When you master advanced structures, mastering inversions, and cleft sentences for emphasis in medicine, you'll notice your conversations flow much more naturally, commonly used in daily life. You will encounter advanced structures, mastering inversions, and cleft sentences for emphasis in medicine frequently in everyday conversations. Pay attention to how native speakers use advanced structures, mastering inversions, and cleft sentences for emphasis in medicine. You will start hearing it everywhere once you are aware of it. Watch out for these 3 common mistakes. Weak, seldom, the complication was so severe. Strong, seldom was the complication so severe. The main error here is forgetting to invert the auxiliary verb and placing it before the subject. When you start with a negative adverb like seldom, the structure must follow standard inversion rules. Weak, it was due to dehydration that drop in blood pressure. Strong, it was due to dehydration that the drop in blood pressure occurred. A cleft sentence needs a full grammatically sound clause following that. You cannot leave it hanging. Always make sure you complete the thought to maintain coherence. Weak, only after testing did we know the root cause. Strong, only after extensive testing did we determine the root cause. When using only after, remember that it triggers inversion just like never or not until. Crucially, you must also ensure your main verb is correctly inverted with the auxiliary. Here are 4 ways to practice. Identify key focus points. Before writing, underline the 3 most crucial pieces of evidence or concepts in your paragraph. These are your targets. When you know exactly what needs, emphasize be it a cause, an agent, or a result you can pre-select the perfect advanced structure to frame that idea. The if-then conversion drill. Take simple sentences and practice converting them into inverted clauses. For example, if the drug was administered slowly, it would prevent side effects. Convert this using inversion. This drill helps you feel comfortable with conditional inversions, which are related to these advanced structures. It builds confidence in managing complex clause openings. The what is practice. For every paragraph that discusses a diagnosis or cause, draft at least 1 sentence using the what is X cleft structure. Making this a routine habit ensures that you are constantly practicing isolating and emphasizing variables. This turns a difficult grammatical rule into a natural writing tick. Reviewing academic sources. Read high-scoring academic journal articles or specialized medical reports to observe how experts structure their most impactful findings. The best way to internalize advanced grammar is immersion. Mimic the structures you encounter in top-tier literature. This helps you adapt them naturally and professionally. Nominalization is a key mechanism for elevating language from casual conversation to formal academic discourse. Simply put, it is the grammatical process of converting verbs and adjectives into nouns. This shift allows us to discuss actions or qualities as abstract concepts rather than direct events. For example, instead of saying, "We analyzed the data," you might write, "The analysis of the data was complex." Understanding this tool helps writers achieve a scholarly, objective tone suitable for reports and university-level writing. Mastering nominalization is essential for demonstrating advanced control over English grammar. When speaking at higher bands, examiners are looking for structural sophistication, not just big vocabulary words. Nominalization provides that sophisticated structure because it allows you to discuss entire processes or results as single conceptual units. It moves your language away from simple narrative and towards scholarly theorizing. Here are 5 examples. Analyze right-error analysis. Process of study. Using analysis allows you to focus the reader on the results of the action, the findings, rather than focusing on the people who performed the analysis. This depersonalizes the text, which is a common goal in formal writing. Implement. Right-error dollars. Implementation. Putting into action. Similarly, swapping implements for implementation shifts focus from the effort of doing something to the strategy or process itself. This is especially useful when discussing policies or institutional changes. Evaluate right-error. Evaluation. Assessing value. When you are writing an academic paper, the evaluation itself is often more important than detailing every step of how it was done. Using evaluation keeps your language concise while maintaining a formal tone. Determine right-error. Determination. Establishing fact. This is very common in scientific reporting. Instead of saying, "The results determine the cause," you write that the determination of the cause was conclusive. Notice how the noun structure makes the discovery sound like a fixed, established truth. Predict right-error. Prediction. Forecasting outcomes. In fields like economics or medicine, we frequently discuss predictions. By using the noun form, you are discussing the concept of forecasting rather than describing the act of predicting. This elevates your vocabulary significantly. The most powerful aspect of nominalization is its ability to create distance between the writer and the subject matter. By converting verbs into nouns, you move away from direct, active voice statements that assign blame or credit to a specific agent. This technique creates an objective, scholarly distance, which makes your writing sound highly authoritative. For instance, saying, "The government cut funding" is direct, but stating, "A reduction in governmental funding occurred" maintains the information while emphasizing the concept of the reduction itself. This depersonalization is key to achieving that high-register academic style. Think of nominalization as a grammatical shield. It allows you to present facts and concepts without getting bogged down in who did what, when they did it, or why. When aiming for an objective tone like in medical reports or policy papers, this depersonalized noun structure is your most reliable tool. Let's compare 4 pairs. Nominalization, the diagnosis. Verbal clause, when diagnosing the patient. Focus of discussion. Using diagnosis's focus is on the result, the finding itself. Using the verbal clause keeps the focus on the process or action being carried out at that moment. Knowing when to emphasize the process versus the outcome is a subtle but important skill for writing clarity. First, nominalization. Passive voice construction. Mechanism versus structure. While many nominalizations can be used within a passive voice structure, they are not the same thing. The passive voice focuses on who is acted upon, whereas nominalization focuses purely on abstracting the concept or action itself. General academic writing. Highly formal. degree of abstraction. In general academic writing, you can use a balance of verbs and nouns. However, in highly formal reports like governmental or scientific papers, you should lean heavily toward nominalization to maximize the objective and detached tone. Gerund, ing noun. True nominalization. Grammatical function. A gerund, like swimming is healthy, functions as a subject. A true nominalization, like the practice of swimming promotes health, transforms the action into a formal concept that often requires more prepositional phrasing. Here are 4 ways to practice. Source, text highlighting. Analyze academic texts for nominalized phrases. When reading complex articles, don't just read, thematically underline every verb that has been converted into a noun. This builds pattern recognition and helps you absorb the register naturally. Transformation drills. Practice converting active sentences to abstract nouns. Set aside time specifically for controlled transformation exercises. Take 20 simple sentences from your notes and force yourself to rewrite them, replacing the core action verb with its corresponding formal noun. Oral concept mapping. Speaking drills focusing on abstract linking phrases. When speaking about complex topics, practice starting your points not with "I think," but with a nominalized phrase like "the primary consideration is," or. A key area of concern involves booze. This immediately signals high-level discourse. Reviewing policy documents. Imitate the style of formal reports. To internalize this skill, read official policy statements or scientific abstracts. These documents are models of nominalized English, and absorbing their rhythm will greatly improve your own output. When expanding your vocabulary for IELTS, simply knowing a synonym isn't enough. We need to understand the nuance, the subtle difference in meaning or context between words. Synonyms are helpful, but near synonyms allow you to achieve greater precision and academic flair. Think of this tool as moving beyond basic word lists toward mastering shades of meaning. Instead of just saying bad, we might use detrimental or adverse depending on the topic's formality. This focus on subtle differences is what elevates your writing from functional to truly sophisticated. Remember that academic writing demands precision. When you can choose between 2 similar-sounding words, like impact versus effect, and know which one fits the context best, you demonstrate a high level of linguistic control. This deep understanding is what separates Band 6 writing from Band 8 writing. Let's go through 6 words. For each word, I will say it clearly, then explain how to produce it correctly. The word is mitigate. Say it again, mitigate. This is a fantastic verb for environmental and policy discussions. It suggests actively reducing severity, not eliminating it entirely. A common collocation here is mitigate risks or mitigate damage. Always remember that you are making something less severe. The word is predicament. Say it again, predicament. This word is excellent for discussing social issues or economic downturns. It implies being trapped in a bender complex problem with no easy solution. If you are talking about ethical dilemmas, this word works perfectly. The word is imperative. Say it again, imperative. Whenever you need to express strong necessity, imperative is much stronger than just saying important. It suggests a critical mandate or an urgent requirement for action. Using this shows confidence in your argument. The word is sustainable. Say it again, sustainable. This is the bedrock word for environmental and economic topics, so knowing it well is crucial. When describing anything, be it power, food, or policy, if you can modify it with sustainable, you sound highly academic. Make sure to pair it with nouns like growth or energy. The word is deteriorate. Say it again, deteriorate. This verb is perfect for describing things that decline over time, whether it's physical health or environmental conditions. It suggests a gradual process of decay rather than an abrupt collapse. We often see it paired with nouns like infrastructure or ecosystems. The word is viable. Say it again, viable. If you are proposing a solution in your essay, using viables confirms that your idea is not just good, but practically achievable. It means the concept can actually survive and work in the real world. This adds immense weight to your arguments. Here are 5 examples. To combat the growing pollution, we must find ways to mitigate the damage to local waterways. Mitigate, vivus off. Notice how mitigate is used here. We aren't aiming for zero damage, we are striving to lessen it. This subtle difference in meaning makes your argument sound more nuanced and realistic. Many developing nations find themselves in a financial predicament due to global trade policies. Predicament in. Using predicaments elevates the discussion beyond simply saying they have money problems. It suggests systemic difficulty that is hard to escape, which is perfect for social science topics. It is imperative that governments invest heavily in sustainable agricultural practices worldwide. Comparative adjective. By linking imperative to governments, you are making a strong, authoritative claim. This structure gives your writing the weight of policy advice, which is ideal for an academic tone. Without immediate action, our freshwater resources will continue to deteriorate at an alarming rate. Deteriorate wie verstehe. This sentence shows the gradual nature of environmental decline. Deteriorate implies a slow but steady decline that requires constant monitoring and urgent attention. Exploring solar power provides a viable, sustainable alternative to fossil fuels. Viable adjective and sustainable adjective. This single sentence demonstrates 2 key words working together. Sustainable describes the method itself, while viable confirms that the method can actually function successfully in reality. Let's compare 4 pairs. Affect, V. Impact, N. Grammatical function and scope. Remember that affects is usually the verb, meaning to influence. Meanwhile, impacts can function as both a noun and a verb, often suggesting a sudden or measurable force of change. Using them correctly adds immediate sophistication. First, adverse. Compare it with detrimental. Negative consequence, formal. Both words mean harmful, but adverse is often used to describe conditions or circumstances, like adverse weather. Detrimental, however, focuses more on the damage caused by an action or object. First, necessity. Compare it with imperative. Degree of requirement, noun versus adjective. If you're writing about the concept, use necessity, but if you want to describe something that must happen like a policy or an action, use the adjective imperative for maximum impact. First, mitigate. Compare it with alleviate. Reducing severity, physical versus abstract. While both mean to lessen, mitigate often applies to risks or overall large-scale threats like climate change risk. Alleviate, on the other hand, is slightly softer and is frequently used for physical discomforts such as pain or stress. Here are 4 ways to practice. Collocation mapping. Learning words in natural groups. Don't just memorize the word viable. Instead, map it with strong collocates like viable solution or viable option. By linking it to common nouns and adjectives, you improve fluency because the whole phrase feels natural. Contextual sentence mining. Gathering words from high-level readings. When reading academic articles, don't just highlight difficult vocabulary. Instead, write down the entire sentence and identify which word is doing the heavy lifting of meaning. This helps you understand why a word was chosen. Thematic word maps. Grouping synonyms by topic area. Instead of one list of 20 words, create thematic maps. Environments might include deteriorate, mitigate, and sustainable. This trains your brain to recall related vocabulary when a specific topic is presented. Active recall drills. Testing usage rather than definition. The best practice is not defining the word, but completing sentences with it. For example, instead of asking, "What does mitigate mean?" ask, "To pay PA, a risk means to..." This forces you into active production mode. Now it is your turn to practice. Read or listen to the following passage carefully. Global pollution continues to deteriorate at an alarming rate. Governments must recognize that climate change is not a distant threat, it is an immediate imperative. To mitigate the worst effects, we need to find sustainable and viable energy solutions today. Failing to act will leave future generations in a massive environmental predicament. Question 1. Find a word in the passage that means to lessen the severity of. Pause the video now and write your answer before we reveal it. The correct answer is mitigate. The text uses mitigates because it is about reducing risk, not completely removing the problem. This shows that even when discussing massive issues like pollution, we are aiming for reduction and management. Question 2. Use one of the target words in your own sentence about technology. Pause the video now and write your answer before we reveal it. The correct answer is, developing renewable energy sources is imperative for a sustainable future. Notice how imperative here adds urgency to the necessity of renewables. And it pairs perfectly with sustainable. This combination shows advanced command over both academic register and topical vocabulary. When discussing major societal problems in Task 2, simple vocabulary is never enough. You need precise collocations that signal true academic mastery. These are not just random words, they are word pairings that sound natural to a native speaker and carry intellectual weight. Using them demonstrates your ability to articulate complex ideas with efficiency. Focus on using strong verb plus noun structures such as mitigate the effects or curb inflation. This elevates your writing from merely descriptive to highly analytical. Remember, precision in language is just as important as having a good argument. Think of collocations as linguistic credentials. When you use phrases like exacerbate poverty, you are telling the examiner that you don't just know the vocabulary, you understand how those concepts interact academically. The goal here is to sound authoritative and highly informed. Here are 4 examples. The government must implement policies to curb socioeconomic disparities and reduce income inequality. Effective use of curbs and disparities. Notice how curb acts as a strong academic verb here. It suggests actively restraining or limiting something powerful, making it much stronger than simply saying reduce. This level of lexical choice is highly rewarded. Insufficient investment in public health infrastructure can exacerbate existing community vulnerabilities. Strong pairing, exacerbates plus vulnerabilities. The word exacerbate is key here. It means to make a bad situation worse, which is perfect for discussing problems. Pairing it specifically with vulnerabilities creates a very natural and high-level academic phrase. Addressing the root causes of climate change requires global collaboration, not just national mandates. Using root causes and global collaboration. Instead of saying solving the problem, using addressing the root causes shows depth of understanding. Furthermore, specifying that this needs global collaboration immediately scopes the discussion to a macro-level policy debate. Many developing nations struggle with infrastructural deficits and sustainable resource management. Focus on noun pairings, infrastructural deficits. This example focuses on compounding nouns to create dense academic language. Infrastructural deficits is a specific technical term that immediately establishes your topic's context within economics or geography. Let's compare 4 pairs. Poverty is a big problem in many countries. Widespread poverty remains a critical global challenge that demands urgent attention. Adding academic framing and precise nouns. The strong version doesn't just state a fact, it qualifies it using phrases like critical global challenge. This elevates the tone instantly. Always aim for more formal, sophisticated terminology. We need to make people care about climate change. Raising public awareness regarding environmental degradation is paramount to mitigating future risks. Using paramount and mitigating. Notice the shift from a personal plea, make people care, to an objective statement of necessity. Using words like paramounts makes your argument sound reasoned rather than emotional. Poor education causes bad jobs. Educational disparities directly hinder workforce potential and perpetuate cycles of poverty. using high-impact verbs and complex causality chains. The strong version introduces the concept of perpetuating cycles, which is a sophisticated theoretical idea. It shows you understand not just the problem, but the system that sustains it. Government should help money distribution. Policymakers must implement targeted fiscal interventions to address socioeconomic inequalities, replacing vague verbs with specialized policy jargon. Instead of saying help distribute money, the strong version uses targeted fiscal interventions. This specific terminology immediately situates your argument within political, science, and economics. Watch out for these 3 common mistakes. Weak. The government needs to make the poor feel better. Strong. Governments must implement measures to alleviate suffering among marginalized communities. This correction moves away from overly sentimental language toward objective policy analysis. Alleviate suffering is precise, while the original phrase is informal and emotionally vague. Weak. It is hard to fix environmental issues. Strong. Addressing environmental degradation presents formidable challenges that require concerted international efforts. The mistake was using hard and fix, which are basic words. The correction substitutes them with much richer vocabulary like formidable and concerted, significantly boosting the academic register. Weak. We should talk about social issues more. Strong. There is a pressing need for public discourse regarding persistent societal ailments. The core error here was using vague nouns like issues by replacing them with societal ailments, and using the phrase pressing need, you make your call for action sound urgent, intellectual, and highly formalized. Here are 4 ways to practice. The collocation banks technique. Create a dedicated list of high-level collocations for the top 5 societal topics, e.g., poverty, climate change. Don't just memorize lists, embed these phrases into sample sentences related to common Task 2 prompts. This ensures that when you sit down to write, the language flows naturally from your subject knowledge. The synonym swap drill. Take 3 simple paragraphs and rewrite them 5 times, replacing basic verbs and nouns with academic synonyms and collocations. This exercise forces you to move beyond simple substitution. You are analyzing the function of the word. Is it describing a state, or is it describing an action? This precision is where Band 7 scores come from. Hypothetical argument mapping. Map out potential arguments, problem, cause-effect, solution, using only advanced collocations. Before writing, structure your argument map with high-impact phrases. For example, root cause of X leads to perpetuating Y effect, which requires targeted intervention. This preloads sophistication into your essay. The thesis statement focus. Practice writing 5 different, highly sophisticated thesis statements for varied societal topics. Your introduction's thesis statement is the first chance to impress the examiner. By consistently using strong collocations here, you set a high linguistic standard that carries through the entire essay. When examiners evaluate your narrative speaking ability, they are looking beyond just correct grammar. They want to hear sophisticated control over time. Specifically, mastering the perfect tenses allows you to connect past events directly to the present moment of conversation. We must move fluently between simple past narration and the more complex structures like the present perfect continuous. This shows that your storytelling isn't just a list of isolated facts, it's a cohesive narrative with impact on today. The key strategy is mastering temporal framing. When should an action be background context versus a defining turning point? Excellent speakers use these tenses to manage the listener's focus and emphasize causation. Remember that using the present perfect continuously suggests actions that started in the past, continued up until a specific point, and perhaps still have relevance now. This is much more dynamic than simply stating, "I did X." It makes your story feel lived in and continuous. Let's go through 5 words. For each word, I will say it clearly, then explain how to produce it correctly. The word is. Over the years, I have realized that. Say it again. Over the years, I have realized that. This phrase is excellent for introducing reflective conclusions. It signals to your listener that you are drawing wisdom from a long period of experience, making your answer sound thoughtful and mature. The word is, by the time I arrived, they had already. Say it again. By the time I arrived, they had already. Using had alreadys is essential for storytelling because it establishes a sequence of past events. It helps your listener understand which actions happened before the main action you are describing. The word is, I have been studying this field since. Say it again. I have been studying this field since. Whenever you need to talk about how long something has taken or how long an effort has been continuous, use have been plussing. This structure is much more engaging than just saying, I studied this field for. The word is, it appears that we have underestimated. Say it again. It appears that we have underestimated. Beak. This phrase adds academic gravitas when you're analyzing an event or situation. It doesn't present the information as absolute fact, but rather as a well-considered conclusion based on evidence. The word is, if I hadn't spent so much time. Say it again. If I hadn't spent so much time. This is your tool for sophisticated speculation or counterfactual narrative. It allows you to explore what-if scenarios, which demonstrates a high level of grammatical control and complex thought. Let's compare 4 pairs. I went to the museum last month and saw cool stuff. Last month, I visited the museum where I observed fascinating exhibits. Using formal vocabulary, Lexis. Notice how changing saw cool stuffs to observed fascinating exhibits immediately elevates your register. Always aim for precise nouns and stronger verbs when speaking formally. It was raining, so I missed out on everything. Since heavy rainfall had interfered, I regrettably missed the main event. Incorporating complex grammar, past perfect. The key here is integrating that past perfect tense. Instead of just stating 2 events happened, it was raining, so you are building a causal relationship using high-level grammar. I've been working on this problem for days. I have dedicated my last several days to tackling this specific challenge. Structuring the commitment, emphasis. We are replacing a simple phrasal verb like working on with more academic verbs such as dedicated or tackling. This adds weight and professionalism to your narrative. The results showed that we didn't think enough. The subsequent findings suggested that thorough preparation had been lacking. Passive voice for objectivity, academic tone. In formal academic speech, it is often better to use the passive voice. It shifts focus from who did the action to what was found, making your response sound more objective and analytical. Watch out for these 3 common mistakes. Simple listing choppy. I went to the park and then I saw a dog. Temporal linking. Cohesive. By the time I arrived at the park, a dog had already caught my attention. The mistake here is treating events as disconnected list items. By using by the time, you immediately establish a clear timeline and hierarchy of importance between 2 actions. Grammar slip, incorrect verb form, I have known him since high school. Correct grammar, stative verbs, I have known him since high school. Remember that knows is a stative verb, meaning it describes a state rather than an action. Stative verbs cannot take the continuous form like have been knowing. Always check if your verb can be used in the ing form. Topic, drift het week conclusion. The weather was bad and I think that's why we failed. Strong causal statement. Thesis. Given the severe weather conditions, it is evident that our efforts were significantly compromised. Avoid vague conclusions using I think or weak conjunctions like and. Instead, use strong linking phrases such as it is evident that or. Consequently, to give your analysis weight, here are 4 ways to practice. Self-recording and analysis. Record yourself telling a short story. Then listen back strictly to your use of perfect tenses, noting every time you switch between simple past and present perfect. The most effective way to improve is to listen critically to your own voice. Don't just check for grammar. Pay attention to natural pauses and where you hesitate when shifting tenses. Shadowing expert speakers. Find podcasts or TED Talks with complex narratives. Listen, pause, and repeat segments immediately. Focus specifically on how they structure their time references. Shadowing trains your mouth muscles to produce complex grammatical structures smoothly and automatically. It helps internalize the rhythm of advanced English discourse. The timeline drill. Take an event, e.g. moving house, and narrate it by physically drawing a timeline. Force yourself to use past perfect for background, simple past to the main events, and present perfect to connect the outcome. Visualizing the timeline is crucial because grammar and speaking is highly linear. This exercise forces you to consciously manage the sequence of time frames. Impromptu reflection prompts. Ask a friend random questions about your past, e.g., what was the toughest thing you learned? Force yourself to answer using at least 2 different perfect tenses. This simulates real-world pressure and forces spontaneous application of difficult grammar points. Don't worry about perfection. Focus only on successfully deploying those required tense structures. Now it is your turn to practice. Read or listen to the following passage carefully. Describe a significant challenge or difficulty you have recently overcome in your life or studies. You should speak for about 1 minute. Focus on the journey from initial struggle to final success. Question 1. What is the most important thing to include in your answer? Pause the video now and write your answer before we reveal it. The correct answer is structure the narrative chronologically, clearly dividing the background, past perfect, the main action, simple past, and the lasting impact lesson learned, present perfect. When structuring this story, remember that the initial struggle is best framed using the past perfect to show what was already in place before your efforts began. This gives depth to your narrative. Question 2. What language feature should you demonstrate? Pause the video now and write your answer before we reveal it. The correct answer is fluency in shifting between simple past, present perfect continuous, and past perfect while maintaining a formal, reflective tone. Your goal is seamless transition. The examiner isn't just listening for the tenses, they are evaluating how effortlessly you can switch between them without pausing or sounding forced. When speaking in an academic setting, examiners aren't just looking for correct grammar, they are listening for the conviction and sophistication behind your arguments. Developing opinionated language means moving past simple phrases like I think or I feel. Instead, you need to establish a clear rhetorical stance immediately. This involves using advanced discourse markers that commit you strongly to a viewpoint while still allowing you to acknowledge nuance. Mastering these markers elevates your speech from mere conversation into persuasive argumentation. Remember that strong language doesn't mean being aggressive, it means being definitive about your perspective. Use modal verbs like must, should, or would undoubtedly to signal the certainty of your claims. If you can frame an argument with high confidence markers, you immediately boost your perceived fluency and coherence. Let's go through 5 words. For each word, I will say it clearly, then explain how to produce it correctly. The word is, it is fundamentally undeniable that. Say it again. It is fundamentally undeniable that. This phrase immediately sets a very strong, conclusive tone. Use it when you are introducing your main argument or thesis statement. Be careful not to overuse this. Save it for the most critical point you want the listener to remember. The word is, the prevailing notion suggests that. Say it again. The prevailing notion suggests that. This is excellent for setting up a counter-argument. By first mentioning what prevails, or what most people believe, you demonstrate critical thinking and then show how your personal viewpoint deviates from the norm. The word is, one cannot disregard the fact that. Say it again. One cannot disregard the fact that. This construction is perfect when you have data, statistics, or a historical example to back up your point. It signals to the examiner that your claim isn't just personal opinion, it's fact-based observation. The word is, I submit that. Say it again. I submit that. By you. This is a very formal, academic way to jump into your unique point. It sounds like you are presenting research or a policy recommendation. Use this when your argument requires a sophisticated, professional register. The word is, to argue the contrary, one might suggest. Say it again. To argue the contrary, one might suggest. This structure shows academic maturity. Instead of just saying no, you are wrong, this phrase allows you to introduce an opposing view neutrally before systematically dismantling it with your own supporting evidence. Let's compare 4 pairs. It's super important that it is of paramount importance that boosting formality and impact. Notice how replacing supers with paramount instantly raises the register. Academic language favors precise, Latinate vocabulary over common intensifiers like really or very. I mean, To clarify my position, I would submit that replacing vague fillers with assertive framing. Informal speech often relies on filler phrases like or, informal speaking. Replace these conversational habits with structured signposts to guide the listener and sound more deliberate. But seriously, might as well gamer. However, upon closer examination, creating a smooth transition for contrast. Beginning an argument with but is fine in conversation, but it is too casual for the exam. Using transitional phrases like however or upon closer examination provides a much smoother and more intellectual pivot point. I guess that's true. While this may be factually correct, I maintain that moving from reluctant agreement to strong counterclaim. The key here is moving from hedging, which sounds weak, to a structured concession followed by an assertion. This shows you are thinking deeply and engaging with the complexity of the topic. Watch out for these 3 common mistakes. Weak phrasing hesitation. I think that the reason is trailing off. Assertive framing, the underlying cause of this issue is ending a thought with the reason makes your argument sound tentative. By replacing it with strong noun phrases like the underlying cause of this issue, you sound authoritative and confident. Incorrect conditional tense, if I was given the chance. Grammatical slip. Formal academic grammar, if I were granted the opportunity. When discussing hypothetical scenarios, always remember to use the subjunctive mood. Using if I were instead of if I was is a clear marker that you have strong grammatical control. Vague. Informal conclusion. So basically, it means we should do X and Y. Structured conclusion, therefore, based on this evidence, the logical conclusion is to implement measures X and Y. Avoid using simple summarizing phrases like basicallys or so. Instead, use highly academic concluding structures that signal careful consideration of all points made. This brings a sense of finality to your argument. Here are 4 ways to practice. Targeted record practice. Choose 3 strong phrases from the drill and record yourself using them in a mock debate. Focus on varying intonation. Don't just read the phrases, incorporate them naturally into an argumentative flow, as if you were speaking passionately about something. Listen back specifically for where your delivery falters or sounds unsure. IELTS Part 3, Debate Practice. Practice responding to abstract social issues, e.g., universal basic income requiring deep opinionation. Part 3 tasks are designed for this exact skill. Always remember that the question is rarely about what's, but rather why, so structure your answers around causes, effects, and necessary interventions. Structured shadowing. Find academic podcasts or TED Talks and shadow expert speakers, paying attention to their transition markers. Shadowing allows you to absorb natural rhythm and advanced phrasing without having to generate the ideas yourself. Pay close attention to how they link one thought to the next. That's where true fluency lies. The 3-point theses drill. For any given topic, prepare 3 distinct points, A, B, C, and build an argument that connects them using strong markers. This is a powerful organizational tool. Instead of rambling, structure your entire response with a clear opening statement, followed by point A, then point B, and concluding how all 3 connect under one main idea. Now it is your turn to practice. Read or listen to the following passage carefully. Topic: the future of work. Some argue that automation and AI will lead to mass unemployment, while others claim it will create entirely new industries we cannot imagine today. Bullet points: impact on current job sectors, e.g., logistics. Today, the necessity of retraining the workforce. Your definitive prediction for the next decade. Target length: 1 minute 30 seconds. Question 1. What is the most important thing to include in your answer? Pause the video now and write your answer before we reveal it. The correct answer is a clear, nuanced thesis statement that takes a defined stance while acknowledging counterarguments. Do not simply list pros and cons. You must synthesize them into a single, complex argument. Your opening sentence should encapsulate your core position, for example, arguing for managed transition rather than choosing one side entirely. Question 2. What language feature should you demonstrate? Pause the video now and write your answer before we reveal it. The correct answer is advanced concession and counter-argument phrasing, e.g., while it is true that, however, the goal here is to sound like a sophisticated academic panelist, not just a student giving an opinion. By using advanced phrases that concede points before rebutting them, you demonstrate intellectual depth and mastery of complex argumentation. When we listen to academic discussions or lectures, it can be challenging because the speaker often moves quickly between main ideas and supporting evidence. The key skill here is not just catching words, but understanding the function of what you hear. You must train yourself to distinguish a general statement, the topic sentence, from the specific examples that prove it. We are listening for the structural framework of an argument as it unfolds in real time. Think of active listening as being a detective, not just a recording device. Instead of trying to memorize every word, you need to constantly ask yourself, what is the speaker's main point right now? If the details shift dramatically, that usually signals a new supporting pillar for their argument. You are about to hear a listening passage. Get ready to listen and take notes. A strong academic essay relies heavily on clear organization. Remember, every body paragraph should begin with a definitive topic sentence that clearly states the specific claim for that section. This sentence acts as a roadmap for the reader. Following that opening statement, you must provide solid supporting details, data, statistics, or expert examples. For instance, if your topic is climate policy, your topic sentence might declare that carbon taxes are the most effective immediate solution. The subsequent points then need to unpack this by citing recent economic models or successful international case studies. Never let the evidence drift away from that core opening claim. It must always circle back to prove the initial statement was accurate and vital to your overall thesis. This tight connection is what elevates writing from descriptive prose to persuasive academic work. Question 1. What function does a topic sentence serve in an essay? Pause the video now and try to answer before we reveal it. The correct answer is, it acts as a roadmap for the reader, stating the specific claim of that paragraph. This question requires you to identify the purpose or the controlling idea. It tests whether you can move beyond simply hearing facts and comprehending the underlying structural role those facts play. Question 2. According to the passage, what should supporting details do? Pause the video now and try to answer before we reveal it. The correct answer is, they must always circle back to prove the initial topic sentence claim. We are testing your ability to synthesize information. You don't just listen for details, but you must grasp the relationship between those details and the main idea. Question 3. What is the difference between descriptive prose and persuasive academic work? Pause the video now and try to answer before we reveal it. The correct answer is, persuasive work has a tight connection where evidence consistently proves an initial statement. This tests your overall comprehension of the passage's core argument. You need to grasp the main takeaway, the so what moment, which is often summarized in comparison. Here are 5 examples. Definitive topic sentence. A clear statement that introduces the paragraph's main argument. When you hear definitive, think of it as non-negotiable and absolute. In writing, this phrase signals that the claim being made is central and cannot be ignored by the reader. Solid supporting details. Evidence like data or expert examples. This moves beyond just saying examples. Solid implies reliability and academic rigor. The speaker suggests these must be substantial enough to carry the weight of your claim. acts as a roadmap for the reader, guides the audience through the argument. This is a fantastic metaphor. Whenever you hear something that describes guidance or direction, visualize it like a travel map. It tells you exactly where you are going and why. Subsequent points. The ideas following the initial statement. This phrase helps transition your listening focus. If you hear subsequent, remember that the speaker is about to list or elaborate on things that come next in sequence. Overall thesis. The central argument of the entire essay. While a topic sentence controls one paragraph, your overall thesis statement controls everything. Always remember that every single piece of evidence must ultimately relate back to proving this primary thesis. Listen again and fill in the missing words. Effective structure requires you to SDUA your initial claim with strong evidence. Pause the video now and fill in the blank before we reveal the answer. The correct answer is connect. The verb connect here is crucial because argumentation isn't just listing facts, it's actively linking them. You are building an intellectual chain of cause and effect. Always ensure that the supporting details directly S the topic sentence. Pause the video now and fill in the blank before we reveal the answer. The correct answer is validate. To validate means to prove or confirm something is true. This word choice emphasizes checking the truthfulness of your claim, which is the core job of good evidence. If your argument weakens, you should consider adjusting your primary error. Pause the video now and fill in the blank before we reveal the answer. The correct answer is thesis. The thesis statement is the foundation. If that moves, everything else must be reevaluated. Remember that it remains the controlling idea for the entire piece. Before writing, you must carefully outline and 1 mile long all potential supporting points. Pause the video now and fill in the blank before we reveal the answer. The correct answer is organize. We use organize here because simply having ideas isn't enough. They must be placed in a logical sequence. Think of organizing as structuring the flow before adding content. Here are 4 ways to practice. Pre-listening prediction. Before listening, read the topic and predict what structural elements you expect to hear. This technique primes your brain. By anticipating structure like expecting a claim, followed by 3 examples, you are giving yourself mental signposts for when the actual speech starts. Focused note-taking. Don't write down everything. Use symbols to track signal words, e.g. for conclusion, for example. Because you are aiming to hear structure, treating transitional phrases like signposts is key. When the speaker uses, for instance, or consequently, pause and mark it in your notes. Shadowing dialogue. Listen to academic speeches and immediately repeat what you hear, focusing on the rhythm and flow. This builds muscle memory for natural academic cadence. It helps train your ear not just for words, but for the spacing used when making a strong structural point. Summarizing immediately. After listening to a section, pause and summarize the main idea aloud in your own words. This forces active retrieval. Instead of passively accepting information, you are actively processing it and translating complex speech into simple, measurable concepts. Now it is your turn to practice. Read or listen to the following passage carefully. When writing a persuasive piece, simply stating your opinion is not enough. You must anticipate and address counterarguments, the opposing viewpoint. A strong writer doesn't ignore the opposition, they acknowledge it first. For example, you might introduce the argument that, while some people argue for increased regulation, you immediately pivot to rebutting them. The key phrase here is concession followed by refutation. Concession means saying, I understand why someone might think X, but the next step must be your rebuttal, stating why X is wrong or incomplete. This shows depth of thought and makes your own position much more compelling. Question 1. What process must a writer do before simply stating their opinion? Pause the video now and write your answer before we reveal it. The correct answer is, they must anticipate and address counterarguments by acknowledging the opposing viewpoint first. This question tests whether you grasp the necessity of the action. The passage emphasizes that ignoring opposition weakens your argument, so understanding this proactive step is vital. Question 2. What are the 2 distinct steps required to effectively address a counterargument? Pause the video now and write your answer before we reveal it. The correct answer is, the first is concession, acknowledging the opposing view, followed by refutation, stating why it is wrong or incomplete. This targets specific academic vocabulary and process. You must distinguish between concession, the agreement to a point, and refutation, which is your powerful counterclaim. Task achievement in Task 1 requires you not just to report data, but to interpret it. You must move beyond listing figures and instead focus on describing the underlying trends. Is the change steady? Was the growth exponential? Or did it plateau completely? The key is structuring your response logically. Start with a clear overview that summarizes the main findings before diving into granular details. Secondly, employ sophisticated language to describe movement. Instead of saying, "it went up," use phrases like, "witnessed a marked increase" or "soared dramatically." When describing trends, remember that your verbs and adverbs are doing most of the heavy lifting. Using varied vocabulary for change like plummeted versus declined elevates your writing instantly. Always ensure your overview captures the broadest picture before you tackle specific numbers. Here are 4 examples. The graph clearly illustrates a consistent upward trajectory for renewable sources. Beginning at just 5% in 1990, this sector saw remarkable growth, surpassing oil dependence by nearly 20% by the end of the period. Effective use of trajectory and comparative phrasing, surpassing. Notice how we use trajectory instead of just saying went up. This single word signals academic fluency. The note also shows we connected 2 ideas, growth plus comparison, in one focused sentence. Conversely, the consumption of coal remained relatively static throughout the 30-year span, maintaining a stable figure that peaked around 1995 before experiencing only minor fluctuations. Using conversely and vocabulary for stability, static, fluctuations. Starting with transition words like conversely's is vital because it signals to the reader exactly how your new information relates to the previous point. It creates a smooth, logical flow. By contrast, water usage experienced an erratic pattern. There was a sharp decline in the late 90s, followed by a moderate rebound that never quite reached its initial peak. Using erratic pattern and describing the sequence of changes. Describing patterns like erratics or rebound is much more powerful than simply stating dates. It shows you are analyzing the story the data tells, not just reading coordinates. Overall, while global production rates fluctuated considerably in the early years, a clear trend towards diversification became evident by 2020. Strong summary language focusing on overall significance, clear trend towards. This sentence is perfect for your overview. It doesn't list data, it identifies the most important overarching takeaway. This confirms to the examiner that you understand the main message. Let's compare 4 pairs. Oil production rose from 5 million to 10 million tons. Oil production saw a dramatic increase, rising from 5 to 10 million tons over the period. Using stronger verbs and adverbs for impact. The simple version is functional but dull. By changing rose to saw a dramatic increase, you immediately sound more academic and sophisticated. We are making your language vivid. In the early years, both sectors were similar in size. Initially, both sectors maintained comparable levels of output, suggesting parity at the start of the period. Using precise vocabulary, parity, and formal adverbs initially. When you use academic words like parity, you demonstrate a high level of lexical resource. This shows that you are comfortable with specialized, formal English. Gas usage stayed the same from 2010 to 2020. Between 2010 and 2020, gas consumption remained remarkably stable, showing little deviation from its previous rate. Adding nuance and descriptive adverbs, remarkably. The strong version adds little deviation, which is much more precise than simply saying stayed the same. It suggests that even if there were minor changes, they weren't significant. By 2015, renewable energy was higher than fossil fuels. By 2015, the proportion of renewable energy sources had surpassed that of traditional fossil fuels. Using relative phrasing, proportion, surpassed for comparison. The word surpassed is far more dynamic than simply was higher. Furthermore, specifying proportions directs the reader to a comparative analysis of shares or percentages. Watch out for these 3 common mistakes. Weak, the number of people using the internet increased and also decreased. Strong, internet usage exhibited volatility, initially increasing before undergoing a noticeable decline later in the decade. Listing increased and also decreased is repetitive. The strong version uses descriptive nouns like volatility, which encapsulates both movements into one academic concept. Weak, according to the chart, the highest point was in 2005 because it went up a lot. Strong, the peak occurred in 2005, reaching its zenith due to marked growth over the preceding years. Avoiding causal language like because makes your writing sound more objective and analytical. Instead of stating a cause and effect simply, you describe the fact of the peak. Weak, in contrast to oil, solar power is rising strongly. Strong, compared with oil, solar power demonstrated robust growth throughout the period under review. Simple comparisons like is rising are too conversational. Using phrases such as demonstrated robust growth is formal and precise, improving your overall academic register. Here are 4 ways to practice. Select key features first. Do not try to cover every single data point. Identify the maximum, minimum, steady trend, and biggest change. These are your 4 focus points. The biggest mistake students make is attempting to report everything. You must be selective. Choose only the most statistically significant numbers to support your claims. Structure your narrative. Plan a clear pathway. Overview. Key trend. 1. Growth decline. Key comparison. Key comparison. Detail support. This guides the reader smoothly. Think of yourself as a guide leading the examiner through the data rather than just reading out numbers. This structured approach guarantees coherence and logical progression. Use complex grammar. Incorporate advanced structures like relative clauses, which, that, or conditional statements to link ideas elegantly. Using complex grammar isn't just for show. It allows you to embed multiple pieces of information into one cohesive sentence. This maximizes your score while maintaining clarity. Master the verbs. Create a mental bank of synonyms for increased, decreased, and remained. Examples include soared, dipped, plateaued, remained constant. Vocabulary variety is cornerstones of high-scoring writing. Always pre-plan these high-impact verbs so that when you are under time pressure, your language remains varied. When describing graphs and charts, simple words like went up or dropped down are insufficient. We need precise academic vocabulary to convey the speeds, magnitudes, and natures of change in data. This set of verbs and adjectives will help you move beyond basic descriptions into advanced analytical language. Mastering these terms significantly boosts your score when discussing trends. Remember, sophisticated English is about using the exact word for the exact concept. The key takeaway here is precision. Instead of just saying the numbers increased, think about how they increased. Was it a slow creep or a sudden boom? By learning vocabulary like surge and plummet, you are not just speaking English, you are analyzing the data with expert linguistic tools. Let's go through 6 words. For each word, I will say it clearly, then explain how to produce it correctly. The word is fluctuate. Say it again, fluctuate. Fluctuate is a very useful academic verb that describes non-directional movement. It implies irregularity, which is key. Use this word when the data shows no clear pattern of increase or decrease, but rather a back and forth motion. The word is surge. Say it again, surge. A surge suggests speed, power, and sudden momentum. It is stronger than simply increasing. Think of it like a wave crashing. It's rapid, forceful, and noticeable. This verb is perfect for describing immediate market booms. The word is plummet. Say it again, plummet. If plummet is the opposite of surge, it means a rapid, dramatic descent. It carries a sense of gravity and speed. When you use this word, you are emphasizing that the decline was not gradual but severe. The word is steady. Say it again, steady. If you need to describe slow, predictable growth, steadies is your go-to adjective. It suggests reliability and consistency. When describing long-term trends that are stable, using steady adds an air of measured confidence to your analysis. The word is volatile. Say it again, volatile. Volatile describes the qualities of the data, meaning it changes dramatically without a clear reason. It's more intense than just fluctuating. Use this when you want to warn your listener that predictions might be difficult. The word is peak. Okay, peak. While peaks can be a verb, it is most useful here as a noun to identify the absolute high point on a chart. This makes your language very specific when you are pointing out maximum values. Always pair this with phrases like reached its peaks or peaked at. Here are 5 examples. After the policy change, sales began to surge dramatically in the following month. Surge verb. Notice how surge immediately draws attention to the suddenness of the increase. This sentence is far more compelling than simply saying sales increased quickly. It paints a picture for your listener. Due to global climate factors, the sea levels tend to fluctuate year by year. Fluctuate, verb. Here we use fluctuate because the changes in sea level aren't always massive or dramatic. They are more of a continuous, irregular movement. This shows a nuanced understanding of natural processes. The data showed a steady upward trend over the last 2 decades. Steady adjective. Using steady implies time and consistency. It suggests that while there might have been minor dips, the overall direction is reliable and predictable. This is excellent for summarizing long-term growth patterns. The commodity market remains highly volatile due to geopolitical instability. Volatile adjective. When you use highly volatile, you are not blaming the data, you are identifying a systemic risk. This is high-level language that signals deep understanding of complex, unpredictable systems. After reaching its peak in May, revenue began to plummet sharply through the rest of the year. Peak noun, plummet verb. This sentence combines 2 powerful words. By mentioning peaking first and then describing the subsequent fall with plummet, you create a clear narrative arc for your data description. Let's compare 4 pairs. First, increase. Compare it with surge. General versus sudden, forceful. Remember, increase is the general term we use when speaking English in general. However, if you want to emphasize that the jump was immediate and very powerful, always upgrade it to surge. The difference shifts your description from merely factual to dramatically engaging. First, decline. Compare it with plummet. Mild general versus extreme rapid. A decline is a polite academic word for any drop. But if the graph shows a vertical freefall, you must use plummet. Using plummet instantly and dramatically conveys the severity of the fall to your audience. Fluctuate. Compare it with volatile. Process, verb versus quality, adjective. This is a common point of confusion. Fluctuates describes the action, the back and forth process itself. Volatile describes the nature or inherent character of the thing that is doing the fluctuating. First, steady. Compare it with stable. Consistency, long-term versus unchanging, short-term. While often interchangeable, steady usually implies a slow, predictable evolution over time. Stable, however, suggests that the data point is resistant to change. It's settled and reliable in the short term. Here are 4 ways to practice. Locution grouping. Practice linking verbs with their specific prepositions and adverbs. Example, plummet dramatically, surge significantly. Don't just learn the word, learn how it behaves grammatically. By grouping collocations, you make your language sound much more natural and native-like. Always check which adverbs pair best with high-impact verbs like plunge or soar. Picture walkthroughs. Take any random graph stock prices, rainfall, etc., and force yourself to describe it using only our target vocabulary. Record yourself doing this. Active output is the best way to solidify these concepts. When you are forced to use volatile or steady in real time, your brain makes stronger connections. The goal here is fluency and instant recall. The opposite game. When practicing vocabulary, always think of the direct opposite. If you learn surge, immediately define its opposite, a slow decline. This method builds lexical depth by forcing you to consider antonyms and their appropriate context. It helps prevent you from using an incorrect word just because it sounds similar to the correct one. Review and reuse. When you write or speak next week, pick 3 vocabulary words from this lesson and intentionally include them. Do not wait for a chart. The best way to move vocabulary from short-term memory to long-term fluency is consistent, deliberate reuse. Force yourself into the conversation with these high-level terms. This cements them permanently in your academic arsenal. Now it is your turn to practice. Read or listen to the following passage carefully. Global energy consumption started to surge rapidly after the last decade. However, this growth was highly volatile, showing sharp dips when recessions hit. While some sectors maintained a steady upward trajectory, others began to plummet dramatically towards their lowest trough. Analysts note that predicting future trends remains challenging due to market instability. Question 1. Find a word in the passage that means increased suddenly and rapidly. Pause the video now and write your answer before we reveal it. The correct answer is surge. The paragraph uses surge perfectly here because it describes an immediate, powerful start to consumption. Notice how the text contrasts this sudden start with later dips, showing the full range of these verbs. Question 2. Use one of the target words in your own sentence. Pause the video now and write your answer before we reveal it. The correct answer is, the global economy is currently exhibiting volatile behavior. When creating your own sentences, try to embed the word within a complex structure. Instead of just stating, it is volatile, explain why or when it is volatile. This boosts both accuracy and complexity in your speaking. When we speculate about how past decisions or hypothetical policy changes affect the present or future, we use advanced conditional structures. The key here is distinguishing what could have been from what's this. We often employ the third conditional if plus, had plus past participle, would have plus be thirdo discuss missed opportunities in policy. However, for a current outcome based on a past action, mixed conditionals are invaluable tools. Remember that these structures allow us to move beyond simple predictions and engage in sophisticated academic debate. The most challenging part of conditionality is managing time shifts. Don't just try to memorize the forms, focus on why you are shifting time. Are you regretting a policy decision from 5 years ago or predicting an outcome based on current legislative inertia? Understanding that if clause sets up a hypothetical reality is half the battle. Here are 5 examples. If the board had funded renewable research last decade, we would have reached carbon neutrality by now. Third conditional, past action, tollers, present result. This example is perfect for policy discussions because it addresses a clear missed opportunity. They had funded anchors us to the past, while would have reached shows the present impossibility of that outcome. If the government revised its tax bracket system, small businesses could afford to expand significantly. Second conditional, hypothetical present to hypothetical present. Hypothetical present. Here we are discussing a current policy adjustment. The second conditional helps us explore ideal scenarios that are contrary to the present reality but should be considered. If technology hadn't advanced so quickly, medicine would still rely on more natural remedies. Mixed conditional, past condition, tollers, present result. This mixed structure is excellent for comparing historical context with modern realities. It suggests that a past condition fundamentally altered our present state of affairs. They would face immediate backlash if they proposed such radical legislative changes. Type 2 modal, hypothetical future warning. Sometimes we don't need a full if clause. Using modals like would or could allows us to warn about probable outcomes without needing to state the exact condition. If stricter emission standards were implemented years ago, global climate change would be less severe today. Mixed conditional, past condition toller, present result. Notice how were is used for the hypothetical past condition. This structure allows us to criticize or analyze historical governmental inaction directly and powerfully. Let's compare 4 pairs. Conditional, if we reduce spending, the economy would stabilize. Simple future, we will reduce spending and the economy will stabilize. Hypothetical versus certainty. The key difference lies in certainty. Conditionals explore possibilities. It might happen. Simple future statements are presented as facts or guaranteed predictions, requiring less nuance. Modal of deduction. The policy must be difficult to implement. Conditional. If they implemented the policy, it would be difficult. Deduction versus condition. Modals of deduction allow you to draw a conclusion based on limited evidence. You are reasoning now. The conditional requires you to invent an entire scenario first and then predict the outcome. Mixed conditional. If they hadn't cut funding, we would have better research. Third conditional. If they had cut funding, we wouldn't have that research. Past action focus. The third conditional focuses on the result of a past action. The mixed conditional links that past failure to a lasting change in our current state or reality. Simple past. They debated the policy extensively. Conditional, if they had debated it, we wouldn't know this much. Fact versus hypothesis. Using the simple past simply reports a completed event. Using the conditional implies that the debate did not happen, and thus our current knowledge level is different. Fill in the blank with the correct form. If the government blank stricter carbon taxes last year, emissions would be lower now. Pause the video now and fill in the blank before we reveal the answer. The correct answer is had implemented. This requires a mixed conditional. The if clause must refer to a past action that has an effect on our present reality. This structure is perfect for criticizing historical policy lapses. If funding were increased, scientists blank breakthrough medical treatments. Pause the video now and fill in the blank before we reveal the answer. The correct answer is would develop. Because we are discussing a general, hypothetical possibility in the present, the second conditional is appropriate. We are not talking about past failure or guaranteed future success. If they blank this environmental report, the committee would change its stance. Pause the video now and fill in the blank before we reveal the answer. The correct answer is saw. This uses the simple second conditional structure. It sets up a clear hypothetical condition, seeing the reporto predict a likely reaction from the committee. We blanked this outcome if we had followed the original sustainability model. Pause the video now and fill in the blank before we reveal the answer. The correct answer is would have avoided. This is a third conditional statement. We're looking back at policy history and speculating on a negative result that did not happen because of an earlier failure. Watch out for these 3 common mistakes. Incorrect subject-verb agreement. If the budget cuts was approved, we would have fewer resources. Correct. If the budget cuts were approved, we would have fewer resources. Remember that in hypothetical clauses, especially those involving if, English often uses the subjunctive mood. Even if the subject is plural or singular, using were for conditionality sounds more formal and academic. Incorrect tense type mismatch. If they change the law, climate will get better. Correct. If they change the law, the climate would improve. You mixed a simple present in the if clause with a simple future prediction. When speculating about hypothetical policies, always default to the second conditional structure, past tense and with past base verb. Incorrect. Mixing structures. I wish we had implemented these changes last year. Correct. If we had implemented these changes last year, things would be different now. While I wish is a common way to speculate, expanding it into a full conditional sentence adds academic weight. It explicitly shows the link between the unfulfilled past action and the current speculative outcome. Now it is your turn to practice. Read or listen to the following passage carefully. The City Council is debating strict new zoning laws. The opposition argues that if the rules were too rigid, economic growth would slow dramatically. They suggest that a phased implementation, starting with voluntary compliance over 5 years, would be more effective. Many experts believe this gradual approach allows businesses to adapt without sudden market shock. Question 1. Find and correct the grammar error in this sentence. If they'd invest in public transport earlier, traffic congestion wouldn't be so bad today. Pause the video now and write your answer before we reveal it. The correct answer is, if they had invested in public transport earlier, traffic congestion wouldn't be so bad today. This is a common mistake with past perfect verbs. Remember that the third conditional requires the had auxiliary verb followed by the past participle, which for invest is invested. Focus deeply on getting those 3 parts correct. Question 2. Write your own sentence using this grammar point to speculate about future global policy changes. Pause the video now and write your answer before we reveal it. The correct answer is, if international treaties mandate sustainable sourcing, supply chains would undergo massive restructuring within the next decade. When formulating your own speculative sentences, try varying the conditional type. Don't stick only to third conditionals. Mixing and matching timeframes like this shows a high level of grammatical control. When examiners listen for your lexical resource, they are not just counting unique words. They are assessing the natural fit and appropriateness of your vocabulary within a complex argument. This means moving beyond simple synonyms and successfully integrating advanced phrasal verbs and idiomatic structures. The goal is to sound articulate, precise, and spontaneous, making your speech flow naturally from one sophisticated idea to the next. Remember that sounding academic doesn't mean speaking robotically. The key is integration. These complex phrases must feel natural when you speak them. Practice weaving these structures into full sentences rather than reciting them in isolation. This technique moves you from merely knowing vocabulary to truly mastering fluent, sophisticated English. Let's go through 5 words. For each word, I will say it clearly, then explain how to produce it correctly. The word is, it bears mentioning that, bus. Say it again. It bears mentioning that. This phrase is excellent because it signals to the listener that you are about to offer a nuanced perspective, not just a simple fact. Use this when your argument needs a slight pivot or an important qualification. It shows intellectual maturity in your response. The word is, while I appreciate the premise, one must consider. Say it again. While I appreciate the premise, one must consider. By acknowledging the other person's point first, you soften your opposition while maintaining strong critical thought. The word is, this naturally leads us to question whether. Say it again. This naturally leads us to question whether. Do not just use simple connecting words like so or therefore. This phrase creates a smooth, logical trajectory between ideas, demonstrating that your thinking process is structured and coherent. It elevates your discourse marker game. The word is, on a related note, it's worth noting. Say it again. On a related note, it's worth noting. This is perfect when you need to introduce a secondary but related piece of evidence without losing the thread of your main argument. It shows that you can navigate complex discussion points gracefully and logically. The word is, all things considered, the most immediate impact is. Say it again, all things considered, the most immediate impact is. Use this when you have presented multiple viewpoints and need to synthesize them into one strong, conclusive statement. It signals that your thought process is reaching its final, most critical point. Let's compare 4 pairs. The problem will come up later. This issue is likely to surface in subsequent discussions. Formalizing predictions. Notice the shift from come up to surface. Academic English favors higher register verbs that are more precise. Instead of vague phrasal verbs, aim for single strong nouns and verbs like ameliorate or mitigate. We need to figure out a plan. We must formulate a comprehensive strategy, replacing simple action verbs. The difference here is moving from the informal figure out to formulate. This shows that you can handle abstract, complex topics with appropriate academic vocabulary. Always consider if there's a single Latinate verb available. It brought about big changes. This has resulted in substantial systemic change. High-level causality. Instead of the slightly casual brought about, use formal constructions like resulted in or catalyzed. These phrases are robust and highly respected by examiners because they demonstrate precise understanding of cause and effect. The policy kind of slowed down development. The policy has somewhat impeded economic growth. Improving descriptive power. Replacing kinda is easy, but replacing slowed down with impeded or stifled shows a deeper grasp of meaning. Adjectives like substantial, systemic, and comprehensive are your best friends for raising the formality level. Watch out for these 3 common mistakes. Grammar slip, subject, verb agreement. The environmental impact are very big. Correction, precision, and grammar. The environmental impact is quite significant. Be careful with collective nouns and abstract concepts. They often take singular verbs. Additionally, replacing very bigs with quite significant instantly adds polish and sophisticated vocabulary. Filler words and hedging. The studies show that better clarity and formality. For instance, academic research demonstrates that minimizing fillers is crucial for fluency. Instead of resorting to like or, use specific signposts like, for instance, or to illustrate. These phrases guide the listener and make you sound more confident. Vagueness and overstatement. So, I think we should change everything about the education system. Better specificity and register. Therefore, a fundamental overhaul of the current educational framework is warranted. Avoid sweeping generalizations like change everything. Instead, use measured language words like overhaul, framework, or warranted sound, much more considered and academic. Specificity is key to a high band score. Here are 4 ways to practice. Advanced shadowing techniques. Don't just repeat, focus on the rhythm. Listen to podcasts and shadow specific complex transitions, like how native speakers smoothly transition between points. When shadowing, pay attention not only to what they say, but how they pause and stress words. This helps you internalize the natural cadence that makes advanced speech sound effortless rather than rehearsed. The idea mapping drill. Take a complex article, like one from The Economist, give yourself 60 seconds and force yourself to orally link 5 distinct concepts using the new linking phrases we practiced. This drill mimics the real-time pressure of speaking tests. By focusing on connecting disparate ideas, you train your brain to access high-level vocabulary under time constraint, which is exactly what examiners want to hear. Recording for self-correction. Record yourself discussing a topic and then listen back, specifically hunting for moments where you used simplistic language or repeated the same structure. Self-critique is invaluable. When listening back, don't judge your ideas, only judge your slanguage. Circle every time you could have replaced very good with commendables or discussed with delve into. Timed response drills 3 minutes. Set a timer for 3 minutes and force yourself to speak continuously on a single topic, incorporating the target phrasal verbs naturally throughout your monologue. Fluency requires endurance. By setting strict time limits, you prevent yourself from rambling or falling back into comfortable, simple language patterns. This technique builds conversational stamina while forcing lexical sophistication. Now it is your turn to practice. Read or listen to the following passage carefully. You are discussing the future of urban centers. Describe whether the increasing trend of remote work will fundamentally change how people live in cities. You should cover the impact on city infrastructure, changes to social interaction and community life, potential positive outcomes for quality of life. Aim to speak for 2 minutes, incorporating at least 2 advanced phrasal verbs. Question 1. What is the most important thing to include in your answer? Pause the video now and write your answer before we reveal it. The correct answer is a clear thesis statement and well-developed opposing views. Do not just list pros, analyze how they interact. Structure is paramount here. Start with a strong position. Use those advanced phrases like, "While I appreciate the premise," to address counterarguments. And conclude by synthesizing your main points using language such as, "all things considered." This shows holistic thinking. Question 2. What language feature should you demonstrate? Pause the video now and write your answer before we reveal it. The correct answer is the ability to sustain a high academic register while maintaining natural fluency. Practice linking complex ideas with transitional structures. Focus on the connective tissue between your thoughts. Use those nuanced markers. This naturally leads us to question, or on a related note, to ensure your speech flows like a coherent academic presentation, not just a list of points. Subordinating conjunctions are powerful linguistic tools that help us build complex sentences. Think of them as relationship signposts. They signal how one idea depends on another. These conjunctions introduce a dependent clausier group of words that cannot stand alone. They link this dependent clause to an independent clause, which can speak by itself. Mastering these links allows you to show cause, condition, time, or contrast in your writing and speaking. It's important to remember that subordination is all about showing hierarchy. You aren't just listing ideas, you are explaining the relationship between them. Using a conjunction like because tells the listener that one idea is the direct reason for another, adding analytical depth to your communication. Here are 5 examples. Although the rain was heavy, we continued our hike. Contrast although. Notice how, although introduces a concession way, expected us to stop, but we didn't. This structure immediately elevates your writing from simple statements to thoughtful arguments. We arrived late because the train was delayed. Because. When you start a sentence with because, always remember that comma rule. The dependent clause is at the beginning, so it needs that pause to separate it from the main idea. If you study regularly, you will improve your grades. Condition, if. This example uses a condition. The if clause sets up the necessary circumstances. Without studying, the outcome simply doesn't happen. This is key for discussing policies or outcomes. When the alarm sounded, everyone evacuated quickly. Here when. Using when helps sequence events precisely in time. It gives your narrative a strong sense of flow and causality that simple listing cannot achieve. Unless the budget increases, the project will be postponed. Negative condition, unless. The conjunction unless means if not. This is a powerful way to present constraints or necessary prerequisites, adding formal weight to your claims. Here are 3 reasons why this matters. Elevating complexity. Moving from simple coordination to complex structures. Using conjunctions moves you beyond basic sentence linking. It shows the listener or reader that your thoughts are interconnected and nuanced, which is a key marker of advanced fluency. Showing logical depth. Defining relationships like necessity, contrast, or time sequence. Instead of just stating 2 facts side by side, you are now explaining why they relate. You are presenting an argument, not just a list of observations. Improving speaking flow. Making spoken English sound more academic and cohesive. When you speak fluently, your speech should feel like one continuous thought process. Subordinating conjunctions help the listener track that sophisticated line of reasoning. Watch out for these 3 common mistakes. Some learners say, "She walked home because it was raining." The better way to say this is, "She walked home because it was raining." This sentence is actually correct, illustrating proper comma placement when the conjunction introduces a clause following the main statement. Don't say, "Because of the delay, we missed the start." Say, "Because the train was delayed, we missed the start." Be careful not to confuse because of with a conjunction. Because of is a prepositional phrase followed by a noun, while because introduces an entire clause with a subject and verb. Don't say, "When finished, the report was submitted." Say, when the report was finished, it was submitted. This error is called a dangling modifier. The initial clause needs to clearly specify who or what is performing the action mentioned in the main part of the sentence. Here are 4 ways to practice. Identify your core relationship. Before writing or speaking, ask yourself, is this idea a cause, effect, condition, or contrast? If you know the function, this type of relationship, you can quickly select the precise conjunction needed. This pre-planning step dramatically improves your rhetorical accuracy. Practice varying structures. Don't start every complex sentence with although. Mix up starting clauses to keep listeners engaged. Try embedding the dependent clause in the middle of the sentence rather than just always leading with it. This variety makes your speech sound less predictable and more sophisticated. Focus on if and unless. These are high-level conjunctions perfect for academic discussions about policy and outcomes. Whenever you are discussing hypotheticals or necessary criteria, these words are your best friends. They allow you to explore possibilities without making definitive statements. Read aloud for flow. Always read your complex sentences out loud to check the rhythm and natural pause points. Writing something that looks grammatically correct on paper can still sound stilted when spoken. Reading it aloud helps you find where a slight comma adjustment will make the entire sentence flow perfectly. Building complex sentences means combining multiple related ideas into one grammatically cohesive unit. It requires understanding how different clause independent, dependent, and relative interact seamlessly. The goal is not just to string words together, but to show the logical relationship between all your points. This advanced skill allows you to express nuanced arguments with greater academic weight. In IELTS writing, this demonstrates a high level of grammatical control and sophisticated thought. Remember that complexity isn't about length, it's about precision. When you use multiple clauses correctly, you signal to the examiner that your thoughts are deeply connected and structured. Think of these sentences as miniature research papers, where every piece of information supports a central claim. Here are 4 examples. Although technology has increased global connectivity, the resulting over-reliance on digital communication often hinders genuine face-to-face interaction. Uses an adverbial clause, although, to set up a contrast immediately. Notice how although establishes a clear tension between 2 ideas. This structure allows you to present a counter-argument gracefully, which is highly effective in academic writing. The government must invest heavily in public transportation networks, ensuring that all citizens, regardless of socioeconomic status, have reliable access to employment centers. Uses a non-restrictive clause, regardless of, to add necessary detail about the scope of the policy. This example uses an appositive phrase and a dependent clause together. This shows that your argument isn't just general, it has specific, equitable implications for all groups. Experts suggest adapting educational curricula to incorporate practical skills, which will better prepare students for the rapidly evolving demands of the modern job market. Uses a relative clause, which, to modify and elaborate on the main action, adapting curricula, the use of which efficiently modifies the entire preceding idea. This is much tighter than using 2 separate sentences, creating better flow and academic resonance. Having implemented stricter environmental regulations last year, the company significantly reduced its operational carbon footprint while maintaining profitability. Starts with a perfect participial phrase, having implemented, to establish cause and effect immediately. Starting with a participle creates immediate momentum. It tells the reader why the main action happened first, giving your argument a strong sense of causality and proactive thought. Let's compare 4 pairs. Poor infrastructure limits economic growth. Also, people cannot get to work easily. Because poor infrastructure severely limits economic growth, many citizens find it difficult to commute to viable employment centers. Combining 2 short, choppy sentences into one flowing cause and effect statement. The weak version feels like a list of complaints. By subordinating the second idea with because, we show that the lack of infrastructure is the direct cause of the commuting difficulty. We need better water management. This is important because climate change increases drought risk. Given that climate change escalates the risk of severe droughts, enhancing regional water management systems is critically urgent. Using a prepositional phrase, given that, at the start to introduce the premise before making the main argument. Starting with, given that immediately sets the necessary context. It elevates your tone from merely stating facts to analyzing underlying conditions. The government should teach coding skills. These skills help people in new jobs today. Training students in modern coding skills, which are increasingly vital, will better equip them for the dynamic demands of 21st century labor markets. Using a relative clause to seamlessly insert explanatory information without breaking the sentence's flow. The phrase "which are increasingly vitals" acts as an elegant parenthetical explanation. It adds depth without needing separate, choppy sentences. Solar energy is good. Many countries should use it more to fight climate change. As global efforts intensify to mitigate climate change, increasing the adoption of solar energy sources presents a crucial opportunity for numerous nations. Starting with a complex introductory phrase, as global efforts intensify, that sets the stage and frames the argument globally. This structure immediately places your idea within a larger, urgent global dialogue. It moves beyond simple suggestion to strategic analysis. Watch out for these 3 common mistakes. Comma spliced choppy. The data showed a clear increase in usage. This suggests people are using the internet more. Subordinating clause. Because the data showed a clear increase in usage, it strongly suggests that public reliance on the internet is growing. A comma splice happens when you join 2 complete sentences with only a comma. By using because, we grammatically establish that one idea causes the other, making your logic undeniable. Dangling modifier, walking quickly through the park, the city was beautiful. Clear subject linkage, walking quickly through the park, I found the city to be incredibly beautiful. A dangling modifier is when the subject performing the action isn't clear. You must ensure that the noun doing the walking is also the actual person who found the city beautiful. Misplaced modifier, the solution, focusing on education reform, was rejected by lawmakers. Clarity and placement. Lawmakers rejected the proposed solution, which focused heavily on educational reform. The word focusing needs to be attached correctly. By placing the modifying clause after solution, we clarify that it was the content of the solution, not the lawmakers, that failed. Here are 4 ways to practice. The triple point method. Identify 3 connected ideas. A cause, B action process, and C result. Link them using because, thus, and a relative clause. Instead of writing the sentence, write these 3 points down first. This forces you to map out the causal chain before worrying about grammar, ensuring your complex structure is logically sound. The parenthetical pause. Use non-restrictive clauses, often with which, to add supporting detail without stopping the main flow of thought. Think of this as an academic aside extra, valuable information. Using commas around these phrases shows excellent control and deepens your analysis. The causal chain mapping. When discussing policy or science, always map X leads to Y, which consequently causes Z. Build the sentence in that order. This technique helps you build momentum. You are not just listing facts, you are illustrating a chain reaction of cause and effect, which is key for high scores. The transitional sentence skeleton. Before writing the main complex sentence, write a simple skeleton. Although idea 1 happens, idea 2 remains true. Then expand each bracketed section. This scaffolding technique gives you instant structure. It ensures that your core contrast or concession is established first, giving maximum impact to the final complex sentence. Now it is your turn to practice. Read or listen to the following passage carefully. Some argue that governments should subsidize space exploration for scientific advancement. Others believe these funds would be better spent addressing immediate terrestrial issues like poverty or climate change. Discuss both views and give your own opinion. Question 1. What is the key requirement of this task? Pause the video now and write your answer before we reveal it. The correct answer is, you must demonstrate balance by discussing 2 opposing viewpoints, while maintaining a complex grammatical structure throughout to link these contrasting ideas. The challenge here is not just listing pros and cons. You need transitional complexity structures that manage contrast or concession within one sentence, like, although X is true, Y remains more critical because... Question 2. What would a Band 7 response focus on first? Pause the video now and write your answer before we reveal it. The correct answer is developing several highly complex sentences in the introduction and conclusion. Use clauses to frame every argument within a broader academic context. Don't wait until the body paragraphs to use advanced structures. Set the tone immediately. By using complexity early, you establish your command of English grammar right from the start. Academic writing demands absolute grammatical precision. Two common pitfalls are subject-verb agreement errors and inconsistent tense usage. But remember that the verb must always agree with its true subject in number, singular or plural. Furthermore, once you establish a primary narrative tense often, the simple present for academic facts, you must maintain it throughout your argument. Maintaining consistency signals polish and sophistication to the examiner. These errors are not just minor slip-ups, they undermine your authority as an academic writer. When the grammar wavers, the reader's focus shifts from your brilliant ideas to the mechanical mistakes. Treat these rules like structural beams. If they fail, the entire argument can collapse. Here are 4 examples. The unprecedented rise in global temperatures necessitates urgent policy changes across multiple sectors. Effective use of the plural subject, temperatures, controlling a singular verb necessitates. Notice how rise is the true subject here, making the sentence grammatically airtight. This mastery prevents abrupt shifts in grammatical focus and builds flow. Historical data suggests that education spending consistently correlates with improved health outcomes. The simple present tense is maintained when discussing general or historical truths. When writing about established academic findings, the simple present tense is your safest bet. It presents these facts as enduring realities rather than temporary observations. Many factors, economic shifts, and cultural resistance influence how communities adopt new technologies. Handling compound list subjects correctly, factors, is plural, controlling a verb that matches the plurality. This example shows you can handle complex subject structures. Always locate the core noun that dictates whether your main verb must be singular or plural. While early researchers believed X was true, modern studies now suggest alternative explanations. Smoothly transitioning between past, belief, and present, current knowledge, controlling tense shifts effectively. The key here is managing the timeline. You acknowledge what was previously thought in the past tense, but anchor your current argument firmly in the present perfect or simple present. Let's compare 4 pairs. The evidence suggests that social media affects mental health. The evidence suggests that social media affects mental health. Fixing SVA, evidence, is an uncountable singular noun. This simple fix demonstrates how confusing collective nouns can be. Always pause and ask yourself if the subject treats the concept as one whole unit or multiple individual parts. The government implemented policies that changing society quickly. The government implemented policies that changed society quickly. Fixing tense, the action changing must match the past context of implementation. When describing a completed event in your essay, stick to clear past tense verbs. Using an incorrect participle can create ambiguity about when the change occurred. Climate change and pollution are major issue worldwide. Climate change and pollution are major issues worldwide. Fixing plurality, both issues plural and worldwide, adverb conceptually pluralized, need adjustment. Remember that subject-verb agreement also extends to general nouns. If you list multiple topics, make sure the noun count matches your descriptor. The study has revealed a pattern which are not immediately obvious. Fixing agreement, the relative pronoun which refers back to the singular noun pattern. This is a common trap involving compound subjects and relative clauses. Identify what which is replacing that singular noun dictates your verb. Watch out for these 3 common mistakes. Weak. Data are increasingly used by researchers. Wrong, data is increasingly used by researchers. While data historically means plural, in modern academic writing, it is often treated as a singular mass noun. Using the singular verb is safer and more common practice today. Weak, if governments will invest more money, poverty decrease. Strong, if governments invested more money, poverty would decrease. This corrects a mixed conditional structure. To talk about hypothetical or unlikely conditions, you must use the past simple in both the if clause and the main result. Weak, the biodiversity of rainforests are threatened by logging. Strong, the biodiversity of rainforests is threatened by logging. Crucially, in this sentence, biodiversity itself is the single subject. The prepositional phrase of rainforests gives context but does not change the core singular noun. Here are 4 ways to practice. The subject test SVA. Mentally remove all prepositional phrases. The noun remaining must match the verb number. This is a powerful diagnostic tool for complex sentences. Getting rid of distracting information allows you to see the true structural relationship between your subject and your verb. The tense roadmap. Map out time markers, e.g., since 2020, currently, historically, before writing, ensuring tense agreement. Do not wait until the end to check tenses. By creating a roadmap first, you guide yourself toward inevitable temporal shifts and maintain narrative integrity. The noun-verb anchor. For every sentence, underline the primary subject noun and its corresponding verb. If they don't agree, flag it. This tactile method of underlining forces you to slow down and physically confirm agreement. It turns a passive grammar check into an active, measurable skill. The revision read-through. Read your essay aloud, focusing only on the verbs and their subjects. Listen for unnatural pauses. Reading aloud is perhaps the most underrated editing technique. Your ear will often catch an awkward grammatical mismatch that your academic eye might skip over. Now it is your turn to practice. Read or listen to the following passage carefully. Some argue that universal basic income, UBI, is the necessary response to job displacement by automation. Others claim UBI disincentivizes work and creates economic dependency. Discuss both views and suggest a balanced policy approach. Question 1. What is the key requirement of this task? Pause the video now and write your answer before we reveal it. The correct answer is, you must maintain consistency when discussing current trends, simple present, while also acknowledging historical or potential changes, conditional future forms. The prompt requires you to analyze a contemporary debate, so using the simple present tense for general facts is ideal. However, because you are suggesting solutions, don't neglect conditional structures like governments should consider. Question 2. What would a Band 7 response focus on first? Pause the video now and write your answer before we reveal it. The correct answer is, a strong response will dedicate clear topic sentences to each differing viewpoint while ensuring every verb in those sections aligns with the intended time. Remember that grammatical accuracy supports coherence. If your argument shifts between historical data and modern proposals, ensure your tense shift is grammatically justified and smooth. When an examiner is assessing your speaking depth, they are not just looking for accurate information, they are listening for the complexity of your thought process. Excellent answers move beyond simple description by providing causation, consequence, and nuanced examples. You need to explain the why behind your claims and elaborate on the how something might impact others. Think about structuring your response around evidence and analysis rather than just listing facts. Remember that true depth isn't about using massive vocabulary, it's about showing intellectual flexibility. If you can explain a simple concept like recycling using cause and effect chains, you demonstrate mastery of complex English thought patterns. Always aim to provide at least 2 layers of detail for every main point you make. Let's go through 5 words. For each word, I will say it clearly, then explain how to produce it correctly. The word is, to illustrate this point, I would argue that. Say it again. To illustrate this point, I would argue that. This phrase is perfect for when you need to transition from a general statement into concrete proof. Instead of just saying, "It's good," use this structure to introduce an illustrative example, making your argument feel solid and well-researched. The word is, the primary consequence of this trend is, pie. Say it again, the primary consequence of this trend is. This type of phrasing immediately elevates your answer from simple opinion to academic analysis. You are signaling that you understand the systemic implications, which shows a high level of critical thinking and vocabulary control. The word is, on a deeper level, I believe that. Say it again, on a deeper level, I believe that. Use this phrase when you want to deepen the conversation right after discussing surface-level issues. It tells the listener, wait, there's more nuance here, allowing you to introduce a less obvious but critical perspective. The word is, this is intrinsically linked to. Say it again, this is intrinsically linked to. When you use this, you are demonstrating advanced command of relational grammar. It moves your answer beyond simple listening and shows the listener that you understand how different ideas feed into one another. The word is. One potential drawback we should consider is bus. Say it again. One potential drawback we should consider is. A truly advanced speaker doesn't just present positives, they anticipate weaknesses. By introducing a perceived drawback, you demonstrate balanced thinking and critical engagement with the topic material. Let's compare 4 pairs. It basically means, in essence, it suggests. Formal analysis opener. The shift here is from casual explanation to academic definition. By using in essence, you signal that your answer will be precise and highly structured, which is ideal for discussing abstract concepts. A lot of people think. It is widely perceived that, stating general opinion, when you are referring to public belief, always use formal framing. Widely perceived adds authority and academic distance, suggesting you are discussing societal trends rather than just personal assumptions. Like, it helps with. Specifically, it facilitates. Giving an example. Never use vague filler words like in formal speaking. Replacing them with strong verbs and precise signposting phrases, such as specifically, makes your examples sound intentional and authoritative. It's super important to. It is paramount that we prioritize. Stating importance. Elevate the verb choice. Instead of saying something is important, use vocabulary like paramount or crucial. This immediately raises your lexical resource score and adds weight to your argument. Watch out for these 3 common mistakes. Simple statement. So, I guess that technology is good because it connects people. End. Elaborated thesis. While technology certainly facilitates connection, a more significant benefit is the immediate access to specialized knowledge, which empowers individuals globally. The mistake here was simply listing benefits. The correction shows you are analyzing why it connects people and what the deeper impact of that connection is. Knowledge access, in this case. Vagueness generalization. I think climate change is bad because we use cars a lot. Systemic detail. The escalating carbon emissions from private vehicles contribute significantly to global warming, which necessitates a systemic shift towards sustainable public transport infrastructure. Don't stop at the obvious cause. To deepen your answer, you must identify the system that needs fixing. Naming carbon emissions and suggesting infrastructure shifts shows depth. Hesitation, deflection. It's hard to say, I don't know what you mean. Strategic refocusing. That's a complex question. To provide the most detailed response, could we perhaps focus on the economic factors involved? A filler phrase is far worse than needing to pause. Instead, use a phrase like this to buy time while simultaneously guiding the conversation back to an area you are confident discussing in depth. Here are 4 ways to practice. The White House expansion drill. Pick any simple statement, e.g., I like coffee, and practice expanding it by force, feeding yourself 3 follow-up questions. Why? How? What is the consequence? This drill forces you out of your comfort zone of surface detail. It trains your brain to immediately transition from a simple claim into an analytical discussion, which is exactly what examiners want. The counter-argument role play. Pretend someone disagrees with everything you say. Practice responding not by defending yourself, but by calmly acknowledging their point before pivoting to a more complex counterpoint. This technique is excellent for improving fluency under pressure and mastering polite disagreement. It shows the examiner that you can logically dismantle an opposing viewpoint while maintaining politeness. The vocabulary deep dive. Take 5 common nouns, e.g. problem, change, success, and practice using them in 5 different high-level academic collocations, e.g. socioeconomic problem, paradigm shift, sustainable success. By pairing basic words with advanced structures, you achieve 2 goals simultaneously, expanding your vocabulary and improving your ability to sound highly academic and analytical. The timed elaboration challenge. Give yourself 30 seconds after a prompt. Do not speak until the timer ends. Then, force yourself to speak for 2 full minutes using only phrases that add depth, e.g. Furthermore, consequently, to elaborate, the silence before speaking is critical because it allows your brain time to shift from thinking of a simple answer to constructing a multi-layered argument. Use the pause strategically, not just out of panic. Now it is your turn to practice. Read or listen to the following passage carefully. Imagine discussing how technology is changing the nature of work. This topic requires you to move beyond listing gadgets and instead analyze impact. Points to cover: the shift from office work to remote labor, the necessity of new skills, e.g. emotional intelligence, digital literacy. ICE, potential long-term social impacts. Question 1. What is the most important thing to include in your answer? Pause the video now and write your answer before we reveal it. The correct answer is, you must create a narrative arc. Start with a clear statement, the change, analyze the cause-effect chain, and conclude with a solution or prediction. Do not just list points. Focus on showing connections between ideas rather than presenting them as separate facts. A strong speaker weaves these points together using cohesive devices to create one continuous stream of insightful thought. Question 2. What language feature should you demonstrate? Pause the video now and write your answer before we reveal it. The correct answer is, demonstrate advanced causal linking and conditional speculation. Use phrases like, this trend will inevitably lead to, or should we fail to adapt. The consequence would be, P. Conditionals allow you to speculate convincingly without having definitive proof, which is key for academic discussion. This ability to discuss hypothetical future outcomes elevates your performance significantly. Timed essay writing is not just about getting words on the page, it's a performance test. It requires you to fluidly execute multiple skills simultaneously: coherence, grammatical accuracy, advanced vocabulary usage, and structural integrity. The key rule here is efficiency. You must synthesize all these elements under pressure without sacrificing quality. For IELTS, this simulates real academic writing where time constraints are expected. Mastering this means moving past simply knowing the rules and achieving automatic recall of complex structures. The goal of integrated practice is to train your writing muscle memory so that sophisticated language use feels natural and immediate. When you write under a clock, you don't have time to pause and check every conjugation. Therefore, practicing speed and accuracy together is crucial for high scores. Here are 4 examples. The escalating prevalence of urban sprawl necessitates a paradigm shift in municipal planning, demanding the re-evaluation of car-centric infrastructure. Uses high academic register and sophisticated vocabulary, paradigm shift necessitating. Notice how necessitates immediately elevates the tone. Using collocations like escalating prevalence sounds far more authoritative than simply saying more and more. Always aim to replace common verbs with stronger, more precise synonyms. While some argue that economic growth is paramount, this perspective fails to account for the cumulative damage caused by unchecked industrial output. Employs concessive clauses while, effectively to introduce counter-arguments smoothly. The use of while here doesn't just link ideas, it signals a nuanced debate. This structure is perfect because it shows the examiner you can acknowledge an opposing view before firmly refuting it. It is only by implementing robust global regulations that we can mitigate the adverse consequences of deep-sea mining. Uses inversion only by for emphasis and advanced sentence structure. Inversions like this are powerful tools to draw attention to a crucial point or condition. They immediately signal fluency and grammatical mastery, making your writing sound highly polished. Consequently, policymakers must pivot toward decentralized renewable energy sources if they wish to secure long-term climate resilience. Strong conclusion using precise linking adverbs and expert vocabulary. Pivot, resilience. The word consequently provides clear logical flow. Pairing strong verbs like pivots with abstract nouns like resilience showcases a high level of academic command over both action and concept. Let's compare 4 pairs. The government should do more about climate change. Governments must implement stricter policies to address the urgent crisis of climate change. Replacing vague language with specific, formal terminology. This comparison shows the immediate shift in tone. Instead of sounding like an opinion piece, the strong version adopts a formal, policy-driven register expected in academic writing. Because people use phones too much, it is bad for their focus. Given the pervasive nature of mobile phone usage, cognitive function and attention spans are demonstrably deteriorating, moving from simple cause-effect because to complex causal relationships. By utilizing given the pervasive nature, you signal sophisticated vocabulary while structurally linking the cause to its measurable effect. This level of specificity is what separates Band 6 from Band 8 writing. If we change things, maybe it will be better. Should radical reforms be implemented, a significantly improved quality of life could subsequently materialize. Using conditional structures, e.g., should plus subject plus verb for formal speculation. The structure should X happen is much more advanced than a simple if. It's a highly elegant way to speculate on policy outcomes while maintaining a confident academic voice. I think education is important for people's future. Education serves as the primary catalyst for socio-economic mobility and individual advancement in modern society. Shifting from personal opinion, I think, to objective, authoritative statements. Never start a formal essay with, I think. Instead, use strong topic sentences that make a declarative assertion. This immediately positions your writing as an academic analysis rather than a personal reflection. Watch out for these 3 common mistakes. Wordy nominalized, the increasing use of technology leads to the acceleration of poor communication. Concise active voice. Increased reliance on technology accelerates the decline of effective communication skills. Watch out for nominalization, where you use abstract nouns like acceleration instead of powerful verbs. Converting these back to active voice makes your writing punchier and far more direct. 2 general weak claim. It is generally true that people are happier when they have money. Nuanced qualified argument, while correlation exists, attributing personal happiness solely to wealth oversimplifies complex human motivations. Avoid sweeping generalizations like generally true. Instead, introduce nuance by acknowledging the complexity of the issue. This demonstrates critical thinking and raises your argumentative level. Informal vocabulary repetitive. Many people have to study hard and they need good teachers. Academic collocations precision. For effective learning outcomes, students require rigorous academic support coupled with highly competent educators. The key here is replacing simple, everyday words like goods or need with precise academic collocations. This refinement instantly boosts your lexical resource score. Here are 4 ways to practice. The reverse outline method. Before writing, quickly list the main points and supporting evidence for every body paragraph. This ensures structural balance. Don't start with the introduction. Dedicate your first 2 minutes solely to outlining. Knowing exactly what you plan to say prevents rambling when the pressure is on. Targeted grammar focus. During drafting, consciously use one advanced structure like the passive voice or a specific perfect tense every other paragraph. Instead of trying to fix everything at once, pick one challenging grammar point and force yourself to integrate it strategically. This controlled practice solidifies retention under pressure. The 10-minute review. Do not stop writing until the clock runs out. Use your final minutes only for checking flow, linking words, and major errors. Resist the urge to rewrite entire paragraphs. Focus your review time strictly on cohesion, checking that every paragraph flows logically from the last one. Vocabulary preloading. Keep a bank of 10 strong collocations relevant to common essay topics, e.g., economic, environmental. Always try to incorporate at least 5. Having these high-level phrases preloaded means you won't have to stop and think of them during the actual test. This strategic preparation is invaluable for maintaining fluency. Self-assessment requires more than just knowing definitions. It demands rapid recall under pressure. We are focusing on high-level academic vocabulary essential for testing and critical analysis. These words help you accurately describe gaps in knowledge or the complexity of a subject. Learning these terms boosts your ability to articulate precise ideas quickly. Remember, true mastery isn't just about recognition, it's about immediate retrieval. When we talk about rapid recall, we are simulating the pressure of an exam setting. Our goal today is to transition these words from passive knowledge to active, instant use. Let's go through 6 words. For each word, I will say it clearly, then explain how to produce it correctly. The word is synthesize. Say it again, synthesize. Think of synthesize as building something new from existing parts. You aren't just listing facts, you are weaving them together to create an original conclusion or argument. A common error is confusing this with simply summarizing. Synthesis requires more intellectual blending. The word is discrepancy. Say it again, discrepancy. When you identify a discrepancy, you are pointing out an inconsistency, usually in data or accounts. This term is highly valuable in academic writing when comparing sources. It sounds much more formal than simply saying difference and elevates your analytical tone. The word is evaluate. Okay, say it again, evaluate. Evaluate means to judge worth, which is a step beyond merely describing something. When you evaluate, you are applying criteria and forming a judgment based on those standards. Use it when your writing needs to show critical judgment. The word is fluency. Say it again, fluency. While fluency often relates to speaking, it can also describe writing a text that flows seamlessly without abrupt changes in tone or structure. When discussing language skills, this word is far more precise than just saying someone speaks well. The word is robust. Say it again, robust. Robust is an excellent adjective for academic contexts, especially in science or policy. It implies strength that isn't just physical, but structural or conceptual. If your plan needs to survive unexpected challenges, it must be described as robust. The word is mnemonic. Say it again, mnemonic. A mnemonic isn't just a trick, it's a formal tool for memory retention. When you are studying hard vocabulary, creating these devices like rhymes or initialisms is key to moving information into long-term memory. It shifts your study method from passive reading to active creation. Here are 5 examples. The author managed to synthesize complex philosophical ideas into a single, accessible argument. Synthesize verb. Notice how the phrase single, accessible argument emphasizes that the synthesis was successful. It suggests the writer took disparate pieces of information and made them work together smoothly for the reader. The report highlighted a major discrepancy between the recorded sales figures and the physical inventory count. Discrepancy, noun. Here, discrepancy is used to signal an investigative problem. It tells the reader that there is a mismatch that needs explaining or correcting, giving your writing immediate tension. Before we can recommend changes, we must first properly evaluate the current system's limitations. Evaluate verb. The structure must first. Evaluate shows a necessary process. You cannot propose solutions until you have thoroughly judged what is currently in place. This establishes credibility. Despite initial hesitations, her public speaking fluency grew significantly with consistent practice. Fluency, noun. In this context, fluency speaks to the smoothness of delivery. It's not just about using many words, it's about making those words flow naturally and at an appropriate pace. The engineering team developed a robust framework capable of withstanding extreme temperature fluctuations. Robust adjective. When you use robust, you are promising reliability. It gives the reader confidence in your subject matter, suggesting that whatever system or concept you describe is highly resilient and dependable. Let's compare 4 pairs. First, synthesize. Compare it with summarize. Synthesis creates new meaning, summarizing reports' existing points. The difference is crucial. Summarizing means boiling down what others said, while synthesizing means using those ideas as raw material to build something entirely original. Always aim for synthesis when you want to demonstrate deep thought. First, assess. Compare it with evaluate. To assess is general measurement. To evaluate requires forming a value judgment. While these words are close, assessors can be objective like counting items. But evaluates forces you one step further, determining if those counted items are good or bad. Think of it as moving from data collection to critique. First, clarity. Compare it with fluency. Clarity is precision. Fluency is smooth delivery. You can speak with great fluency sounding very natural and fast, but if your ideas lack clarity, the listener will be confused. True mastery requires both, effortless speech combined with crystal clear thought. First, vague. Compare it with robust. Describes weakness, lack of detail versus strength, resilience. These are structural opposites in description. If your argument is vague, it lacks specific support. If it is robust, it means the core structure, the evidence, and logicis unshakable. Here are 4 ways to practice. Contextual mapping. Don't memorize isolated definitions. Connect the word to an entire scenario. Instead of writing discrepancy difference, write a mini-story where you must use that word. Linking vocabulary to vivid mental images drastically improves retention and recall speed. Spaced repetition. Reviewing material at increasing intervals prevents decay. This is scientifically proven for memory. Review your difficult words today, then again in 3 days, then a week, and finally 2 weeks later. This spaced effort solidifies the knowledge without unnecessary cramming. Collaborative gap filling. Test yourself by having a partner fill in blanks using the target word. Teaching or testing others is one of the most effective ways to cement your own knowledge. It forces you to not only know the answer, but also to articulate why it fits, which builds fluency. Minimal pair practice. Drilling word pairs, e.g., assess, evaluate, quickly improves distinction. When 2 words are similar in meaning but different in usage like assess and evaluate, you must drill them together. Quick contrast practice solidifies the subtle, high-level distinctions needed for academic fluency. Now it is your turn to practice. Read or listen to the following passage carefully. The research team faced a significant challenge when they noticed a major discrepancy between the initial field reports and the newly acquired satellite data. To overcome this, they decided to evaluate both datasets independently. They had to synthesize these varied inputs into one robust model. This process demanded high analytical fluency and required them to create several mnemonic aids for complex variable tracking. Question 1. Find a word in the passage that means a lack of consistency or agreement. Pause the video now and write your answer before we reveal it. The correct answer is discrepancy. The context made it clear that the contradiction was between 2 types of data, the reports and the satellite images. Use this question to activate your knowledge, demonstrating immediate recall under a time constraint. Question 2. Use one of the target words in your own sentence, showing its academic power. Pause the video now and write your answer before we reveal it. The correct answer is, the policy needs a more robust framework to ensure long-term success. When you answer, try to make it sound like formal speech. Don't just write the definition, build an entire thought around the word. This shows true mastery and prepares you for high-level academic writing. Achieving high band scores means moving beyond simply performing 4 separate skills. Instead, you must adopt an integrated performance mindset, where listening informs your speaking and reading structures your writing. This requires viewing English not as a collection of isolated rules, but as a fluid system for complex communication. When preparing, always ask yourself, how can I use this grammar point to improve my argument structure? Or, how can I describe this data using more varied vocabulary? The goal is seamless transition and constant cross-referencing between skills. Many students still think of reading, writing, speaking, and listening as separate checklist items. However, true fluency means they operate simultaneously. When you integrate these skills, you are showing the examiner that your language knowledge is deep and versatile, which is exactly what top marks reward. Here are 5 examples. After hearing the speaker mention resource scarcity, I argued that local policy changes are necessary. Listening, speaking, synthesis. This example shows how listening is not just comprehension, it's fuel for your output. You must actively reference specific points from an audio source to make your response highly credible and detailed. The dramatic dip in Q3 suggests a market correction, which could be attributed to global supply chain issues. Reading, writing, academic tone. When writing, don't just repeat the data. Use sophisticated linking phrases and academic vocabulary to interpret what the reading material is telling you, rather than merely reporting it. If authorities had implemented stricter zoning laws earlier, we might not be facing this housing crisis now. Speaking, advanced conditional use. Don't just use the third conditional, practice embedding it within a longer narrative. This demonstrates both grammatical control and ability to speculate on complex causal chains. The correlation between increased leisure time and higher reading rates is significant. Writing, synthesizing, 2 sources. In writing tasks, try to synthesize information from multiple prompts or readings. This forces you to create a unique argument that combines different pieces of provided evidence. The primary challenge is not the lack of funding, but the difficulty in coordinating departmental efforts. Speaking, identifying core conflict. Higher-level speaking involves pinpointing the core tension or central conflict within a discussion. This ability to summarize the essence shows profound understanding beyond surface details. Here are 3 reasons why this matters. Holistic understanding of context. Language use changes depending on the situation and audience. Top-scoring English speakers register the appropriate tone for a job interview versus an academic presentation. Integration forces you to constantly check if your language matches the context. Developing argumentative depth. It moves beyond stating facts and into analyzing implications. A high-band response doesn't just say X happened. It answers, why did X happen? And what does X mean for the future? This depth requires drawing connections between disparate pieces of information. Building fluency through cognitive load. The brain becomes more efficient at switching between language functions. Practicing integration increases your cognitive flexibility. You are training yourself to switch gears quickly from listening for key verbs to recalling the correct grammatical structure and then producing it all fluidly. Focus intensely on nuance markers that elevate your discourse. These are the small linguistic details that separate a good response from an excellent one. This includes using hedging language, which allows you to express opinions without sounding overly absolute or dogmatic. Remember phrases like, it appears that, or one might argue that. Furthermore, mastering nominalization turning verbs into nouns is crucial in academic writing. Instead of saying, the government decided, write, there was a governmental decision. This immediately elevates your vocabulary and formality. Academic nuance is about controlling certainty. You are not just stating facts, you are discussing hypotheses. Using hedging language doesn't make you sound weak, it makes you sound thoughtful, balanced, and highly aware of complexity. Here are 4 ways to practice. The 3P framework for speaking. Practice. providing prediction, purpose, and parallel examples. When answering a question, never give just one point. Adopt the 3Ps framework. State your main point, provide proof evidence, and then predict the policy implication. This structured approach guarantees depth. The triple passes writing check. Proofread for structure, grammar, and lexis separately. Do not proofread everything at once. First, check your flow and paragraph structure. Second, scan only for grammar errors like articles or prepositions. Finally, polish your word choices. This segmented approach prevents you from missing small details. Time management mapping. Allocate fixed time slots for each section, regardless of difficulty. Under pressure, the biggest mistake is spending too much time on one difficult question. Create a mental map and stick to it. If you finish early, use the remaining time for a final review pass. Embrace ambiguity in listening. Listen not just for facts, but for underlying assumptions or omissions. The best students don't just listen to what is said, they listen to what isn't said. Pay attention to shifts in tone, hesitation, or sudden changes in topic. These often reveal the speaker's true point of view. IELTS Writing Task 2 requires you to write a cohesive essay responding to a prompt. It is not enough simply to list ideas. You must build a sophisticated argument that addresses all parts of the question. A strong response maintains an academic tone while developing complex, focused points. Remember that successful writing relies on mastering structure, clear introductions, topic-specific body paragraphs, and concluding summaries. When we talk about argumentative structure, we are moving beyond just linking sentences together. Think of your essay as a pyramid. The thesis statement is the peak, and every subsequent paragraph must support it with increasingly detailed evidence. Always ensure your main points flow logically from one another to build undeniable momentum toward your conclusion. Here are 4 examples. While some believe that mandatory uniform policies stifle creativity, the primary benefit lies in fostering a sense of community and reducing socioeconomic visibility among students. When all pupils wear the same attire, the focus shifts from material possessions to academic achievement and personal growth. Effective thesis topic sentence directly addresses the counterargument while pivoting to the main claim, focusing on community. Notice how this first sentence is powerful. It doesn't just state an opinion, it acknowledges the opposing view, while some believe structure. This immediately shows the examiner that you have considered the topic from multiple angles, increasing your band score potential. Furthermore, governments must dedicate resources to improving public transport infrastructure. Investing in reliable rail links and expanding bus networks will alleviate urban congestion, making city life more sustainable for all residents. Strong transitional linking uses furthermore and provides clear cause-effect reasoning, alleviate congestion, sustainable life. The strength here is the direct link between problem and solution. Instead of just saying transportation is bad, the writer specifies what needs to be done investing in rail, links and explains the resulting benefit, which makes the argument concrete. The rapid proliferation of digital media has fundamentally altered traditional journalism. Today's audience consumes news instantly across varied platforms, requiring journalists to adapt their narratives for maximum engagement and speed. High-level vocabulary in noun use uses proliferation, fundamentally altered, and narratives to maintain an academic register. Pay attention to the vocabulary choice here. Using words like proliferations instead of increase shows a high lexical resource, which is crucial for scoring well. It elevates the entire paragraph from mere description into sophisticated analysis. In conclusion, while economic factors play a role, cultural initiatives are more critical in preserving historical sites. Local community engagement and educational funding provide the necessary sustained interest to prevent decay. Powerful conclusion restates the thesis using different words, paraphrasing, and offers a final, conclusive thought. A great conclusion doesn't just summarize, it provides closure by synthesizing your main points into a broader, impactful statement. By rephrasing your original argument without repeating exact phrases, you demonstrate mastery of paraphrasing skills. Let's compare 4 pairs. Many people think that studying late is good for grades. The belief that prolonged study sessions enhance academic performance warrants critical examination. Shifting from simple statement to complex, nuanced phrasing. The first version is too direct and casual. The improved version immediately establishes a formal, objective tone by using phrases like warrants critical examination. This signals to the marker that you are engaging in academic debate rather than just stating facts. Technology makes life easier for people everywhere. Technological advancements have fundamentally simplified daily existence across global populations. Using stronger verbs and more abstract nouns to generalize the claim. Instead of makes easy, notice the shift to fundamentally simplified. This upgrade in vocabulary combined with using the plural populations broadens your scope, suggesting a deeper understanding of the topic's global implications. If we don't fix pollution, the planet will get worse. Failure to mitigate environmental pollutants risks severely degrading planetary health and biodiversity in the coming decades. Replacing vague warning phrases with specific academic terminology, mitigate, degrade. This is a key example of upgrading your register. Instead of get worse, we use degrading or deteriorating. Using specialized vocabulary related to the topic like biodiversity shows that you are genuinely engaged with academic discourse. I think government should give more money to art. It is argued that governmental investment in cultural arts and humanities is a vital economic and social priority. Adopting formal, impersonal structures, avoiding I think. Never use I think in task 2 unless specifically told to give personal opinion. The strong version uses phrases like, it is argued that, which allows you to present an informed perspective without staking your entire argument on your own voice. Watch out for these 3 common mistakes. Weak grammar word choice. Due to the rain, we could not go outside. Strong. Because of the heavy rainfall, our outdoor plans were cancelled. A common error is confusing due to and because of. Remember that due to usually follows a form of the verb, while because of introduces a noun phrase. Using precise grammar makes your prose sound highly polished. Weak subject, verb agreement clarity. The main reason for this problem are lack of planning. Strong. The primary cause of this issue is insufficient preliminary planning. This mistake focuses on subject-verb agreement. When the subject, like reason, is singular, the verb must be singular and agree accordingly. This simple fix instantly boosts your grammatical accuracy score. Weak redundancy. In conclusion, to sum up everything that was said. Strong. To conclude, in summation, it can be argued that be careful with redundancy. Phrases like in conclusion and to sum up mean the same thing. Selecting varied signposting language or choosing just one strong phrase is a mark of advanced writing control. Here are 4 ways to practice. The time allocation rule. Spend exactly 5 minutes planning before writing a single word. Outline your introduction, 3 body paragraphs, and conclusion. Many students rush into the essay without planning, which leads to underdeveloped ideas. By dedicating focused time purely to outlining, you ensure that every paragraph has a mandated purpose, keeping you on track for the full 250-word count. The topic sentence anchor. For each body paragraph, write one clear topic sentence first. This acts as a mini-thesis guiding your reader and yourself. Think of the topic sentence as a promise to the reader. In this paragraph, I will prove X. If you can confidently state that central idea in one strong sentence, the rest of the paragraph is simply elaboration. Brainstorming. Keywords first. Before writing sentences, list 5 high-level academic verbs and 5 advanced nouns related to the prompt. This builds your vocabulary toolkit. Don't wait until you are drafting to think about better words. Actively pre-select sophisticated language so that when writer's block hits, your brain automatically pulls from a pool of appropriate, high-scoring vocabulary. The counter-argument mapping. Always map out the opposite viewpoint and dedicate one section or sentence to it. This boosts your task response score. Showing that you are aware of opposing arguments is arguably the single most effective way to improve your analytical depth. It transforms your writing from a simple defense of an idea into a nuanced, objective discussion. Now it is your turn to practice. Read or listen to the following passage carefully. Some people believe that all university education should focus purely on career-specific skills. Others argue that the humanities and arts are equally vital for a well-rounded life. Discuss both views and give your own opinion. Question 1. What is the key requirement of this task? Pause the video now and write your answer before we reveal it. The correct answer is, the prompt requires you to discuss two distinct viewpoints, career skills versus humanities, before concluding with your own position. Because this is a discuss both views and give opinion essay, failure to dedicate equal time and space to both sides will immediately lower your score. You must balance the discussion equally before you present your final stance. Question 2. What would a Band 7 response focus on first? Pause the video now and write your answer before we reveal it. The correct answer is, the response should spend its introduction clearly defining the scope of career specifics and humanities, setting up a balanced yet argumentative roadmap for the reader. A high band response doesn't just answer the question, it manages expectations. By spending time in the introduction to define terms and structure the debate, you prove sophisticated control over the entire piece from the very first sentence. Pronouns are powerful linguistic tools that allow us to avoid repetition. However, their power comes with a responsibility. They must always clearly point back to something already mentioned, which is called the antecedent. When this link is unclear, we face pronoun ambiguity. Advanced usage requires precision, ensuring that every pronoun has one unmistakable noun it refers to. This isn't just about grammar. It's fundamentally about maintaining logical flow for your reader. A strong grasp of pronoun reference shows sophistication in writing. Remember that the antecedent doesn't have to be the immediately preceding word. Sometimes, you need to look back several clauses to find the noun the pronoun is meant to replace. Always ask yourself, could this pronoun refer to two different things? If the answer is yes, you likely need to restructure your sentence. Here are 4 examples. The committee decided to postpone the meeting because it lacked proper funding. Ambiguous reference it. Here it is unclear. Did the committee lack funding or did the meeting lack funding? The reader has to guess, which breaks immersion and clarity. You must rewrite this sentence to clarify whether the subject of the problem was the meeting or the group itself. When the researchers spoke to the students, they were surprised by the enthusiasm. Ambiguous reference, they. Who was surprised? The researchers or the students? Since they could grammatically refer to either group, the sentence is confusing. To fix this, restructure it so that the subject of the surprise is explicitly named. The machine requires calibration before its use. Agreement. In this case, it clearly refers back to the machine. This demonstrates precise agreement. The possessive pronoun matches the singular noun in a simple and effective way. Since the policy affects businesses and consumers alike, all must adapt. Unspecified antecedent, all. The pronoun all is acting as a collective reference. While understandable in context, it's much stronger to name the groups directly. Both businesses and consumers must adapt. This removes any doubt about who needs to take action. Here are 3 reasons why this matters. Maintaining reader credibility. Ambiguity forces the reader to pause and logically backtrack. In formal writing, every sentence should propel the argument forward without friction. When you create ambiguity, you are forcing your expert reader to do extra cognitive work just to understand who is doing what. This detracts from your overall authority on the subject. Achieving logical cohesion. Clear reference ensures that causality and relationships between ideas remain intact. Pronouns are critical for cohesion, acting like invisible threads tying sentences together. If the thread is attached to the wrong object, the entire argument structure can unravel. Strong pronoun usage guarantees a tight, logical mesh. Elevating academic tone. Precision in language is synonymous with intellectual rigor. Writing that avoids ambiguity sounds polished and highly professional. Skilled writers rarely leave anything to chance. They control every single pointer, including those invisible pronouns. Mastering this detail significantly boosts the perceived quality of your work. Watch out for these 3 common mistakes. Don't say, "The management and the staff held a meeting, but it was chaotic." Say, "The management and the staff held a meeting. However, the discussion was chaotic." Here, it could vaguely refer to the meeting or the people involved. By splitting the sentence and replacing the pronoun with a clear noun phrase like the discussion, you eliminate all doubt about the antecedent. Incorrect, she told her colleague that she needed to submit the report by noon. Correct, she told her colleague, you need to submit the report by noon. This is a classic example of ambiguous she. Is it her, the speaker, or colleague? When using pronouns that could refer to people, restructuring the sentence to use direct speech or rephrasing often provides the most clarity. Don't say, "The car needed oiling because its engine was making strange noises." Say, "The car's engine needed oiling because it was making strange noises." While not a pronoun substitution issue, observe how using the possessive form on the noun car's engine is often clearer and more direct than relying on its. Sometimes, simply changing the syntax is the best fix for ambiguity. Here are 4 ways to practice. The substitution test. If you are unsure of a pronoun's antecedent, temporarily replace it with the actual noun. Does the sentence still make sense? This is your most powerful editing tool. If substituting the noun makes the sentence clunky or requires excessive rephrasing, then the original structure was flawed. Don't be afraid to rewrite the entire clause for better flow. The noun-heavy approach. When possible, favor using full noun phrases over pronouns. This increases word count but boosts clarity significantly. While repeating a noun sounds repetitive to the ear, on paper, it guarantees zero ambiguity for the reader's brain. In academic or legal writing, sacrificing some stylistic flair for absolute precision is always the right choice. Visual mapping. When proofreading complex paragraphs, physically draw arrows connecting each pronoun back to its specific antecedent. Treat your writing like a diagram. By literally mapping these connections, you force yourself to acknowledge every single linguistic link. This physical act of reviewing builds an unconscious habit of checking coherence. Read aloud and slow down. Reading the text aloud forces you to pause at potential points of confusion, allowing you time to adjust. Our brains often skip over these minor logical gaps when we are focused on meaning. Reading slowly, especially complex passages, activates a different part of your brain that is much better at catching subtle grammatical mismatches and unclear references. This course markers are small words or phrases that act as signposts in your speech. They don't carry the main grammatical meaning. Instead, they guide your listener through your thought process. Mastering them allows you to structure arguments logically and transition between ideas smoothly. We are focusing on 3 specific functions today. Concession, which acknowledges an opposing point. Emphasis, used to highlight a critical piece of information. And qualification, which shows that your statement is conditional or limited in scope. Think of discourse markers as the invisible architecture of your speech. They tell the listener not just what you are saying, but how they should interpret it. Understanding these 3 functions, concession, emphasis, and qualification, moves you from merely speaking to building a sophisticated argument. Here are 5 examples. Although the data is limited, we must proceed with caution. Concession, despite although. Notice how although sets up a contrast. You are acknowledging the weakness of the data before stating your necessary action. This makes your argument feel more balanced and credible. In fact, the primary obstacle is not funding but public buy-in. Emphasis, indeed, in fact. Using in fact signals to your listener that you are correcting a potential misunderstanding or elevating the importance of a specific point. It adds immediate weight and conviction. It is important to note that this theory applies only within urban settings. Qualification, however, only. Phrases like "it's worth noting" or "only" are key for qualification. They prevent your statement from sounding too absolute, showing the speaker has considered limitations. Granted, costs are high, nevertheless, the long-term benefits outweigh them. Concession, nevertheless. When you start with granted, you signal that you have fully considered the counter-argument. This structured approach makes your final conclusion much stronger. To be clear, this policy aims to reform, not abolish, the existing framework. Emphasis, to be clear. To be clear is a powerful way to pause and reset the listener's understanding. It acts as an immediate corrective tool, ensuring that your core message lands with maximum impact. Here are 3 reasons why this matters. Building credibility and tone. Effective use shows that you are a measured, thoughtful speaker. A skilled communicator doesn't just present facts, they manage the listener's perception of those facts. By using these markers, you demonstrate metacognitive awareness. You know how your own thinking works. Avoiding monotone logic. Without variation, speech can sound like a list of disconnected points. Think of it this way, if every idea connects with "and," the speech becomes dull. These markers inject rhythm and intellectual movement into your delivery, controlling the narrative flow. They allow you to dictate when a point is secondary, primary, or conditional. This gives you control over the pacing of the conversation. You can slow down dramatically with a qualifying phrase, forcing the listener to pay acute attention. Watch out for these 3 common mistakes. Don't say, "It is undeniable that we should act now. Moreover, it saves money." Say, "It is undeniable that we should act now. Furthermore, this will save money." The mistake here is confusing markers of addition with specific causal links. Moreover, implies a slightly stronger, more formal connection than simply adding another point. Incorrect, given that the report was delayed, therefore we cannot meet the deadline. Correct, since the report was delayed, we cannot meet the deadline. When you use 2 markers of cause and effect, given that, and therefore you are redundant. Choose one strong marker to streamline your argument and sound more authoritative. Don't say, "I think it is necessary, but also acceptable." Say, "While I believe this is necessary, it remains an acceptable alternative." Using commas or simple coordinating conjunctions here makes the relationship weak. By restructuring with while, you create a sophisticated concessive clause that accurately reflects complexity. Here are 4 ways to practice. The pausing technique. Before using a marker like however or nevertheless, take a slight, deliberate pause. This signals to the listener that you are about to change your line of thought. Pacing is crucial when mastering these markers. The momentary silence gives gravity to the words that follow, making your transitions feel less like grammatical requirements and more like natural rhetorical shifts. The topic sentence drill. Structure practice by writing 3 points, a main idea, a conflicting idea, and a concluding qualification. Use markers to connect them all. This exercise forces you to move beyond simple conjunctions and actively engage with the function of concession or emphasis in your own written arguments. It builds muscle memory for advanced linking. The mirror recording. Record yourself speaking on a complex topic, but force yourself to use at least 1 marker for each function, concession, emphasis, qualification. Listen back critically. Self-correction is the fastest way to improve. When you listen back, pay less attention to your content and more attention to how you linked your ideas. Was the transition abrupt or smooth? Varying intensity. Don't overuse strong markers like indeed. Cycle through varying levels of intensity, e.g., initially, perhaps, however, critically. The goal is variation, not volume. By having a toolkit of different markers from the gentle, it seems that to the forceful, in fact, you can fine-tune your tone and rhetorical impact for any audience. Inversion is a grammatical structure where we change the usual word order in English. Instead of subject-verb-object, the auxiliary verb often comes before the subject. This shift in structure isn't random. It serves a powerful rhetorical purpose. We use inversion specifically to draw attention and add dramatic emphasis to certain ideas. By changing the natural flow, we elevate the formality and sophistication of our writing and speaking. Think of it as giving your statement a formal spotlight. It immediately signals to the listener that this point is particularly important and warrants deeper consideration. Remember that inversion does not happen in every sentence. You should use it strategically, reserving it for moments when you want maximum impact. Overusing it can sound unnatural or overly dramatic, so pace yourselves. Here are 4 examples. Never have I seen such a beautiful display of cooperation. Negative adverbial never. Notice how the auxiliary verb have jumps right before the subject I. This structure immediately makes the sentence sound more formal and academic. It's much stronger than simply saying, I have never seen. Rarely do we encounter such complex datasets in this field. Negative adverbial rarely. When you start a sentence with rarely, the auxiliary verb do takes its place. This pattern is highly useful for academic discussions because it emphasizes how unusual or infrequent the subject matter is. Not until did the committee realize the depth of the problem. Line clause, not until. The phrase, not until, requires this inversion structure. It forcefully emphasizes that the realization or event only happened after a specific condition was met. This precision is key in academic writing. Little did he know about the potential impact of his research. Negative expression, little. This structure gives a sense of dramatic revelation. The placement of little at the start allows you to build suspense and highlight the speaker's ignorance regarding the outcome. Here are 3 reasons why this matters. Increased emphasis and impact. It gives weight to the information that follows. The primary function is emphasis. By altering the expected pattern, you force the listener's attention onto the opening phrase or adverbial clause. It's a rhetorical device, not just a grammatical trick. Elevating academic tone. It signals formality and mastery of structure. In academic contexts like presentations or formal essays, using controlled inversion makes your English sound highly polished. It shows that you are comfortable with complex syntax. Varying sentence structure. It prevents monotony and keeps the audience engaged. If every sentence follows the standard SVO order, your writing can become predictable. Incorporating inversion is a way to vary rhythm and keep your readers interested throughout an entire piece. Watch out for these 3 common mistakes. Don't say, rarely the students understand such complex theories. Say, rarely do the students understand such complex theories. The most common mistake is forgetting to introduce an auxiliary verb. When you invert, you must swap out do, does, or did if the original sentence did not have one. Some learners say, not until I finished writing did the professor leave. The better way to say this is, not until I finished writing did the professor leave. When using not until, remember that the auxiliary verb always precedes the subject, even if the original clause was in a different tense. This structure is very rigid. Don't say, only by studying diligently success will be achieved. Say, only by studying diligently will success be achieved. If the inversion involves a prepositional phrase starting with only, make sure that the auxiliary verb comes immediately after the initial clause, before the subject. Here are 4 ways to practice. Pre-write and plan your emphasis. Identify the single most important point you want to make in a paragraph. This is your target for inversion. Do not try to force inversion everywhere. Instead, choose 1 or 2 pivotal moments in your speech or essay where the emphasis will have the greatest impact. Practice converting standard sentences. Take simple statements and manually rewrite them using rarely or never at the start. This builds muscle memory for the syntax shift. This active conversion process is fantastic for solidifying the pattern. Start with topics you are already familiar with, like your field of study. Use it in academic introductions. A strong opening inversion immediately grabs the reader's attention and sets a high academic tone. Starting an essay or presentation with an inverted structure is a sophisticated way to hook your audience. It signals immediately that this content requires careful listening. Read academic texts for models. Paying attention to high-level academic writing, such as published journal articles, will expose you to natural usage. When reading complex material, keep a pen handy and circle any sentence that feels unusually structured. Analyzing these models is the best way to internalize the rhythm. Synthesizing ideas means doing more than just summarizing. It requires weaving together distinct viewpoints into a cohesive whole. It is the active process of identifying patterns and connections across different sources. Instead of presenting source A's idea, then source B's idea, you are building a new understanding that incorporates both. This integrated perspective gives your argument depth and complexity. Think of synthesis as forming a third idea that didn't exist before you started reading. Common mistake learners make is confusing summary with synthesis. Remember, summarizing acts like a report card, listing what each source said individually. True synthesis acts more like an architect, using the materials from all sources to design an entirely new and stronger structure. Here are 4 examples. Climate change is accelerating due to human activity, source A. Yet economic growth remains the primary focus for developing nations, source B. A synthesis suggests that carbon-neutral development must be financially incentivized at a global. Bridging conflict. Notice how this example doesn't choose a side. It identifies the conflict environment versus economy and then proposes a third, synergistic solution. This model is highly effective in academic debates because it shows nuance. While early studies focused on genetics, source A, recent behavioral data highlights the role of social media interaction, source B. Therefore, a holistic approach requires examining both biological predisposition and digital environment. Broadening scope. This example demonstrates how new evidence expands old models. Instead of dismissing one field for another, you show that they must be examined together to gain a complete picture of human behavior. The historical narrative emphasizes political treaties, source A, but archaeological finds suggest the true drivers were shifts in agricultural patterns, source B. We must therefore reevaluate power dynamics through an ecological lens. Third, shifting focus. Here, you are changing the lens of analysis. You aren't just adding 2 facts. You are suggesting that one source's perspective is incomplete without integrating the insights from another discipline. One policy argues for deregulation, source A, while another fears market instability, source B. The synthesized conclusion suggests targeted regulation focused only on high-risk sectors. Mitigating extremes. This technique is vital when dealing with polarizing arguments. You take the core premise of each extreme view and use it to define a moderate practical middle ground that addresses both concerns. Here are 3 reasons why this matters. Demonstrates critical depth. Synthesis proves you can think beyond reading and into analysis. In academia, the goal is rarely to repeat information, it's to contribute new knowledge. By synthesizing ideas, you are actively participating in the conversation and proving your ability to critically process complex material. Builds credibility. It positions you as a well-read and balanced thinker. When an audience sees that you have considered multiple sides, they trust your final conclusion more. It moves your writing from being merely informative to being genuinely authoritative. Creates nuance. It prevents overly simplistic or black and white conclusions. The world rarely has simple answers, and strong academic writing reflects that complexity. Synthesis allows you to acknowledge the limitations of any single perspective while still forming a robust argument. The most advanced step in synthesis is identifying the unstated assumptions underlying each source. Every perspective operates on a set of beliefs that are never explicitly stated. Ask yourself, what must source A believe to be true for its argument to hold? And what does source B take for granted? By mapping these hidden assumptions, you can reveal points of conflict or potential synergy. Simply noting that 2 sources disagree is basic level analysis. However, identifying the underlying assumption, the roots belief system, is deep critical thinking. This allows you to critique not just the conclusion, but the entire foundation upon which the argument was built. Here are 4 ways to practice. The question matrix method. Create a grid with sources on the columns and key theme/questions on the rows. Fill in the intersections. This is a highly visual tool that forces you to compare concepts systematically rather than just reading them one after the other. It makes the gaps and overlaps immediately visible for synthesis. The Thesis Statement Challenge. Before writing, write 3 possible thesis statements, one based on source A, one on source B, and a third that synthesizes them. Drafting multiple competing theses forces your brain to recognize the points of friction between ideas. This exercise is excellent preparation for finding that ideal middle ground. The "so what" filter. After reading a section, immediately ask, so what does this mean when combined with source X? Write down the implication. This active filtration technique stops you from passively absorbing information. It keeps your focus on generating connections rather than just recalling facts. Outline by concept, not source. When writing your outline, use themes and ideas as headings, not the names of the sources. This structural change is critical. If you title sections Source A and Source B, you are summarizing. If you title them Economic Impact, Social Equity, and Environmental Cost, you are synthesizing. When we articulate alveolar plosives like d and d, remember that they are produced with minimal effort. For both sounds, your tongue tip must make contact near or against the ridge right behind your upper front teeth. The difference lies solely in the airflow release. To create, you momentarily stop all air, then sharply release it. 4. You perform the exact same build-up, but instead of a sharp burst, the air escapes with a more voiced vibration. In academic speech, precision matters greatly, especially with common function words or transitional phrases. Think about how data versus daytime requires that distinct voicing difference. Focusing on this subtle laryngeal activation will instantly make your delivery sound more measured and authoritative. Practice differentiating these sounds even when they are surrounded by other syllables. Let's go through 6 words. For each word, I will say it clearly, then explain how to produce it correctly. The word is hypothesis. Say it again, hypothesis. The challenge here is maintaining that subtle yet crucial unvoiced sound. Do not let it become a simples. Remember to place your tongue lightly between your teeth for that characteristic hiss. Try saying the word while visualizing placing a small feather on your tongue tip. The word is determine. Say it again, determine. Notice how the sound is often reduced when spoken quickly, which can undermine clarity. When you are presenting or discussing findings, exaggerate this middle vowel slightly to ensure listeners correctly perceive the root structure of your verb. It lends weight and carefulness to your statement. The word is criteria. Say it again, criteria. Many speakers struggle with the final unstressed vowels. Remember that this word has an important stress pattern starting on the second syllable. It is not a single stressed unit, it's built around 3 smaller vowel sounds. Articulating these small internal steps gives your speech a more sophisticated rhythm. The word is analyze. Say it again, analyze. This word is often mispronounced with too many syllables or a misplaced stress. When you analyze data, your voice should mirror that careful process. Start by exaggerating the initial an sound, making it robust and clear before moving through the remaining syllables. The word is context. Say it again, context. When you discuss context, be meticulous with the final consonant cluster. The combination of and must sound crisp and distinct. This clarity shows that your understanding of the material is comprehensive and highly detailed. The word is disseminate. Say it again, disseminate. This is a powerhouse academic verb, and its rhythm can be tricky. Focus on separating the syllables clearly so your speech doesn't become a single rush of air. A methodical pace here suggests that you are delivering important, well-vetted information. Let's compare 4 pairs. First, compliment. Compare it with compliment. The difference is in the vowel sound and initial consonant tension. While these words are challenging to distinguish visually, phonetically, they require a change in your tongue's position. The key here is realizing that compliments often carries a slightly more forceful, contained energy in its articulation compared to the other word. First, theory. Compare it with theory. The second word needs a distinct vowel sound and an extra syllable. Listen carefully to how your mouth molds itself around the central vowels. The difference between these two words is not just one letter, it's a fundamental shift in rhythm and where you place the main stress beam of your speech. First, analyze. Compare it with analyst. The word for the action versus the person doing the action. Thinking about this pair helps us understand how function words are pronounced differently based on their grammatical role. When you use analyze, think of it as a continuous process. When you say analyst, give yourself a small pause to emphasize the noun. First, hypothesize. Compare it with suppose. The formal, academic alternative for suggesting an idea. Choosing to use hypothesize over a simpler verb elevates your register immediately. Focus on delivering this word with impeccable clarity and measured pace. It signals that you are operating at a highly advanced level of discourse. Watch out for these 3 common mistakes. Wrong, data pronounced as data. Right, data pronounced as die-ta. The most common error is making the initial vowel too open, almost like saying dairy. Remember that the intended sound is a diphthong, which requires your mouth to start in one position and glide smoothly into another. Practice gliding the air from the first to the second vowel. Wrong, impartial. Right, impartial. Be careful not to soften or drop the sound in this specific word. The L needs to be clearly articulated against your alveolar ridge, giving a crisp quality to the middle section of the word. This precise articulation conveys neutrality and objectivity. Wrong, furthermore. Right, furthermore. Many speakers reduce this complex transitional phrase into 3 separate syllables, which ruins its authoritative rhythm. Instead, practice linking it smoothly so that the entire word flows as a single unit of thought. A seamless delivery makes your argument feel cohesive and undeniable. Here are 4 ways to practice. Tongue twister focus. Practice rapid shifts between dental and alveolar sounds. Try combining challenging consonant clusters like sis followed by L or followed by T. This forces your articulators to shift quickly, improving the speed and mechanical efficiency of your speech without sacrificing accuracy. Speed is not the goal, rhythmic precision is. Minimal pair drill. Pair academic words that differ by only 1 vowel sound. Selecting minimal pairs like theories versus theory or critical versus critical helps you isolate and strengthen the muscles responsible for forming those specific vowels. Treat each difference as a tiny, targeted workout for your mouth. Shadowing technique. Listen to native speakers giving authoritative lectures and mimic them immediately. This is arguably the most effective method because it forces you to reproduce not just the words, but the entire music of the speech, the pitch changes, the pauses, and the pacing. Record yourself shadowing, then compare your recording directly against the original speaker for objective feedback. Read script. Reading a formal script while whispering forces extreme control over breath and articulation. Because you cannot rely on vocal volume, whispering demands that every single consonant and vowel be fully formed with minimal effort. This controlled delivery builds incredible muscle memory for clarity, which you can then transfer to speaking at full volume. Quantifiers are words we use to indicate quantity or amount. They are essential for precise communication in English. The biggest challenge here is knowing whether a noun is countable or uncountable. Countable nouns refer to things that can be counted individually, like apples or books. Uncountable nouns, on the other hand, refer to substances, concepts, or collections that we cannot count one by one, such as information or advice. Think of this distinction not just as a grammar rule, but as understanding how things exist in the physical world. If you can put a number in front of I-tone chair, 2 chairs are countable. If you must use units like a glass of or a piece of, it is uncountable. Here are 5 examples. I have many friends who live in this city. Friends, countable. Because friends are distinct individuals, we use the quantifier many. We can count them one by one. Using much here would sound unnatural and grammatically incorrect. We don't have much time before the train leaves. Time, uncountable. When we talk about times as a general substance or duration, it is treated as uncountable. We measure it in hours or minutes, but we cannot say 3 times. Therefore, we use much. She published many articles last year. Articles, countable. Article is countable because you can list them sequentially. If she had only written a little amount of writing, we would use little, not many. Did you buy much food for the picnic? Food, uncountable. While food is made up of countable items like sandwiches and apples, when we refer to food as a general category or bulk quantity, it functions as an uncountable noun. This requires much. They spent too little money on the trip. Money, uncountable. Although we use dollars or pounds to count amounts of money, the word money itself is always uncountable. We say a lot of money, not many monies. Here are 3 reasons why this matters. Units of measure versus items. Some nouns require a unit to be counted. This is the deepest layer of understanding. When we talk about concepts like information, we aren't counting discrete units. We are dealing with a conceptual mass that requires measurement, not individual enumeration. The role of abstract nouns. Concepts like happiness or advice are always uncountable. Abstract nouns represent ideas and feelings. They cannot be physically tallied. Think about happiness. You can feel a lot of it, but you cannot count 10 instances of it. Why we use partitive phrases. We use phrases like a cup of or a piece of to make uncountable nouns countable. This technique, called using partitives, is incredibly useful because it allows us to talk about large amorphous quantities in specific measurable chunks. It bridges the gap between count and non-count. Watch out for these 3 common mistakes. Don't say, I need many advice for my career. Say, I need much advice for my career. Remember that advice, even though it is so useful, operates as an uncountable noun. It is a mass concept, so you must pair it with much. Using many suggests you are counting discrete pieces of advice. Incorrect. How much people came to the concert? Correct. How many people came to the concert? Since people are individual beings, they are always countable. The error here is treating a clearly plural and count-based noun as an uncountable mass. Don't say, I have few patience for this situation. Say, I have little patience for this situation. This is a tricky one because patience feels like an abstract countable thing. But grammatically, it functions as an uncountable noun requiring the quantifier little. Focus on the concept of duration or emotional state. Here are 4 ways to practice. The can I count it test. Quickly ask yourself if you can assign a specific number to the noun. If yes, use countable quantifiers. If no, use uncountable ones. This is your most reliable mental shortcut. If you struggle with the rule, revert to this test. It forces you to break down the noun into its core physical or abstract nature. Use context clues. Look at surrounding words. Does the sentence suggest counting items or measuring a substance? Pay close attention to verbs and prepositions in the sentence. If the verb is measuring or giving, you are likely dealing with an uncountable noun. Practice partitive phrases. When unsure, practice framing your answer using units like a slice of bread or a gallon of milk. This reinforces the measurement concept. Actively forcing yourself to use these partitives helps lock in the idea that even if we talk about a large amount, it must be broken down into quantifiable, smaller units. Listen for native speakers. When consuming media, pay attention to how native English speakers naturally use these quantifiers. Notice their rhythm and word choice. Listening is key because it trains your ear to recognize the natural patterns of usage. Over time, hearing correct structures repeatedly will make the right grammar feel instinctive. Effective test taking isn't just about knowing grammar, it's about pacing. In the IELTS Academic module, you have 60 minutes for both tasks. The key rule is distributing your time proportionally to the task weight and complexity. Task 1, reporting visual data, should take approximately 20 minutes. This includes analysis, structuring the overview, and writing the body paragraphs. For Task 2, the essay, allocate at least 40 minutes. This longer block requires more critical thinking and complex argumentation. Never spend too much time perfecting a single sentence if it means sacrificing structure or depth in other areas. Remember that pacing is arguably as important as the quantity of your writing itself. When you feel yourself getting bogged down on minor details, take a deep breath and move forward. You can always return for revision later. Think of time management as an active strategy, not just passive awareness. Here are 4 examples. The graph reveals a dramatic upward trend in solar power adoption between 2015 and 2025, suggesting rapid investment. While fossil fuels saw minor increases initially, their percentage share declined steadily throughout the decade. Excellent overview sentence directly addresses the main trends without needing complex data points. This is a perfect moment to pause after writing your overview and check your clock. By stating the overall trend immediately, you signal competence and save time later by not having to keep referencing the primary findings. Furthermore, proponents argue that remote work significantly boosts employee morale and local community engagement by reducing daily commutes. Uses strong linking phrases, furthermore, and presents a balanced argument point efficiently. When writing arguments, grouping ideas under clear thematic transitions is vital. These concise topic sentences allow you to quickly hit your word count while maintaining an academic flow. While some critics suggest that technological reliance diminishes human interaction, this overlooks the capacity for virtual connection and specialized learning opportunities. Addresses a counterargument quickly using while, showing sophisticated concession while maintaining momentum. The ability to handle nuance acknowledging an opposing view only to refute, it shows control over both vocabulary and time. This saves you from writing 2 separate, disjointed paragraphs. In conclusion, given the escalating climate crisis and technological advancements, prioritizing sustainable energy is not merely advisable. It is an economic necessity for future global stability. Strong concluding sentence that synthesizes main points and offers a definitive, high-impact final thought. The conclusion must feel decisive. Don't introduce new ideas here. Instead, rephrase your core arguments using elevated language to leave the examiner with a sense of completeness and authority. Let's compare 4 pairs. Traffic increased a lot in the cities over time. The data clearly illustrates a substantial and sustained increase in urban traffic congestion throughout the period. Replaces simple, emotional language with precise, academic vocabulary. Notice how the strong version doesn't just say increased, it specifies what's increased congestion and how sustained. This precision is key when you are under time pressure. People should use public transport because it is better for the earth. Utilizing public transportation offers significant environmental benefits, reducing individual carbon footprints and mitigating urban pollution. Shifts from vague opinion to concrete, technical claims that support the argument. When you feel yourself making broad statements, pause and try to quantify or specify the benefit. Moving from better for the earth to reducing carbon footprints instantly raises your band score. It is important to look at these numbers before writing anything. A careful initial analysis of the provided figures must precede any discussion, ensuring that all claims are evidence-based. Focuses on process and academic necessity rather than simple suggestion. This demonstrates meta-awareness. You're telling the examiner how you think. This kind of structural language is highly valued because it shows maturity in your writing approach. Overall, education helps people get jobs and live better lives. In summary, while socioeconomic factors play a role, expanding access to quality education remains the most potent catalyst for upward mobility and improved global well-being. Use a stronger academic phrasing, catalyst, upward mobilities, instead of cliché language. The difference here is moving from obvious common sense to nuanced analysis. Instead of stating a basic fact, you are explaining the mechanism by which that fact operates. Watch out for these 3 common mistakes. Weak. The biggest problem is that people don't save enough money. Strong. A primary challenge facing modern economies is the persistent issue of insufficient personal savings rates. This mistake shows a casual tone. Whenever you write for IELTS, you must elevate your diction immediately. Replace everyday phrases with formal academic terminology to instantly raise the perceived sophistication of your writing. Weak, I think that this happened because of poor government planning. Strong, this outcome can be largely attributed to systemic failures in governmental planning and policy implementation. Avoid using personal pronouns like I think or we believe. The examiner wants you to sound objective and authoritative as if you were presenting established academic knowledge. Weak, many people waste time on social media, which is bad for everyone. Strong, the pervasive use of social media platforms contributes to decreased productivity and has proven detrimental to overall mental well-being. Notice the shift from a judgmental statement, which is bad, to an analytical one. You are presenting evidence of harm, which makes your argument much more robust and convincing. Here are 4 ways to practice. The 2-minute blueprint. Before writing a single word, dedicate 2 minutes to quickly jotting down 3 main points and 1 counterpoint. This brief flash planning prevents you from getting lost in complex vocabulary. Simply mapping out your core arguments ensures that even if time runs short, the structure of your essay will remain solid. The time-boxed body paragraph. Commit no more than 10 minutes to writing both body paragraphs for task 2. Focus on development over perfection. If you spend too long perfecting your transitions, you lose time needed for actual argument support. Treat setting a hard stop as a crucial part of the planning process. The skeleton first rule. Drafting the first pass should focus only on linking ideas and content flow. Save grammar refinement for the final 5 minutes. It is tempting to stop and correct every comma or tense agreement as you write. Resist that urge. Focus on getting your main idea down quickly, creating a solid skeleton first. The final 5-minute sweep. Use the last 5 minutes solely for checking cohesion, checking linking words, and ensuring grammatical flow across paragraphs. Do not use this time to rewrite entire sentences. Instead, focus your energy on the connective tissue, checking plurals, subject-verb agreement, and making sure your transitions feel natural. Now, it is your turn to practice. Read or listen to the following passage carefully. The use of electric scooters and bicycles for urban commuting has risen sharply in major cities over the last decade. However, this trend creates new challenges regarding infrastructure safety and public space management. Question 1. What is the key requirement of this task? Pause the video now and write your answer before we reveal it. The correct answer is, analyze the provided statement by discussing both the benefits and the associated infrastructural challenges in approximately 250 words. Dedicating no more than 10 minutes to planning and outlining your response. The crucial element here isn't just answering, it's managing that 10-minute period. You must allocate time, 2 minutes for brainstorming, benefits, challenges, 5 minutes for writing the first draft, and 3 minutes remaining for review. Question 2. What would a Band 7 response focus on first? Pause the video now and write your answer before we reveal it. The correct answer is, the introduction should immediately establish both sides of the argument. The growth found Scamber Tech. The challenge toe show immediate structural control. A high-scoring candidate will not wait until the conclusion to mention the challenges. By weaving the tension between benefits and challenge throughout, they demonstrate analytical balance right from the start. Writing about problems is often easy. Describing actionable solutions requires a higher level of critical thinking. Actionable solutions are suggestions that are not only viable but also practical and implementable within real-world constraints. They must answer the how question, detailing specific steps, responsible parties, and measurable outcomes. Simply stating that a problem needs addressing is insufficient for high scores. You must explain exactly what should be done. The key takeaway here is moving from abstract statements to concrete proposals. When developing solutions, always use conditional language like implementing, requiring the allocation of resources to, or mandating. This shift demonstrates not only understanding, but also mastery of a persuasive academic tone. Here are 4 examples. To mitigate urban smog, municipal authorities should mandate the creation of low-emission zones in city centers. Furthermore, subsidies must be offered to encourage residents to switch from private gasoline vehicles to public electric transport options. Effective because it names specific actions, mandate, subsidy, and gives clear mechanisms, low emission zones, electric transport. Notice how this example doesn't just say reduce pollution, it suggests a policy, low emission zone, and an economic tool, subsidies. This level of detail shows the marker you have thought through the feasibility of your ideas. Educational institutions need to integrate mandatory financial literacy courses into their curriculum. These modules should cover budgeting, investment basics, and debt management to better prepare students for economic realities. Strong because it identifies the specific what financial literacy courses and defines its scope, budgeting, investment basics. When proposing educational changes, avoid generic terms like better learning. Instead, define the curriculum change. By specifying modules, you transform a vague suggestion into a concrete policy proposal. To combat waste management issues, local government should establish centralized composting facilities. This would divert organic waste from landfills and generate nutrient-rich soil for community farming initiatives. Highly actionable because it proposes a physical infrastructure, centralized facility leading to a tangible benefit, soil generation. The power of this solution lies in the cause and effect chain. You are proposing facility A, which leads directly to outcome B and C. Always structure your solutions as a clear, logical process. Employers must invest significantly in upskilling their workforce, focusing particularly on digital competencies. Government grants could incentivize small businesses to adopt remote work infrastructure, maximizing both flexibility and talent access. Very strong because it addresses two different stakeholders, employers and government, with specific interventions, grants, adopting infrastructure. Excellent solutions often address multiple levels of governance or industry. By naming the responsible parties like employers or local governments, you increase your credibility and depth of argument. Let's compare 4 pairs. Governments should do more to protect the environment. To mitigate climate change, governments must implement carbon pricing mechanisms and invest in renewable energy infrastructure nationwide. The strong version replaces vague verbs, do more, with specific economic tools, carbon pricing, and sectors, renewable energy. The difference between these two sentences is accountability. The weak version is passive, while the strong version forces the reader to consider a viable policy mechanism. Always aim for that level of specificity. People need to recycle more and be less wasteful in their daily lives. Local communities must establish easily accessible recycling points, complemented by educational campaigns that incentivize waste separation at the household level. The strong version moves beyond blaming the individual peoples and proposes systemic changes, accessible points, incentives. Remember that in IELTS Task 2, you are writing an academic essay, not a personal plea. Therefore, shifting the responsibility from the general public to policymakers or institutions is always safer and more persuasive. Schools should teach students about career choices so they know what jobs exist. Curricula must be reformed to include mandatory modules on emerging industries, such as artificial intelligence and green technology, providing practical pathways for student engagement. Specificity is key. Instead of career choices, the strong version names modern, high-demand sectors, AI, green tech. When discussing education, don't just say add classes. Be precise about which classes and how they should be structured. For example, linking theory to practical application like internships or modules. The city needs better ways for people to get around without cars. Urban planners should prioritize the expansion of segregated bicycle superhighways and enhance public transit networks through dedicated rapid bus lanes, improving both safety and efficiency. This version uses technical language, segregated bike superhighways, and names specific infrastructure improvements, making it sound authoritative. Good academic writing employs precise terminology. Using words like superhighways, dedicated rapid bus lanes, or infrastructure elevates your vocabulary and demonstrates subject matter knowledge. Watch out for these 3 common mistakes. Weak. Government should just make people care more about the planet. Strong. The government must implement a national conservation fund, allocating tax revenue specifically to reforestation projects and protected marine areas. The mistake here is relying on emotion or willpower. Policy solutions require measurable actions funds, targets, mandates. Always anchor your suggestions in governmental or institutional mechanisms. Weak. This problem will fix itself eventually if we wait long enough. Strong. To prevent a decline in infrastructure quality, mandatory cyclical inspections must be instituted, coupled with timely budgetary allocations for proactive maintenance. Never suggest inaction as a solution. Instead, focus on preventative measures and cycles of review. Using phrases like mandatory cyclical inspections shows systematic thinking. Weak. We need businesses to cooperate more with the community. Strong corporate social responsibility (CSR) initiatives should be legally mandated, requiring large enterprises to allocate a fixed percentage of profits toward local educational or environmental revitalization projects. The weak version is too vague. Cooperate mores means nothing. The strong version adds weight by invoking legal mandates and quantifiable metrics, turning a wish into an enforceable policy. Here are 4 ways to practice. The 3-part solution framework. For every solution you propose, address 3 elements: the agent who, the mechanism how, and the outcome what. Think of this as a mini essay structure within your paragraph. Naming the agent prevents weak, general statements because it assigns responsibility. This immediate clarity boosts your coherence score significantly. Stakeholder brainstorming. When tackling a problem, list every group affected: government, corporations, students, parents, local councils. Each stakeholder needs a different solution. This exercise forces you to think critically about the multifaceted nature of global problems. By addressing multiple stakeholders, your essay demonstrates sophisticated critical thinking that goes beyond simple agreement. Action verbs and noun phrases. Upgrade verbs like helps or do to academic phrasings. Mitigate, mandate, facilitate, institute. Use nouns like framework, protocol, or incentive. Elevating your vocabulary isn't just about sounding smart, it's about specificity. Using a precise, high-level adverbial phrase can make your argument sound much more authoritative and convincing to the examiner. The if, then, bridge. Structure your solution paragraphs using clear cause and effect logic. If X policy is implemented, then Y problem will be mitigated because Z resource will become available. This connective structure builds logical flow and coherence. It tells the reader exactly why your proposed action is necessary. Practice linking your proposals with strong transitional phrases like consequently or furthermore. A diagnostic module is not just another practice test. It is a targeted assessment designed to pinpoint your exact academic weaknesses across all 4 skills: listening, reading, writing, and speaking. Instead of simply giving you a score, this process forces you to identify the why behind any underperformance. It helps separate gaps in knowledge like poor vocabulary recall for writing from gaps in technique, such as time management during reading passages. The goal is precision, ensuring that your study time is spent only on areas where improvement will yield the highest return. The key thing to remember about diagnosis is that it requires honesty with yourself. You cannot simply guess which skill is weak. You must actively analyze why you struggled in the test environment. Think of this module as a highly detailed X-ray for your English skills, not just a simple temperature check. Here are 4 examples. Listening, difficulty following rapid academic lectures. Focus, note-taking, speed, complexity. The diagnostic confirms you catch details but lose the main thread when speech is dense. This isn't a listening comprehension issue, it's a processing speed issue under pressure. Your brain needs to simultaneously write down information and interpret complex context, which takes significant practice. Reading, failing to distinguish between inference and direct fact. Focus, reading for implication. The test shows you are great at finding explicit answers, but miss the author's hidden meaning. Inference questions require you to read between the lines, connecting 2 pieces of information that aren't directly linked by a comma or period. This skill is about making logical leaps based on textual evidence. Writing, over-reliance on simple sentence structures. Focus, grammatical range and complexity. The diagnosis reveals solid grammar but repetitive syntax. To boost your band score here, you need to move beyond subject-verb-object sentences. You must actively practice using dependent clauses and transitional phrases to build sophisticated sentence architecture. Speaking, pausing too frequently when searching for specific vocabulary. Focus, fluency versus lexical retrieval. The diagnosis shows you know the words, but your retrieval process significantly slows down your pace. Fluency isn't just about speaking fast, it's about minimizing those noticeable pauses where you are mentally scrambling for a word. This is often fixed through structured, timed conversation practice. Here are 3 reasons why this matters. Efficiency and time management. You stop wasting time on topics you already understand. Since your study hours are limited, targeting weak spots is the most efficient use of energy. It prevents burnout from reviewing material that is already solid. Build in confidence. Knowing your exact limitations reduces general test anxiety. When you approach a challenging skill with a concrete plan, for example, I need to improve my use of linking adverbs, the task feels manageable. This structured focus dramatically boosts confidence, creating an actionable plan. Diagnosis turns vague goals into measurable steps. A goal like, I want a better scores, is meaningless. A diagnosis, however, allows you to set micro goals, such as, in the next 2 weeks, I will write 5 paragraphs incorporating transitional phrases of contrast. This makes progress visible. Watch out for these 3 common mistakes. Don't say, assuming a single low score means you are fundamentally bad at the skill. Say, recognizing that one weak area simply indicates where targeted effort is needed. A poor performance on a single test day does not define your ability. It only defines your readiness on that particular day. Use the score as data, not as a permanent judgment of self-worth. Incorrect balance, studying every skill equally regardless of diagnostic results. Strategic focus, allocating 70% of your time to the weakest area and 30% to maintenance on strong areas. This is the core principle of efficiency. If the diagnosis shows speaking is your biggest hurdle, you must dedicate significantly more time there than in listening. Surface level fix, focusing only on the content gaps, e.g., missing vocabulary. Deep analysis, investigating the root cause. Is it poor memory, or is it a lack of exposure? Sometimes you don't know a word because you never encountered it in academic material. The fix isn't just memorizing. The fix is increasing your exposure to high-level, topic-specific discourse. Here are 4 ways to practice. Implement timed micro-practice sessions. Instead of full-length tests, dedicate 20 minutes solely to the single skill you flagged as weakest. Micro-sessions are less overwhelming and allow for intense focus on one specific mechanism. For instance, if your weakness is linking words and writing, only write 5 paragraphs focused only on integrating those structures. Curate resource pools. Build a dedicated folder of materials, academic articles, or TED Talks that specifically challenge the skills you identified as weak. Do not rely only on textbook exercises. Consume high-quality, authentic English content that forces your brain to engage with complex language structures and academic registers naturally. The feedback loop. After every practice session, document 3 things: what went well, what failed, and 1 specific technique to try next time. This step is crucial for self-correction. Never end a practice session without analyzing it. You must be your own most critical coach by noting exactly where you deviated from the optimal strategy. Integrate revision into daily life. Use targeted vocabulary and grammatical structures in your everyday English conversation or writing, even if it's just a journal entry. The ultimate goal is integration. If you diagnose a weakness in using conditional tenses, don't just practice them on paper. Try to use them actively when speaking with friends or family. Testing resilience isn't about eliminating stress. It's about building the ability to function effectively despite high levels of pressure. It means recognizing that anxiety is a normal physiological response, not necessarily a prediction of failure. Instead of fighting the feeling, we learn to use controlled breathing and refocusing techniques to manage it. Think of resilience as mental muscle strength. The more you practice these coping mechanisms in low-stakes environments, the stronger they become when it really matters. This preparation allows your true knowledge base to shine through. It's vital for students to understand that anxiety is a perceived threat, not an objective reality. When we reframe stress as excitement or focused energy, our bodies react differently, which can trick us into performing better. Remember that psychological preparation is just as critical as academic study time. Here are 4 examples. Instead of, "I hope I do well," try, "I am prepared to give my best effort." Shifting focus from outcome to process. Notice how the first phrase is passive and uncertain. The second statement puts you in an active role, which gives you a feeling of agency. This subtle shift changes your brain's internal conversation from worry to action. When stuck on a question, move on and come back later. Tactical self-regulation. The core mistake high achievers make is getting trapped by one difficult question. This technique teaches you to accept imperfection in the moment and prioritize moving forward, maintaining momentum. Visualizing success. Imagine walking out of the exam feeling calm and confident. Positive mental rehearsal. Visualization is a powerful tool because it primes your brain for the expected experience. Don't just picture getting an A, picture the feeling of finishing and being proud of your effort. Preemptive breathing, taking 3 slow breaths before starting any module. Physiological reset. This isn't just a nice tip, it physically impacts your nervous system. Deep, controlled exhalation activates the parasympathetic nervous system, which is responsible for calming you down. Here are 3 reasons why this matters. The fight-or-flight mechanism. High stress triggers adrenaline, preparing you for immediate physical danger. Our bodies are wired to react to predators, not multiple-choice questions. When we mistake a test for a life threat, the resulting cortisol spike actually narrows our focus and impairs higher cognitive functions. Cognitive load theory. Anxious thoughts consume working memory that should be used for problem solving. Think of your brain's working memory like a limited amount of RAM on a computer. If you are spending processing power worrying about failing, you literally have less memories left to solve the actual problems. The Yerkes-Dodson law. Performance improves with moderate arousal but declines sharply with excessive stress. This law explains that there is an optimal level of excitement. We want to be energized, but we must avoid the point where anxiety completely overtakes focus. Watch out for these 3 common mistakes. Thinking in extremes, I must get a perfect score to be okay. Setting realistic metrics, my goal is to perform my absolute best, given the circumstances. Perfectionism often masks itself as high standards, but it's actually a form of self-sabotage. It sets an impossible bar that guarantees disappointment when reality falls short. Emotional linkage. If I don't know the answer immediately, I am failing. Separating knowledge from self-worth, it is acceptable to pause and acknowledge what I do not know right now. We must learn that a blank answer does not equate to a flawed identity. Our value as individuals is entirely separate from our performance on any single test. Catastrophizing, I need this score to define my entire future. Perspective taking, this score is just one data point in the incredibly complex picture of my life. When we catastrophize, our minds jump to the worst possible outcome. By forcing ourselves to see this test as just one data point, we regain perspective and reduce the emotional stakes. Here are 4 ways to practice. Simulate stressful conditions. Take practice tests in timed, uncomfortable settings to normalize the pressure. Don't just do a practice test, make it feel like the real thing. Sit somewhere you usually study, use limited breaks, and simulate the time constraints. This desensitization is key. Establish a pre-game routine. A consistent routine like light exercise or meditation the night before helps calm the nervous system. Routines are anchors for our minds. By performing the same calming actions consistently, you signal to your brain that even on test day, a predictable sense of safety is available. The 5-minute wind down. Before bed and before the test, avoid intense study sessions. Focus instead on relaxation. Your brain needs time to consolidate memories, which happens during rest. Cramming right up until bedtime often leads to burnout rather than retention. Post-test self-compassion. After the exam, regardless of how you think you did, acknowledge your effort and give yourself a reward. The recovery phase is often overlooked. By showing self-compassion immediately after, you teach your mind that even if performance was imperfect, it was safe and acceptable. Reaching a Band 5 generally means you can communicate your meaning effectively enough for the task. You are understood, even if the language is simple or hesitant. However, Band 7 and above require something more than just clarity. They demand sophistication. It's about depth of thought, structural complexity, and natural fluency. Essentially, we are moving from merely communicating an idea to building a compelling argument. It's critical to understand that the examiner isn't looking for perfect grammar in every single sentence. Instead, they are evaluating your ability to manage complex ideas under timed pressure. Think of it less as a test of vocabulary and more as a demonstration of intellectual maturity. Here are 5 examples. It is important to remember that Band 5 transition phrase. This phrasing works, but it's very common and repetitive. To elevate this, try using a more sophisticated connective phrase that shows contrast or addition. Furthermore, data suggests that Band 7 plus transition phrase. Using academic signal phrases like this immediately raises your register. It shows you are integrating formal research or evidence into your argument flow. This problem is bad because simplistic causal link. Avoid overly simple causal language. Instead of saying something is bad, explain why it presents a detriment or obstacle to progress. A key factor contributing to this is advanced causal link. This phrase allows you to introduce complex causality. It signals that the underlying cause is multifaceted and worth detailed discussion. Consequently, policymakers should consider reforms. Strong conclusion recommendation. A Band 7 plus response doesn't just summarize, it offers concrete, actionable recommendations. Using consequently links your evidence directly to a proposed solution. Here are 3 reasons why this matters. Conceptual depth. Moving beyond surface-level descriptions to analyzing underlying causes. A Band 5 might list symptoms, but a high-scoring response explains the pathology. You must show that you can handle abstract ideas like globalization or systemic inequality. Cohesive mastery. Using linking words naturally so the text flows seamlessly from one idea to the next. Excellent cohesion isn't just about using however and therefore. It's about pronoun reference, thematic continuation, and ensuring every sentence feels organically connected to the preceding thought. Precision in register. Selecting vocabulary that is formal, objective, and appropriate for an academic audience. This means avoiding colloquialisms or overly emotional language. Your tone must remain detached and analytical, even when discussing highly charged topics. Watch out for these 3 common mistakes. Informal language and vague adjectives. This issue is a very big problem for the economy. Precise academic phrasing. This issue poses a significant challenge to economic stability. The key difference here is elevating simple adjectives like very bigs and vague nouns like problem. Always replace them with specific academic vocabulary. Passive voice and vague subjects. Many people agree that the government must do something. Academic nominalization. There is a prevailing consensus that governmental intervention is required. Instead of saying many people agree, use nominalizations like prevailing consensus. This immediately lends an air of formal, objective academic writing. Grammatical redundancy. The reason for this is because money is short. Concise, high-level vocabulary. This stems from a scarcity of capital. Watch out for common grammatical redundancy traps like the reason is because. Always opt for the most concise and sophisticated phrasing possible. Here are 4 ways to practice. The paraphrasing challenge. Take 5 complex sentences from academic articles and rewrite them 3 different ways without losing the core meaning. This exercise forces you to manipulate syntax and vocabulary simultaneously. It builds flexibility, which is crucial for high-scoring writing. Model analysis reading. Read Band 8+ essays or reports and actively highlight every transition phrase and advanced linking structure they use. Don't just read for content, read like a linguist. When you see a perfect link, analyze why it works as a contrast. Consequence? Condition. Topic: specific vocabulary banking. Instead of learning random words, build themed lists, e.g., environmental degradation, economic policy. Focusing vocabulary into thematic units ensures that when you write about a topic, your language sounds cohesive and highly specialized. The outline method. Before writing any piece, create a detailed outline focusing only on the logical connections between paragraphs and ideas. A strong outline guarantees structural coherence. If your argument flows logically from point A to B, the examiner will reward you with a higher score in organization. The IELTS test is a marathon, not a sprint. Effective time management means knowing exactly how much time to allocate to each of the 4 skills. For example, in the listening section, you must balance careful note-taking with anticipating potential distractions. In reading, don't spend too long on one difficult passage, move on and come back if necessary. The writing module requires pacing, enough time for planning, writing the body, and crucially, reviewing your grammar and cohesion. Even speaking needs timing. You must fill the allotted minutes without rambling or falling silent. By treating time as a resource you are actively managing, you greatly reduce stress and improve performance across all sections. Many students approach the test reactively, letting one difficult section dictate their pace for the rest of the exam. Think of timing not just as speed, but as strategic allocation. Learning to move efficiently between skills is key to maintaining cognitive energy throughout the full test duration. Here are 5 examples. Listening, active prediction. When the audio plays a gap-fill question, immediately predict the word type and length. Instead of just writing down what you hear, pause mentally and categorize the missing information, e.g., it's a measurement or a proper noun. Prediction is your superpower here. It forces your brain to listen for specific sounds rather than just processing general speech. If you know it needs a date format, your ear will be primed for numbers and slashes. Reading, skimming the main ideas. Spend the first 2 minutes skimming all passages to determine topic flow and structure. Do not get bogged down in details initially. Your goal is mapping the article's overall argument before tackling specific questions. Skimming helps you build a mental roadmap of the material. When you encounter a question, you know exactly where to look because you've already mapped out the text geography. Writing Task 1. Time boxing data analysis. Dedicate no more than 5 minutes to analyzing graphs and charts. Focus only on the highest highs and lowest lows. Do not list every single data point presented. Task achievement relies on selection, not exhaustive reporting. High scorers select only the most impactful trends and comparisons to keep their report concise and analytical. Writing Task 2. The outline rule. Spend exactly 10 minutes planning your essay structure before writing a single sentence. Your outline should detail topic sentences for every body paragraph and the conclusion's key takeaway. Planning prevents writing paralysis. By having a solid structural foundation, you can write with confidence, knowing that every subsequent sentence serves a clear purpose. Speaking, the buffer phrase. Start complex answers using flexible introductory phrases like, to address your point, or I would argue that. This buys you valuable thinking time while sounding natural and coherent. These buffer phrases are linguistic safety nets. They give your brain a microsecond pause to organize the next idea without the examiner noticing any hesitation, maintaining fluency. Let's compare 4 pairs. Spends too much time on one difficult reading passage. Reads quickly for main ideas and allocates equal time across all passages. Pacing mastery. A weak candidate gets stuck in the details, which drastically lowers their overall score. The strong candidate manages risk by moving on, knowing they can return to challenging material if time allows. Ushers through writing tasks due to anxiety. Practice is a strict 4-stage cycle: plan, draft, review grammar, polish cohesion, structured drafting. The difference here is methodical effort. Rushing often leads to grammatical errors and structural collapse. The high scorer controls their output through intentional review stages. Stop speaking mid-sentence when unsure of vocabulary. Use a circumlocution describing a word or concept using simpler, known vocabulary. Maintaining flow. Fluency is more important than perfect vocabulary. When you can't recall the exact word, describing it effectively keeps your speaking momentum going and impresses the examiner with adaptability. Reads instructions multiple times, wasting precious minutes. Pre-reading strategies: quickly scan all question types first to understand the testing format. Or active preparation. Don't waste time figuring out how you are going to be tested. Before starting any section, quickly reviewing the instructions helps your brain switch into test mode, conserving valuable seconds. Here are 3 reasons why this matters. Reduces cognitive load. When you manage time well, your brain doesn't waste energy worrying about running out of time. Worrying distracts you from the actual task. By being efficient with timing, you free up mental bandwidth that can be used to focus purely on complex language features or nuanced meaning. Ensures comprehensive coverage. It guarantees that all 4 skills are addressed proportionally and that no section is left incomplete. A high band score requires balance. If you perform perfectly in 3 sections but fail to finish the 4th due to poor pacing, your overall score will suffer significantly. Builds test stamina. Regular time-pressured practice trains you to maintain peak focus for extended periods. Taking a test is physically and mentally exhausting. By simulating time conditions repeatedly, you build the necessary stamina to perform at your best even when fatigued. Here are 4 ways to practice. The timed simulation drill. Take a full passage or listening test section and strictly time yourself. Count down the minutes to force maximum efficiency. Do this at home using only your phone timer. The goal is not perfection right now. The goal is simply building the habit of adhering to rigid time limits. The micro goals technique for writing. Break down writing tasks into segmented mini deadlines: 3 minutes for thesis, 7 minutes for body paragraph 1, etc. By setting these smaller targets, you make the intimidating task of writing a long essay feel manageable. Success in one micro goal builds momentum toward the next. Speed reading game. Find articles on topics you like and practice reading them aloud while strictly timing yourself to see if you can maintain speed without losing comprehension. This bridges your reading skills with your speaking stamina. It's a fantastic way to build the automaticity needed for fast, accurate output under pressure. The Zero Distraction Mock Test. Take at least 1 full past paper mock test in an environment where phones are off and you cannot take breaks. Treat it like exam day. Consistency is key to performance optimization. Simulating the real-life, uninterrupted pressure of the actual exam helps normalize the time constraints and build true confidence. Effective goal setting is much more than just wishing for a higher score. We need to make our goals highly specific and measurable. Think about applying the SMART framework: specific, measurable, achievable, relevant, and time-bound. Instead of simply saying, "I want to improve my IELTS score," we must operationalize that desire into clear academic targets. This detailed approach turns vague hopes into actionable plans, giving you a true roadmap for success. Remember that the goal isn't just getting a high band, it's about mastering specific skills. By making your goals measurable, you create checkpoints that allow you to track progress objectively. Don't confuse important with measurable. If you can't quantify the effort or the outcome, it's probably too vague. Here are 4 examples. Vague goal: I need to improve my speaking. Goal setting fail. This statement is too broad because it doesn't tell us how or what part of speaking needs work. Improvement could mean anything from pronunciation to vocabulary, so we lose focus immediately. Specific goal: I will use 3 new cohesive devices in every speaking part 2 response. Highly specific and measurable. This is excellent because it gives you a clear action and accountable metric. You know exactly what to listen for, practice, and count during your next mock test. Vague goal: I need to read more academic articles. Action lacking. While reading is great, simply saying more doesn't guide your practice. We need to link the activity to a specific IELTS skill requirement, like understanding complex arguments or identifying main ideas. Actionable goal: I will read 3 articles from The Economist this week and summarize the core argument for my writing task 2 practice. Integrated and time-bound. This goal is powerful because it integrates multiple skills: reading comprehension, summarizing, and writing. It connects a routine activity directly to an exam requirement. Here are 3 reasons why this matters. Provides direction and focus. A roadmap keeps you from wasting time on low-impact activities. When you have a defined target, every study session has a purpose. This structure helps eliminate drift, which is when studying feels busy but unproductive. You are moving toward a specific destination. Boosts motivation and momentum. Seeing small victories builds confidence more effectively than just aiming for the final score. Achieving micro goals, like mastering one complex grammar structure or scoring highly on a single writing task, provides immediate dopamine hits. This positive reinforcement is what sustains your motivation over months of study. Allows for targeted review. It forces you to identify and prioritize the areas that need the most attention. Goal setting naturally acts as a diagnostic tool. If your goal is high in vocabulary, but you keep failing practice speaking tests on idiomatic language, you know exactly where to focus your next week of effort. Your roadmap needs to be cyclical, not linear. We must allocate time and energy across all 4 skills: listening, reading, writing, and speaking, while also focusing on the systemic gaps we identified in our earlier diagnostic modules. Dedicate specific skill days rather than just vague study blocks. For example, one week might focus 60% of your effort on academic vocabulary acquisition, while another focuses intensely on essay structure and coherence. The most crucial element is reviewing and adjusting your goals every 2 weeks. Testing yourself against these revised targets ensures that the plan remains realistic as your proficiency grows. The biggest mistake students make is treating their roadmap like a rigid contract. Life happens, and sometimes you get stuck or bored. Treat it more like a flexible guided consensus between you and your goal. If one area feels too overwhelming, break it down into even smaller steps to make the load manageable. Here are 4 ways to practice. Start with a minimum viable goal. Identify the one single most impactful change you can make in the next 7 days. Don't try to fix everything at once. That leads to burnout. Instead, pick one small area like expanding your linking words or mastering a specific article type and commit fully to it for 1 week only. Implement goal check-ins. Reviewing your goals and progress weekly builds accountability. Set a time once a week, maybe Sunday evening, just to look at your roadmap. Ask yourself, did I meet my mini goal? If not, why? And what is the smallest adjustment we can make for next week? Gather resources strategically. Match resources directly to a current goal. Don't collect materials randomly. If your goal this month is improving academic register in writing, then every book or article you read should be analyzed through that specific lens. This prevents information overload and maximizes efficiency. Celebrate the process. Acknowledge effort and consistency, not just final scores. Remember that the journey itself is where the real learning happens. Taking time to genuinely appreciate how far you've come builds a powerful positive association with studying, which is crucial for long-term success. Advanced listening isn't just about hearing words, it's an active process of constructing meaning. It requires focused attention and the ability to predict what comes next based on context clues. Instead of passively receiving sound, you must engage critically with every segment of speech. These strategies include anticipating shifts in topic and monitoring for subtle changes in tone or emphasis. Remember that sometimes the most important information is conveyed through inference, not explicit statements. Think of listening as detective work, where you are gathering clues rather than just taking notes. When a speaker pauses, don't assume they finished their thought. Instead, use that moment to predict what logical points might follow. This predictive skill keeps your brain engaged and ready for complex information. You are about to hear a listening passage. Get ready to listen and take notes. The lecture today focused on the concept of cognitive load in professional learning environments. It's crucial that trainees aren't simply overloaded with theory, they need practical application immediately. We observed a significant discrepancy between self-reported knowledge and actual performance during simulations. Therefore, I recommend structuring modules to incorporate short, mandatory breakout sessions every 30 minutes. These breaks allow the brain time to consolidate recent information without losing momentum. Furthermore, using real-world case studies rather than abstract hypotheticals will greatly enhance comprehension and retention rates among participants. Question 1. What is the main problem identified regarding trainee learning? Pause the video now and try to answer before we reveal it. The correct answer is the discrepancy between self-reported knowledge and actual performance during simulations. This question tests your ability to pinpoint the central conflict. Often, advanced listening passages bury the key finding within descriptive language, so listen for contrasting ideas like discrepancies or however. Question 2. According to the speaker, what is the optimal break structure? Pause the video now and try to answer before we reveal it. The correct answer is short, mandatory breakout sessions every 30 minutes. This requires precise listening for specific numbers and recommendations. Don't just hear breaks, capture the timing recommendation because that is the core actionable data point. Question 3. What type of learning material does the speaker suggest using to improve comprehension? Pause the video now and try to answer before we reveal it. The correct answer is real-world case studies rather than abstract hypotheticals. This tests your ability to distinguish between general suggestions and specific recommendations. The phrase "rather than" is a major indicator that a contrast or preferred method is coming up. Here are 5 examples. It's crucial that means it is essential or vital. Use this when making a strong recommendation. When you hear crucial, the speaker is elevating the importance of the following statement. It signals that the information coming next is a core takeaway point for you to remember. Significant discrepancy. A notable difference or inconsistency between two things. This phrase is common in academic reports. It alerts you that the speaker is about to compare two variables that do not align perfectly, which is often where the main argument lies. Without losing momentum, maintaining pace or energy, continuing smoothly. This type of idiomatic phrase relates to process management. It helps you understand that the goal isn't just rest, but effective rest that keeps productivity high. Enhance comprehension, to improve or deepen understanding. Instead of simply saying help you understand, using enhanced signals a more formal academic context. This is vocabulary that will elevate your own speaking and writing. Abstract hypotheticals. Theoretical scenarios that are not based on reality. This phrase helped you categorize the type of example being given. If they contrast this with real-world case studies, you know exactly what kind of evidence is preferred. Listen again and fill in the missing words. It is crucial that trainees aren't simply blank with theory. They need practical application. Pause the video now and fill in the blank before we reveal the answer. The correct answer is overloaded. The verb overload here describes an excessive amount of input. When you hear a warning about too much information, training your ear to catch the root word will help you grasp the meaning quickly. A significant blank was observed between self-reported knowledge and actual performance. Pause the video now and fill in the blank before we reveal the answer. The correct answer is discrepancy. This noun is used for inconsistencies. If a passage mentions two things that don't match, pay close attention to nouns like gap, variance, or discrepancy. These breaks allow the brain time to blank recent information without losing momentum. Pause the video now and fill in the blank before we reveal the answer. The correct answer is consolidate. Consolidating means making something stronger or more stable. In learning, it refers to the process of moving short-term memories into longer-term storage. Using real-world case studies will greatly blank comprehension and retention rates. Pause the video now and fill in the blank before we reveal the answer. The correct answer is enhance. To enhance means to improve quality or value. This word is key for describing how a method improves the learning outcome, making it perfect for summarizing findings. Here are 4 ways to practice. Shadowing technique. Immediately repeat what you hear, mimicking pronunciation and rhythm. Shadowing is highly effective because it forces your mouth muscles to keep up with native speed. It bridges the gap between understanding speech and physically producing it. Targeted dictation. Listen for specific phrases or vocabulary, writing them down word for word. This technique builds auditory accuracy. Instead of transcribing everything, pick a challenging phrase like cognitive load and drill that one until it feels automatic. Pre-reading prediction. Skim the topic or article title before listening to guess key vocabulary. Never listen with zero context. By predicting the general theme, you prime your brain for related vocabulary and structures, making the actual input much easier to process. Summarizing in your head. After a paragraph, pause and internally summarize the main idea before moving on. This is pure active listening. It prevents mental drift where you hear words but don't connect them logically. You are constantly self-testing your comprehension. Now it is your turn to practice. Read or listen to the following passage carefully. Effective communication in a professional setting requires more than just grammatical correctness. It demands clarity and conciseness. When drafting emails or presenting data, always assume your audience is time-poor and highly intelligent. Therefore, the opening lines must immediately state the purpose of your message. Avoid unnecessary jargon unless you are certain everyone understands it. Furthermore, structure complex ideas using bullet points and clear headings to guide the reader's eye. Remember that brevity does not equal simplicity. True professionalism means conveying depth in the fewest possible words. Question 1. What is emphasized as being required for professional communication? Pause the video now and write your answer before we reveal it. The correct answer is clarity and conciseness, beyond just grammatical correctness. This question helps you shift focus from a single skill, like grammar, to the overall quality of the interaction. Listen for contrast words like more than or beyond. Question 2. What is the most important action when starting an email or presentation? Pause the video now and write your answer before we reveal it. The correct answer is immediately stating the purpose of the message. This tests your ability to identify a crucial, actionable piece of advice. The phrase must immediately state signals this non-negotiable requirement for professional writing. Academic lectures are designed not just to test your comprehension, but also your critical thinking. A distractor is any piece of information presented in the lecture that sounds plausible or even true on its own, but which ultimately contradicts or fails to fully address the core question being asked. Identifying these false answers requires you to listen for implication rather than simply listening the key words. You must determine if the speaker's full intent supports the initial idea you picked up on. This process moves beyond simple note-taking and into active cognitive filtering. Think of a distractor as an excellent decoy. It looks real, but it's designed to throw you off course. Your goal isn't just to capture every word. Your objective is to track the main argument thread. Always keep asking yourself, is this the most important point the speaker wants me to remember? Here are 5 examples. Listen for keyword overload, the too specifics trap. If a speaker uses highly technical or very specific vocabulary to describe an example, take caution. Sometimes they use excessive detail simply to make the point sound authoritative, even if that detail is irrelevant to the main academic conclusion. The generality of the concept usually outweighs the specificity of the supporting fact. Track speaker pivots and transitions. The change point. Speakers rarely stick to one idea. Pay close attention to transitional phrases like however, on the other hand, or what is more important. These markers signal that the speaker is explicitly correcting or refining a previous, possibly misleading, statement. Watch for qualifiers and caveats. The limitation clause. A qualifier limits the scope of an idea. Phrases such as, in most cases, under certain conditions, or generally speaking, are massive clues. They tell you that what was just said is not a universal academic truth, but rather an exception. Identify negation and correction. Direct reversal. The clearest signal of a distractor is direct negation. If the speaker says something and then immediately follows it up with no, wait, or actually, that's incorrect, you must treat the second statement as the definitive answer. Filter for main idea versus supporting detail. Focus priority. Every lecture has a central thesis or core message. When you hear supporting details like names, dates, or secondary examples, mentally assign them a lower priority unless they are explicitly stated as crucial evidence for the main point. The highest level of listening comprehension involves tracking context shifts. This means recognizing when a speaker changes their frame of reference, moving from discussing history to methodology or from causality to consequence. When you detect this shift, mentally pause and re-evaluate the premises they just established. A common distractor is the historical anecdote. While interesting, it might only serve as an illustration of a concept, not the core academic principle itself. Therefore, always ask, does this specific example change the general rule being discussed? If the answer is no, treat that detail as secondary information. Successful listeners don't just follow the path, they map the entire intellectual landscape the speaker draws for them. When you hear a pivot, it's not just a topic change, it's usually an opportunity to clarify the most important takeaway point. Let's compare 4 pairs. General anecdote, example. Core academic principle, rule. The difference between illustration and law. An anecdote is a single story that happened once, while the academic principle is the tested theory that applies universally. Always be skeptical of singular examples. They rarely represent the full scope of human knowledge or scientific law. Immediate description, what? Underlying implication, why? Focusing on cause versus effect. Sometimes a lecturer describes what happened, but the core answer you need relates to why it happened or how it impacts a broader system. Always listen for the causal relationship that links the action to the academic theory. Strong assertions, declarative. Qualified statements, hypothetical. The certainty level. When a speaker uses definitive language, they are making a strong claim. However, the most accurate academic answers often come from qualified statements that acknowledge complexity or multiple variables at play. High-frequency vocabulary. Content relevance idea. Don't over-index on specific words. It is tempting to believe that if you hear a word repeatedly, it must be the answer. Instead, focus your energy on tracking the concept or idea that surrounds that word. The idea itself carries more weight than the specialized terminology used. Here are 4 ways to practice. Pre-lecture setup. Predict the scope. Before listening, identify 3 key terms or questions you expect to be covered. This directs your focus. Preparing this way doesn't guarantee answers, but it primes your brain to listen for specific relationships between those concepts. If a distractor appears that doesn't connect back to one of your anticipated themes, dismiss it immediately. Active note, taking track relationships. Instead of writing full sentences, use symbols like TOS for causality and CAST for contrast. This system forces you to process the logical structure of the argument as it is spoken. If a speaker contradicts themselves, your symbol tracking will make that reversal visually obvious. Post-lecture review, map the thesis. Immediately write out the main thesis in one single sentence, using only your own words. This step forces you to synthesize all the information and discard the minor details. If you cannot create a clear, overarching thesis statement, it means you may have been misled by too many distractors. Mock practice. Transcribe for shifts. Find academic podcasts or lectures and transcribe them specifically, marking every time the speaker changes direction. This structured practice helps you build muscle memory for identifying transitions. You are training your ear to hear the linguistic signals that accompany a shift in thought.